Mr. President, council members, and participants, we are now live.
Thank you very much, and good morning to everyone. We're going to get started now. We had a few technical difficulties, but I understand that they have all been corrected. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings and can also be found on phl.com. Now note that the hour has come. Mr. McDermott, will you please call a roll to take attendance? Members that are in attendance will please indicate that they are present or whatever they may say choose to make sure that their image is displayed on the screen. Mr. McDermott, please call a roll.
Councilmember Bass.
Good morning. I am present. Thank you very much.
Good morning.
Councilmember Brooks.
Good morning. I'm present.
Good morning.
Councilmember Dom.
Good morning, Council President, colleagues, and administration.
Morning.
Councilmember Gautier.
Good morning, Council President and colleagues in Philadelphia. Present.
Good morning.
Councilmember Gilmore Richardson.
Good morning, Council President. Good morning, colleagues. Good morning to the tech team, and good morning, Philadelphia.
Good morning.
Councilmember Green.
Good morning, Modesto, and all those who brought the teams together. It's a pleasure to be here with my colleagues and the City of Philadelphia.
Good morning, Council.
Councilmember Gim.
Good morning, Council President. Good morning, colleagues. I am present.
Good morning, Council.
Councilmember Heenan.
Good morning, Council President. Good morning, colleagues. I am present.
Good morning.
Councilmember Johnson. Councilmember Jones.
Good morning, Mr. President. Good morning, colleagues. It is good for us to be together.
Good morning.
Councilmember O'Neill. Councilmember O.
Good morning, Council President. Good morning, colleagues. I'm present.
Good morning.
Councilmember Parker. Councilmember Quinones Sanchez. Councilmember Squilla.
Good morning, Council President and colleagues. Present.
Good morning.
And Councilmember Thomas.
Good morning, Council President. Good morning, colleagues. I'm present.
Good morning. We have established quorum, so we're going to get started. This is the public hearing on the Committee of the Whole regarding bills number 210-320, 210-321, 210-322, 210-323, 210-324, and resolution number 210-336. Mr. McDermott, please read the titles of the bills and resolution.
Bill number 210-320, an ordinance to adopt a capital program for the 6 fiscal years 2022 to 2027 inclusive. Bill number 210-321, an ordinance to adopt a fiscal year 22 capital budget. Bill number 210-322, an ordinance adopting the operating budget for fiscal year 22. Bill number 210-323, an ordinance amending Chapter 192600 of the Philadelphia Code entitled Business Income and Receipts Taxes by revising certain tax rates under certain terms and conditions. Bill number 210-324, an ordinance amending Chapter 191500 of the Philadelphia Code entitled Wage and Net Profits Taxes by revising certain tax rates under certain terms and conditions. And resolution number 210-336, resolution providing for the approval by the Council of the City of Philadelphia of a revised 5-year financial plan for the City of Philadelphia covering fiscal years 2022 through 2026 and incorporating proposed changes with respect to the fiscal year 2022, which is to be submitted by the mayor to the Pennsylvania Intergovernmental Cooperation Authority pursuant to the Intergovernmental Cooperation Agreement authorized by an ordinance of this council approved by the mayor on January 3rd, 1992 by and between the city and the authority.
Thank you, Mr. McDermott. Today, we continue the public hearing of the Committee of the Whole to consider the bills read by the clerk that constitute proposed operating and capital spending measures for fiscal 2022, a capital program, and a forward-looking capital plan for fiscal year 2022. through fiscal year 2027. Before we begin to hear testimony from the witnesses we have today, everyone who has been invited to the meeting to testify should be aware that the public hearing is being recorded, and because the hearing is public, participants and viewers have no reasonable expectation of privacy. So by continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature available on Microsoft Teams to allow the members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this particular purpose. Today, we will hear testimony from Health and Human Services and the Office of Children and Families, as well as public testimony this afternoon. Mr. McDermott, can you please read the first name of our list of witnesses?
Dr. Thomas Farley, Public Health.
Thank you. And good morning, Dr. Farley. To state your name for the record, please proceed with your testimony.
Good morning, council members. Give me 1 second to get my testimony up here. Good morning, President Clark and members of the City Council. I'm Dr. Thomas Farley, Health Commissioner for Philadelphia. I'm pleased to provide testimony on the Department of Public Health's Fiscal Year 2022 operating budget. The FY2022 budget general fund request for the Department of Public Health is $162,489,196. The past year has tested the Department of Public Health as it has never been tested before. The COVID-19 pandemic is a once-in-a-century health crisis that we have responded to by providing healthcare system support, testing, contact tracing, isolation and quarantine services, vaccinations, data, information, policies, guidance, and communications of all sorts. Nearly the entire Department of Public Health has contributed to that response in one way or another. As I've said to the council before, we have lost many lives to this pandemic, but I believe that through our efforts, we have also saved many lives. Unfortunately, the virus is not finished with Philadelphia. We have made enormous progress in our battle against COVID-19. We'll have to continue that battle through FY22. This will include work on containment, vaccination, guidance, and communications, but the work will undoubtedly change as the epidemic evolves. In particular, I expect that we will be vaccinating children, perhaps offering booster shots that are for those already vaccinated, offering more rapid testing, and revising our contact tracing efforts. The virus is unpredictable. It has surprised us before and is likely to surprise us again. To respond quickly to changes in the local epidemic, we will maintain data collection, analysis, and reporting. Fortunately, we receive federal grants for most of this work and will not require city general funds for it. In addition to our work in COVID-19, we will continue our other important work in public health, including providing high-quality primary medical care in our 8 health centers, combating drug overdoses, smoking, and other risk factors underlying the leading causes of death other than COVID-19, creating a healthier environment, and promoting the health of women and young children. In addition, at the request of the City Council, we will develop a health equity plan that describes, to our best understanding, the factors underlying racial disparities in health, recommends approaches that can be taken by government and the private sector to narrow those health disparities. Thank you for your continued support and consideration of this request. I'm happy to take any questions.
Thank you very much, Dr. Farley. So I'm going to get right to probably one of the most significant topics that we've been discussing, unfortunately, over the last year or so. Vaccinations. I want to say that it's been good working with you and the team as we kind of got focused on expanding opportunities out in communities. Been pretty successful based on the fact that we have now reached a plateau to some degree. Surprised at the fact that people can literally walk in without waiting and get a vaccine. And that's a good thing in one sense, but I think it's a bad thing in the sense that we have so many people still have not gotten vaccinated. So Doc, can you kind of tell us, just from your perspective, and we've all heard people's take on it, what your take is on the plateauing and the decline of vaccinations and what we possibly can do because we still have way too many people that are not vaccinated?
Yeah, thank you, Council President. So we peaked with the number that I'm tracking is the number of total doses of vaccine administered per week. We peaked about 125,000 per week. And since it's dropped off, and as of the week before last, we were down about 80,000. So that is substantially lower than it was before. But it is still an awful lot of vaccines that we are delivering, so that there's still a lot of activity going on. If you look at the numbers on our website, you see that we've done pretty well as far as vaccinating people over the age of 65. Not too bad people 45 to 64, but we are lagging in the people who are 20 to 44. And I would interpret this drop-off to mean that we've reached the people who are eager to be vaccinated, who are seeking out vaccination. Now we're in a fairly large fraction of the population that is maybe ambivalent, maybe a little bit reluctant, or simply have many other things on their mind. And so they are not seeking it out, but there are many of them we think will be vaccinated if we make it easy for them. And I think our work then is to make it as easy as possible, and then to encourage people as much as possible. So making it easy as possible means more smaller clinics, more distributed in neighborhoods. When I say clinics, that I include in that like pharmacies and regular medical clinics that offer vaccine, as well as the specialized clinics that we run. And then encouraging people as much as possible about how important this is. I think we can make a lot of progress in that, but it's going to be probably months when we're in this mode. At some point, we'll run up against people who are just adamant that they won't be vaccinated, but we're a ways away from running up to that problem yet.
Yeah, I just saw a graphic, I guess yesterday, consistently the people that are experiencing vaccine hesitancy, that number is going down because those people are actually being convinced to get vaccinated. But there's this 20% of people, it's like they were gauging various months, the last 4 months, and it's around 19-20% consistent. They're never going to get vaccinated. In your mind, if those people make a determination that they're just not going to get vaccinated, do you think in the city, and I know because borders, the virus doesn't recognize borders, like the city of Philadelphia versus Montgomery County, but do you think in the city of Philadelphia that we will reach some level of herd immunity, that we can feel confident to start opening up much more of our economy and all the other things that we'd like to do in the city if we don't ever get those 20% of people?
Yeah, if we got 80% of people vaccinated, and include in that children, now children are not eligible yet, but they will be in the future, that'll be enough to substantially reduce the risk in the community. It won't drop it to zero. The virus will still be here in small pockets. If in addition to that, we have a high percentage of elderly people who are vaccinated, then for those where the virus is still spread, at least it doesn't kill people, then we're in very good shape. And then I think that, we can allow the large majority activities to start as they were before. I think it's too early to say whether we're going to be able to achieve those. So I think we need to be cautious in our predictions right now, do the best we can with vaccination, and watch the numbers as we go.
Okay. You referenced, my last question, you referenced children. The issue with respect to children, I know we have to wait till the CDC makes a determination in terms of how low we're going to go. I think Pfizer is looking at going as low as 12. What's the plan as it relates to the school district and the vaccine strategy for the city of Philadelphia and getting children vaccinated? Are we far along on that?
So the Pfizer vaccine will probably be approved for children down to age 12 as early as next week or maybe even this week. And so we will be using a variety of providers to deliver that vaccine. So pretty much any provider that's delivering vaccine to adults can deliver vaccine down to age 12. The problem we're running into, and that we will consistently run into around schools, is that you need to have parental consent for vaccination. And so in schools, and typically the parents aren't there, and obtaining consent from parents is, for any sort of process in schools, is extremely difficult. You end up getting a very small percentage of those consent forms returned. So we're mainly going to have to rely on these other sorts of providers to vaccinate children. So we have those existing providers. We are also in the process of enrolling pediatric providers, pediatricians, so that parents can also just take their child to wherever they get their pediatric care.
Okay. And I know I just said this is my last question, but this is really my last question. Pop-up clinics. Are we looking at that in any degree? Just to try to.
Yes, absolutely. We are not only looking at it, but we are doing it. We're doing a number of pop-up clinics every week, and we have a whole process where we have a group of folks that look at requests for pop-up clinics and determine what organization might be able to do it. Some cases it's the fire department that are running those. Some cases it's the health department. Some cases they're referred to, say, pharmacies or other providers. And I think, those smaller clinics where there's a pocket of folks who need to be vaccinated is, more where we're going to be moving to in the future.
Okay, thank you. All right, that was really my last question. I want to recognize Councilwoman Bass.
Thank you, Mr. President. I have a couple of questions to start out with. And the first is, Commissioner, the citizens of Philadelphia, and number one, I want to thank you for the work that you're doing, because no one ever saw COVID coming. No one ever saw a pandemic. And I think that, in some ways we did the best that we could, given all of the circumstances. But in other ways, I think that the citizens of Philadelphia still do not have closure on exactly what happened with Philly fighting COVID. And I think that we need to give them some closure in terms of what happened, how this group was allowed to sort of waltz in and move to the front of the line in terms of being distributors, with their lack of access, their lack of experience, and just knowledge and know-how around, medical practices. And at the same time, there were medical practices, we heard from some of them during a hearing we had earlier this year, who had been turned away. And these are very well-established medical practices in often underserved neighborhoods, particularly African-American, African, Caribbean, Asian, Hispanic neighborhoods that are on the ground every day doing the work day in and day out, that were sort of moved to the side. And I really need for you to talk about that a bit, because, as I said, the citizens really still have no closure on exactly what happened here. We as members of council don't have closure. And I think that there's a lot of concern, and there's still a lot of conversation about how did this happen?
Yeah, thank you, Council Member. Well, that, as you know, the question about how that organization was chosen as a partner was the subject of an independent investigation by the Inspector General, and he has issued a report on that to explain something about how it happened, and also we responded with changes to our process. The organization, as you know, was initially given a contract for testing. They were then chosen as a partner for vaccination at a time when we were very much in a hurry to get vaccination started. I've said before that was a mistake, and I say that again today. We have put in place procedures and processes to be more careful about our partnership, including a broader committee to look at requests for proposals for funding for vaccination that include broad representation and minority representation and representation of the city council. And so nothing is going to absolutely prevent the fact that we would never make another mistake, but I do think we put in place some good safeguards for the future. And I think at this point we have a good overall program as far as our vaccination delivery.
I think that we've improved, but I don't think that we've really given answers to the tax-paying citizens of Philadelphia in terms of what happened here and how do we avoid it from happening again. Because this very much looked like a hookup. I've said it before, I'm going to say it again. And in a city where people feel like it's not what you know, but it's who you know. We don't want this to be something that the citizens of Philadelphia feel can happen. It never should have happened before. And I know that you already know this and you've worked on it. But again, I just don't feel that there has been any closure or explanation in terms of who ushered them to the front of the line. So I'm just going to be on record for that. I just want to state that because at the same time that we were given access to people who were inexperienced, as they self-describe themselves as young or 22-year-old college students, but meanwhile we have medical professionals with decades of experience who were set to the side while people in those communities were heavily affected by COVID. I also wanted to ask about, as we talk about vaccines and distribution, about more vaccines in the district, as the numbers of people who have shown up at the clinics, particularly in Center City at the Convention Center and some of the other sites downtown. There's a lot of people in the neighborhoods who are not going downtown. And so I think that, to really reach those populations, moving into the neighborhoods, moving into where the people are and connecting with them, even going door to door. I had a great conversation with a pastor from my district, Bishop Avenger from Greater St. Matthew Baptist Church. We talked this weekend about going door to door in some neighborhoods with medical professionals, because that's really the level of intense effort that's going to be required to get people to get vaccinated at this point. Some people are just, for a lot of different reasons, people aren't going to go downtown. They don't feel welcome. They're, transportation. They don't want to be on the bus. They don't feel safe on the subway. Like a whole lot of reasons. But people don't want to go into Center City. We need to make more and more permanent locations in the neighborhoods.
Yes, council member, I agree. The site at the convention center served a very important purpose. There were many people who were eager to go there and vaccinated many people, but there were many people who, for a variety of reasons, didn't go there and would not go there. And so we do want to have more sites available, distributed across the city. We are having more sites that we are enrolling. We're now up to 282 different providers across the city. That number increases each week. And that includes hospitals, it includes clinics, it includes pharmacies, it includes the sites that the city is running, and then some of these pop-up sites we talked about earlier. You'll continue to hear more about those. And in addition to that, we are doing increasing outreach to publicize those sites and to make it easier for people or encourage people to use those sites. So we are doing canvassing in neighborhoods. We'll be doing more of that in the future. We're doing phone calling, phone banking, including robocalls that some of that you guys have participated in that I think has been very valuable. It's going to be a lot of work at a very local neighborhood level for a long time, and we're absolutely working on that.
Commissioner, I'm surprised to hear you say that there's 200 providers that we're partnered with. I did not know that. Can you give us a list of who those 200 providers are, when they're operating? Are they permanent providers for right now? Some providers. So, for example, we were at Simon Gratz, I think, for a total of 6 weeks, 3 weeks for the first dose, 6 weeks, 3 weeks for the second dose. And so that was a provider arrangement that we had made, but it was only really for about a 6 week period. So what do we have that's happening, that's ongoing, that's permanent? Can you give us a list of what those locations are?
So at first it's 282 provider sites. In some cases, it's an organization that has multiple sites. And we can give you a list, but we can do better than that. Very soon, there will be a vaccine finder webpage.
I want the finder. I want the list.
Excuse me? It'd be a webpage where you can go in there and you can see all the different providers, their locations, and then information about each one on the web, on the map. In the same way that we have that information for testing right now. So there are many sites. Some of those sites are like Gratz. There may be 1 day a week, but some of them are open every day. Each one is different, and so there's information about that. But we will send you a list. Council member, if you're speaking, I can't hear you.
Councilwoman
I sure
Bass?
was. I'm sorry.
Okay.
I do apologize. I sure was. I was saying, I appreciate the work that you all have done, and we know that, listen, we stumbled coming out of the gate. I do think that we have somewhat recovered. But I'll come back to my second round of questions. But I think that the vaccine distribution in the district is just critical. So I'll come back, Mr. President, if you could put me down for the next round, the second round. Thank you.
Thank you, Councilwoman. Chair recognizes Councilman Jones.
Thank you, Mr. President, and thank you, Doctor. I think I should emphasize that we all make mistakes, and we're usually remembered more by our mistakes than our successes. But I want to thank you and your team for, in a dark time during the early phases of COVID, we had close to a dozen institutions, Belmont Hospital, Simpson House, Inglis House, Hayes Manor, Bala, all of who were afraid because there was no playbook to pick how to deal with and address this pandemic. In fact, we weren't ready for it. And so we began to meet up in the Winfield Heights area, and you were kind enough to lend your staff to those meetings with those institutions. It came out that PPEs were in shortage, and some of the workers, the people who changed the bedpans, did not have masks, did not have gowns. And immediately, the next day, you were able to scrounge and pull together PPEs for people taking care of our most vulnerable, our senior citizens. So I want to publicly put on the record to thank you for that. Secondly, the Aardvark, which is a mobile testing unit, has gone and been a part of a lot of the events we've done in the 4th District, whether it was testing or being a part of a joint effort to administer vaccines. And at this point, I want to recognize our president, our majority leader, and our deputy whip for working with the administration to make sure that the 4th District had over a dozen such events, not just with the fire department, but with private drugstores and the like. So those are good successes that we had. We're now going into another phase where we're dealing with vaccine hesitant people. So to agree with my colleague, Member Bass, we have to go hand-to-hand combat. It's time that we do door knocking, but it's also, like we have been, engaging some of the churches to make sure that the sick and shut-in lists get visits from vaccine providers. Because if you're sick and shut in, you're not going to the convention center. How have we engaged the fire department and other agencies like the visiting nurses who do door-to-door to enter this phase of vaccination?
Thank you, Council Member. Yeah, you mentioned the Aardvark, and that is, for those who don't know, it's a mobile truck that can provide testing, and it increasingly is now providing vaccination as well. There will be a second Aardvark that we're going to be deploying soon, and they'll be doing mobile vaccinations. And the fire department will also be doing more mobile vaccinations, maybe out of tents. But getting to your question about the homebound, we know that that's one of the sort of the last mile issues is people who are just unable to get out of their home to be vaccinated. So we are working with several organizations that can deliver those vaccines in people's homes. One of them was visiting nurses. Another is the fire department. They're EMS workers that already go into people's homes. They can deliver that service. Another is Penn Medicine has a home health service that has been doing a lot of that, and we've been giving them vaccine for that. And I believe Jefferson likewise has that. We are increasingly coordinating that, and we'll soon be putting up publicizing a mechanism where people can send us names of people who are homebound and have not been reached by those existing mechanisms, and then we will divvy those out to the different providers so that everybody, so nobody's overlooked who needs to be vaccinated. So we are going to get there, and it's going to take us a while, but we got the mechanisms in place.
So you may deploy canvassing teams in underserved neighborhoods to knock on doors to encourage vaccinations right on the spot?
Yes, so that we're working with Philly Counts, which has been canvassing in neighborhoods for the census, as you know, and they are building up their infrastructure now to be canvassing in neighborhoods. They won't deliver the vaccine, but they'll be delivering the message about where people can get the vaccine.
So my final part of this round will be, I know it's difficult while you are putting out fires to determine the causes of those fires, but there will be a time when we get on the other side of this pandemic where we're going to want to hear about lessons learned. And whether it is not having to go outside the borders of the United States or Pennsylvania for PPEs and gowns so that we have a steady supply in the next crisis, but whether or not we can get them manufactured by Philadelphia firms, I need to know that you're making notes so that when we get past this, we can sit down and say, we're never going to make that mistake again. And so lessons learned in a document will be something I would be interested in. Are you keeping track of those kinds of, we're not going to do that over again, points of impact?
And when we do emergency responses, typically we do an after-action report. And we've done, I believe, after-action reports for specific elements of this response, but we've not done a big after-action report because we're still in the middle of the action. But yes, we need to do that. And to your point, there was a pandemic influenza plan at the national level, state level, and local level before all this happened. And it was, but there were issues like PPE availability, which we don't control here in the city of Philadelphia, but was a national issue. And just with competing priorities, this idea that there may be some pandemic that we might have someday always got pushed to the bottom of the priority list. And so the idea of, well, we need to have PPE manufacturers in the United States who are not dependent on other countries, that never rose to the top of the agenda. And so we were caught. I think in the wake of that, there's going to be lessons learned at the national and the state and the local level that'll change that for future pandemics. We will be part of that conversation.
And finally, for my business community from Market Street to Manayunk, when are we going to lift restrictions so they can get back to full occupancy?
So, everyone wants to know that, and I would love to be able to give people that answer because of, with certainty of where we're going to go with this virus. But again, the virus continues to surprise us. As of February, I thought our case rates were going to continue to fall and we were going to be sort of smooth sailing until the summer. And then I was surprised by this epidemic wave that occurred in March and April. I'm hoping now that we may be on the final downside of this, but I can't guarantee it. There's enough unvaccinated people now where I still think we're vulnerable to an epidemic wave. So I would say we're going to need to watch our vaccination rates, see how high we get, and watch our case rates, see how low they get. When I see those numbers moving further, I'm being in a better position to predict, because I would hate to say, okay, we'll be able to open up everything in July, and then it turns out that there's a summer wave, and we can't do it in July, and then everyone will feel that I've led them astray. So I'm hopeful that we have a much better summer than we've had in spring, but I can't predict it yet.
Thank you, Mr. President.
Thank you, Councilman. Just for the record, for members who wish to ask questions, because of the condensed nature of the budget hearings and the restructuring of some departments within the administration, in this particular budget process, Dr. Farley is the lead individual testifying. But if you have questions for behavioral health or homeless services and some of the other departments that fall under the jurisdiction of somebody, please feel free to ask questions of all those particular entities. This one I say for the record, it's a little different this year than we're used to. So, Chair recognizes Councilman Green.
Thank you, Council President. Good morning, Dr. Farley. Just have a couple questions. In the beginning of the budget hearing process this week, the administration testified that they are committed to growing Black and brown wealth in the city of Philadelphia. as part of the administration, do you also follow that charge?
Yes. Yes, we do.
Okay. So I just, and what's the total size of your budget from all dollars?
I have to get back. We have 160 million in general fund. I don't have all the grant dollars in my mind, but another probably a couple $100 million.
About close to almost, I think it's close to almost $1 billion, give or take. I'm not sure it gets up to $1 billion. It's in the hundreds of millions. I'm sorry, I don't have that number for you. Let's say 750 million, just to move. We can agree to that number. So on page 21 of your budget testimony, you broke down the MWBE contracts on the general fund side, and I think the largest one was about 1.8 million on the general fund side. And so for general fund, you said about 160 million.
Yes.
Okay. And so the largest contract of that 160 million, about $1.8 million. And so what are your percentage goals for MWBEs for both the general fund and the grants revenue?
Well, let me say first that the vast majority of our contractual dollars go to nonprofit organizations. And so what is captured under MWBE is just a small percentage of those that go to for-profit companies. And sorry, I don't have the explicit target for us. I think, let me pull up the number there.
And as you're pulling it up, maybe you can give some perspective of the contracts that you provide to nonprofits. What percentage of those nonprofits are led by a majority African American or woman-led organization or board? I'm sorry.
I apologize. It can take me a second to pull up. Do you know what page on the overall testimony that this is?
Page 21 had the breakdown of the general fund contracts for MWBE, and those would be for profit. But let's shift away, since you said that's a small part of your budget, to the much larger part. And we said 750 million. Of that 750 million that go to nonprofits, as well as some government entities, what percentage go to minority-controlled or woman-controlled nonprofit organizations?
I don't think that there's a specific number there, because we have the board representation of the largest contracts here. So, Fairmont Long-Term Care, PMHCC, et cetera. And many of those have either minority board or strong representation of minorities in the board, but I don't think there's a specific number for tracking the percentage of.
Well, I mean, many of those nonprofits I'm familiar with, having served before I joined this body as counsel to the chair of the Public Health and Human Services Committee. So many of those nonprofit organizations do have people of color and women on their board, but I would not say those are majority female or minority-led organizations. And if we're going to be committed to wealth in the Black and brown communities, those nonprofit organizations are more likely to look in a diverse way to who their providers are, which could be attorneys, accountants, and other type of professionals that will help to grow Black wealth. That's something I think that as a city we should be looking at, because historically we have not done that. Let me move forward to some other questions. In reference to children, I think Council President and you also talked about some challenges in identifying children and getting vaccinated. I know FDA just recently said that Pfizer is going to be able to getting through a protocol to allow younger children to be vaccinated. A number of parents looking for their children to be vaccinated as we try to return to school, especially by the fall. And you said, I want to make sure I understand, what steps are we taking to get an understanding of the hesitancy for children to get vaccinated? I know we don't have all the information right now, but that will be coming in the months ahead. But how are we preparing to get a sense of how children can be vaccinated in the city of Philadelphia?
First, just to clarify, so children down to age 12 will probably be eligible very soon, as in a week or so. And the children down to age 2 will probably be eligible sometime in the fall. So there's going to be a period of time before that they become eligible.
No, I'm sorry, I was focused on age 12, because that's what I made reference to Pfizer, so thank you for correcting the record.
We don't have data yet or experience yet on how much hesitancy we're going to have in the 12 to 15-year-olds. We, our focus right now is making it be as accessible as possible. As with adults, we expect that there'll be some eager people right off the bat that will cause us a surge in demand. But then we're going to have to work with parents for those who are more reluctant.
Right. So it's interesting because I know there was when you talk about reluctance, it's interesting you would say that last year at this time there was a reluctance of the health department to even engage in a testing contract with Dr. Eli Stanford and Black Doctors COVID-19 Consortium. But now my understanding they're reaching out to those who've already been vaccinated to see if they have children to get a sense of whether they're interested in getting their children vaccinated. So that way they can prepare for August and early September to possibly vaccinate children to make sure that we can get as many children vaccinated who are 12 and above. So has there been any conversations to kind of learn from kind of the very creative and prospective ways that Dr. Stanford is looking at in trying to prepare to at least vaccinate the children of those who've already been vaccinated? Yeah,
so my staff is in regular contact with Dr. Stanford. I talk to her periodically. I have not had that conversation with her myself. I wouldn't be surprised if my staff may have had that conversation with her. I do think we're going to have to take steps to make it available for children through many providers. The Black Doctors COVID Consortium has done great work, and we hope that they are interested, and I believe that they are interested in vaccinating children. That's great. We'll have to have other providers as well.
In one of our weekly intergovernmental calls, I asked you in reference to events going forward and how do we tell those organizations that plan years in advance for a conference well before COVID-19 came, and how do we provide guidance for them? As a board member of the Convention and Visitors Bureau, I know that they work very closely with your office to make sure that the Northeast qualifier employment occurred, and we're now getting some information how that occurred. But the concern I have is that we have a convention, a Shriners Convention, that's going to bring 10,000 people to the city of Philadelphia in August. There's also another large Northeast Products Expo coming in September. It's going to bring another 20,000. And considering that the pandemic has been a health calamity, but also an economic crisis, what steps are we taking to let those planners know that we're going to be open when we see other cities like New York, who have said they're going to be open by July 1, other cities, and I'm assuming that the health professionals from those cities went to similar medical schools like yourself and have a similar public health background. How are we giving guidance to those entities when we need to try to bring our economy back as quickly as possible?
So we are having conversations with the Convention and Visitors Bureau. As you know, we had this volleyball convention that came up, a couple of months ago, and we are engaged very specifically in coming up with safety guidelines for the Shriners Convention. And we said that we will be developing more general guidelines for future conventions. The Shriners one was brought to us with fairly short notice, but we did give them guidance, and we're engaged in back and forth on that issue right now. We do want the conventions to come back. We also want them to be safe. I should say that the publicity around New York and New Jersey was that they're going to be fully open as of May 19th. But actually, if you look closely to what they're saying when they be fully open is.
Dr. Fowler, I said July 1, from my understanding. I didn't say May 19th. I'm sorry.
Okay. Yeah. Mayor De Blasio said that New York City would be fully open on July 1, but he actually doesn't control that. That's really been controlled at the governor's level. Mm-hmm. And what they're saying now is their restrictions are pretty similar to what the restrictions are in Philadelphia right now. We want the conventions to be here. We want to project out in the future. We do have to grapple with this issue of uncertainty. But we will try to give guidance in a way so they can still plan and they can still come here with that uncertainty.
And just one quick question, because I know my time is wrapped up. Yesterday I was on call with Governor Wolf through our Capitol Conference for the Pennsylvania Municipal League, and he made that statement, like we also saw reported, about the Commonwealth reopening by Memorial Day. And based on what you're saying, that's not fully up to the governor, that's also up to the health secretary. Do you see a time where you may revisit the perspective of giving guidance earlier for both citizens and businesses for an earlier reopening?
I'm not sure I fully understand the question. I'm sorry. What will I revisit?
Do you see a time where you could possibly give guidance to citizens and businesses in the city of Philadelphia of a time period for an earlier reopening, as opposed to a not sure when we'll fully reopen.
Yeah, I do think at some point we can do that. I want to see our vaccination rates get higher and some evidence that that vaccination rate is really reducing spread of the virus and protecting people who are most vulnerable. And I'd like to see what this epidemic wave does. You know, I know people are feeling wanting to just put the epidemic behind us, but I do need to point out that according to CDC's criteria, we are at the highest risk right now of any state in the country. 60 people die over the course of a week. We're still in a pretty tough epidemic wave right now. And so I'm very hopeful for the future, but we're not there yet.
Okay. Thank you, Council President. Thank you, Dr. Farley.
Thank you, Councilman. Chair recognizes Councilwoman Gimm.
Thank you very much, Council President. Dr. Farley, I think, there's no question this year has been the most challenging imaginable. But, there has been, to some extent, a real important thing that the pandemic has underscored, which is the importance of government in times of public emergency and public crisis. We are the largest American city without a fully public health system, for example. I think the impact has been significant. It's been harder for us to reach communities when we privatize and use contractors. We obviously had the PFC fiasco and disaster. That was a national embarrassment. But we also struggled to reach many other communities with pharmacies serving and hospitals serving a lot of people who were outside of Philadelphia. And despite stated goals on our priorities in reaching communities and families in need, we actually didn't really have the means to do that. And so if there's one thing I think the pandemic underscored, it's the importance of how the both the pandemic and perhaps the American Rescue Plan money needs to be used to shore up government capacity, because we will face things like this again. The possibility of the variants being with us, the fact that it may be very difficult, if not impossible, for the U.S. ever to reach herd immunity. We can't see this as a one-off. In other words, we have to ensure that we are better equipped to handle emergencies than we were before. To that point, one of my questions is around why the Department of Health in particular, and then I'm going to have a series of questions for DBH, why the Department of Health chooses to do so much outside contracting. It is, for one thing, it's important that long-term contracts should be coming before City Council, and so year after year, 1 year extensions with an option to renew feels like a little bit of a workaround that requires us to have more of a handle. But, you do use a lot of contracts and a lot of outsourcing to PMHCC, PHMC, rather than hiring city employees to actually shore up our physical capacity to be able to respond better and to reach out to communities in need and to have a much more stable, unified, mission-informed kind of focus to handling the pandemic. Why does your agency in particular decide not to hire city employees to do work like contact tracing, like much more outreach? And what analysis have you done to inform this decision?
So first, let me just say, as far as the overall response, much of the response has been done by the healthcare system. And the healthcare system in this country, we're not the United Kingdom, it's not a government-run healthcare system, it's a patchwork of different sorts of providers, hospitals and clinics and pharmacies, each run by a different organization. And so we adapt to that patchwork, and we've had to work hard to have that patchwork deliver, say, vaccinations as well as possible. But to get to your specific question, as far as contact tracing and the things that we had to stand up over the past few months, there was and still is incredible time pressure for us to move very, very quickly. Very, very quickly around testing, very, very quickly around contact tracing, very, very quickly around vaccination. Hiring city employees to do this takes a long time. That is just a fact of the process. It's a long-time process. We would still be trying to hire people for contact tracing if we were going to do that with all city staff. Right. I should also point out that the contact tracing...
Yeah, could I just clarify? You could very easily hire employees that are exempt from civil service. Why don't you pursue that route? If knowing what the emergency was, because the consequence to this was not so much yes, there was a demand for speed, but we did not meet people's demands. I mean, we operated from get-go for this pandemic from a scarcity model, a scarcity mindset. Vaccinations are scarce. We don't have enough people. We can't reach out. Instead of what we needed to do, which was an information, education, outreach model that then builds people's understanding as we work through scarcity to the point where we are now. And where we are now, because we operated from scarcity, is an absolute refusal, reluctance, distrust of the system. So, you know, I understand that you're using civil service as an excuse because it's too cumbersome. Why didn't you hire employees that are exempt from civil service?
I would have to get some HR people involved. I don't think that we would have been allowed to hire 150 or 200 civil service exempt positions, maybe at all, but certainly not very quickly. And, you know, we had to build up quickly the contact tracing staff. They may not continue a year from now. We may find that with variants, the contact tracing as a process doesn't work very well. And so as a short-term emergency response, that was the most expeditious way to do it.
Okay. Well, we're not in a short-term emergency response. We're now in a much more long-term one. I do want to put on the record that I'll come back to this, but we do want to take a look at the contracting out, particularly for the long term. We need a chance to shore up our capacity. If we want control, if we want to center Black and Brown communities, if we want to prioritize the health and care and well-being of Black and Brown communities, especially young people and youth who are largely separated from large systems of care, privatized, healthcare systems, we're going to have to do something differently. My other question is for Dr. Bowen. Prior to the pandemic, Dr. Bowen, I think you and I discussed this, but I spent 6 months working with the Justice Collaborative on a national effort to separate mental health emergencies from law enforcement agencies, which are untrained in this field. And I want to thank you, Dr. Bowen, for the work you've done at DBH to build out a new mobile crisis response team for mental health emergencies that may not require or even benefit from law enforcement response. Clearly, what happened with Walter Wallace last fall is top of mind for all of us on City Council and within the city. And ensuring that Walter Wallace's death will not be a tragedy, but actually a catalyst to transform policing responses and mental health responses is our primary responsibility. Can you talk a little bit about the new effort around mobile crisis units that's being proposed within the mayor's budget? How many mobile crisis units are we providing, and how soon do we expect them to expand? And I see this as being very separate from what the police department is doing around the co-responder model.
Okay, thank you very much. Good morning. We're still in the morning. Good morning. I'm Dr. Jill Bowen, Commissioner for DBH IDS, and appreciate the time with Council today. And I want to thank Council for the work over this past year in discussing, especially in this past 6 months, in discussing the opportunity to transform the system and to shift from police-only responses to a continuum which includes what we're talking about in response to your question, which is the development of the mobile crisis teams. Those are community crisis teams that do not involve police. That is designed to shift calls that go into 911 or calls directly from the community to have a community response. And that includes a behavioral health professional, it includes a nurse, and it includes a person or a family member of lived experience on that team. Based on the data that we have, spending a good amount of time embedded at the 911 call center, we know approximately how many calls we expect to shift, how many calls come into 911 currently that are primarily behavioral health calls that do not require police intervention or support. And based on that, we are looking at 4 full-time citywide 24/7 mobile teams. That is what is proposed in the budget. That budget includes the funding to expand our current capacity. We currently have 1 team that reaches out across the whole city and a part-time team we can very quickly, with your support on the budget, expand the consortium team to a full-time 24/7 team. And we are prepared by June, very early in June, maybe even June 1st, to put an RFP up for 2 new 24/7 teams. They would be regionalized so that they maintain some focus on a community-specific area, get to know the communities and the neighborhoods as much as possible, and to be able to respond quickly. It's very important that we understand this to be a significant transformational culture shift from police-only responses to a real presence of a community response teams, community mobile teams. And so along with that ask includes the expansion of the Philadelphia crisis line, and a tremendous amount of work goes on there already. We have expanded volume coming into the Philadelphia crisis line. They have capacity to dispatch the mobile teams, but also to respond in real time to the calls that come in. And because DBHIDS has a whole full continuum, there are other appropriate responses that they can initiate to support someone without a police response. So we look forward to very much look forward to developing the mobile teams and to evaluating their efficacy, which will inform us of what perhaps else or more needs to be done in the future.
Okay, and I'll have more questions later, but just for purposes of people who are watching, could you let people know what is the phone number for the mobile crisis, for the Philadelphia crisis line? And as well, I think we have a goal ultimately of getting to a 3-digit phone number for that. But for right now, could you just tell the public what the phone number is for the Philadelphia crisis line?
And I really appreciate the opportunity to say it. We say it a lot. It's 215-685-6440. Please also feel free to go to dbhids.org/boost, where you will see a whole array of information, including around trauma, and those phone numbers to know, places to go, and that will also help for any questions that people might have about resources and understanding some of the challenges we've been facing from the behavioral health front.
Thank you very much. Thank you, Council President.
Thank you, Councilwoman. I think the chair recognizes Councilwoman Brooks. Councilwoman Brooks. Okay. Councilwoman Brooks, one last time. We'll come back. I know a number of us are having technology issues today. We'll come back and Councilwoman Brooks. Chair recognizes Councilwoman Gauthier.
Thank you, Council President. My questions are for Dr. Farley.
Please proceed.
Okay. Sorry. Good morning, Dr. Farley.
Good morning.
I wanted to start off by saying thank you for the work of you and your team throughout the pandemic. Your department was tasked with leading the city's response to a global pandemic, the likes of which people alive have never witnessed in their lifetimes. And despite the challenge that proved, your team has shown up day in and day out throughout the trauma and the sadness of rising case rates and death rates and the disparate impact of COVID on our communities of color. And, all year it's felt like we've been on this roller coaster experiencing optimism, every time a surge went down and we had positive news about the development of vaccines, but also this consistent uncertainty about the true trajectory of the pandemic. So I wanted to commend you for your effort and determination, and I know that you and your team will continue to work as hard as you can to save lives and help us all get back back to normal. My questions today are about gun violence. Gun violence has been a public health crisis in Philadelphia for decades. In 2020 and this year in 2021, the gun violence has surged to levels that were once thought to be unimaginable. As a society and at all levels of government, we have consistently treated gun violence as a problem that requires mostly enforcement rather than a public health approach. But now, nationally, we are slowly starting to change our approach, as shown by President Biden's plans to provide meaningful funding for gun violence prevention and intervention. And the CDC is even funding gun violence for the first time in 25 years. I want to note that the Philadelphia Public Health Department has been ahead of the CDC in the federal government with the support of this city council under the leadership of our council president, Councilmember Jones and Councilmember Johnson, as well as Dr. Bedegal and Dr. Abaya in the injury prevention unit, who have been carrying out important gun violence prevention work for the health department. For the record, can you describe what a public health approach to the gun violence crisis looks like, and why it is important for us to take this approach as a city?
Thank you very much, Council Member, for your comments and for your interest in gun violence, which is indeed a public health problem. It's very tough, particularly on young African American and Hispanic men in the city. It's a major cause of death. A public health approach, when I say that, what I mean is you look at the phenomenon, that this problem, and you think about all different potential approaches, and you try to understand as much as possible what leads to that problem. And you look at all different potential approaches for prevention, put them in place to the extent you can, and then evaluate what works, and then continue that process. So in general, with public health problems, whether it's a virus or it's a car crash or cancer or gun violence, you think about the impact of the person involved, then there's the agent, in this case the gun, and also the environment. And so with gun violence, that usually occurs in a setting. There's a neighborhood, a specific location, there's a gun, and there are people involved. And there are opportunities for prevention with each of those. Opportunities for prevention with people, with guns, with the environment. And so I think we should look at all of those opportunities for prevention. Some of those we are working on trying to take advantage of now, but some of them, if we understand the phenomenon better, we may realize we've overlooked some, and we don't want to overlook anything given the magnitude of this problem.
Thank you so much, Dr. Farley. For the record, I hear an echo. If my colleague
may I have a point of information?
Sure, Council Member.
Hold on. Chair recognizes Councilman Johnson. Chair recognizes Councilman Johnson.
Yes, thank you, Council President.
Councilman Johnson.
Is that better, Council President?
Yes. Recognize Councilman Johnson
just for
information.
Yes, just for the record, Commissioner Farley, just for the record, just want to ask, and this just clarifying Councilwoman Jamie Gardier's question. In 2018, didn't the city of Philadelphia declare gun violence a public health emergency?
Yes, it did. At least that's
and since that time, what strategies have been put in place to address gun violence as a public health emergency since we officially declared it in 2018 to date?
So that a few things were put in place with the roadmap plan that was put in place in 2018. One is the work of the Office of Violence Prevention. That's a prevention effort and dealing with people who are at risk, identifying people who are at risk for either being a victim or a perpetrator of gun violence and trying to get them on a safer path. It also established the office that Council Member Gautier just mentioned, our injury prevention office, where we are doing case reviews of fatal shootings and non-fatal shootings to try to better understand what all the opportunities for prevention are, to see if there are any that are overlooked. And it created the injury prevention dashboard, which we now have so that everybody has a better understanding of the problem and its phenomenon. And as one of the outgrowths of that also was the city's participation in the lawsuit against the state that would, if successful, give the city permission to put in place policies that could protect our young people from guns. So there's much more work to be done. Public health solution doesn't promise short-term results, but I do think that we are starting to use that lens with the work since then.
Thank you. Thank you, Council.
Thank you. And just continuing on with that line of questioning from Councilmember Johnson, you can get back to me with this figure later if you don't have it, but can you share with us how much the health department spends on gun violence prevention work?
I don't have an exact number now, but it is fairly small. It's a new program, our injury prevention unit. It didn't exist before. It was established in after 2018. I forget the exact year. And so it's probably less than $250,000.
Okay. Can you expound on the gun violence injury prevention work of Dr. Abaya and Dr. Bedigol? What do they do, and how is their work used to influence policy around preventing gun violence?
So that the one key initiative is this it's homicide and non-fatal shooting review team. That's a group where we get a very large number of people and organizations around the table and review in depth individual shootings or fatal or non-fatal shootings to understand, based upon records and other information you could gather, everything that led up to that. And then the group discusses, okay, what are opportunities we might have had to prevent not just this one, but other shootings like this. And then that leads to specific action steps that may be taken by law enforcement, may be taken by the Office of Violence Prevention, may be taken by other organizations around the table. This is a model that is used in hospitals to see where you have a death and you try to figure, okay, how might we prevent a death in this patient? And that's a model that is very valuable. Then there's the injury prevention dashboard. Again, that's the data that makes it so that everybody understands the overall pattern of gun violence. Rather than seeing this as a one-person issue, there's a pattern to it, and the more we understand the patterns, the more prevention we have. And then there are communications around that to inform people better, so that everyone can make data and evidence-based decisions around prevention. And then there's the policy-based work, as I mentioned earlier, that led to that lawsuit. And we are engaged with coalitions at the state level around other policy changes that could help.
And then lastly, I would love to expand the work of the injury prevention unit's gun violence prevention efforts. Do you see any opportunities for expansion, and what would that look like? And how would that help us?
I think there's always more that can be done. In particular, I think that there may be more data available that we could bring to bear. A public health approach really depends upon plumbing all the sources of data you have to understand things in a quantitative as well as qualitative way. So that's data, acquiring that data, analyzing that data, putting out summaries of that so that everyone can understand what the prevention opportunities are, and making recommendations to a variety of bodies and how they can take those opportunities for prevention. I do think that we could do more of that.
And then I think this is really important for the record. Just one last thing. Dr. Farley, what do you see as your particular leadership role in helping the city of Philadelphia to alleviate gun violence? Can you describe that? What role you are playing as the leader of the health department?
I think it is, public health strategy is where I think we offer that's unique, in which the same sort of strategy you can use to prevent car crashes or cancer or heart disease can be applied to this public health problem of gun violence. And we can't do anything on our own. The work is largely done by others, but we can provide a different perspective and information and recommendations that can have an impact over the long term. And so it's our role really working with all the other different players and just bringing that different perspective and understanding of how to use data to identify prevention opportunities.
Thank you so much. I am grateful that health is more at the table on this issue, and I look forward to there being even more of an integration and into your work expanding in this area. Thanks.
Thank you for your commitment and your support.
Thank you, Councilwoman. Chair recognizes Councilman Don.
Good morning, Council President. Thank you. And good morning, Dr. Farley. And thank you for all you've been doing and your team. I have 6 or 7 questions if you could just provide very concise answers, that'd be great. First one is, what is the current amount of surplus doses we currently have in the city?
I can't give you an exact number. I can tell you in general that with the drop-off in demand in the last couple of weeks, that we do have surplus doses. There's more doses available than people that are going into people's arms.
Is it 50,000, 100,000, 200,000?
It is, well, we're getting probably 80,000 doses coming in per week. And we were delivering at one point 120,000, but the most recent week is we may be at 60,000, so you can get a rough sense. It's in the tens of thousands.
We have over 100,000 right now?
And it depends on what you're talking about. The total number of doses that are in freezers, that's a higher number than the doses that coming in each week that are not going into people's arms.
So we have right now, we have plenty of doses right now.
We have plenty of doses. No shortage of doses in the city right now.
And have you figured out how many doses we as a city will have to deliver between now and July 4th, when President Biden has set for the 70% of the adult population to be vaccinated? Do we have that number what we have to deliver?
I can give you that number, and but I don't have it on the top of my head. I can tell you that the limiting factor is going to be finding places where people are willing to go to be vaccinated. It's the demand is the limiting factor right now.
And last week, did you mention that 80,000 doses occurred, and was that for all city residents?
That is delivered by all Philadelphia-based providers. Some of those would have gone to non-Philadelphia residents, but also some Philadelphia residents would have been vaccinated outside of the city.
Any idea how many of those 80,000 went to Philadelphians?
Probably about 80%.
Okay. And then the other question I have is, are we going to be able to meet President Biden's deadline by July 4th of 70% in the city?
I think it's a good target. I can't guarantee we're going to be able to reach it. It really does depend on demand.
And in the American Rescue Plan, how much money will the department be receiving for speeding up vaccine distribution?
We have received approximately $15 million for building out our vaccination infrastructure and outreach.
Is that also can be used for speeding up this distribution so we can get up to that herd immunity number?
Yes, it can be used, and there are there's other federal funds that we can use and we are using to build out our provider network. As you know, there's a request for proposals, and there are organizations that are funded to provide vaccination.
Is it possible for you to provide to this council a plan of how we're going to deploy these funds in the next 60 days to meet President Biden's 70% July 4th goal?
Yes.
Okay. And then the last question, thank you for these answers. The last question is, I'm looking all over the country and I see New York's opening in 2 weeks, Boston's opening in 5 weeks. I think New Jersey said May 19th. I think Governor Wolf said at the end of May, Memorial Day. Chicago said July 1st. Is there some sort of date that you would feel comfortable that we can at least tell people what's going on?
So first is to clarify, that again, there was a publicity around New York and New Jersey opening, but if you look quite closely, what they're opening to is very much close to where we are right now. So that's not fully opening. They will have additional steps that they have not yet laid out or put a deadline to. We can provide, well, I've always been reluctant to predict out a couple of months in the future because it's been so difficult to predict. And as recently as a couple of weeks ago, our case rates were rising. Now the case rates are falling and vaccination rates are increasing. We will try to give more predictability because we know that the business wants that. but it's always going to have to be with a certain caveat that if the virus surprises us, a new variant arises, whatever, that we may have to change course.
I think that would be okay because you have hotels trying to do conventions and bring people here. You have people trying to get married with events, and they have no idea like when that date will occur. So even if you could provide those dates and give some sort of caveats, at least they'd have some direction.
Yes.
Anyway, thank you very much. Keep up the good work, and thank you, Council President.
Thank you, Council Member.
Thank you, Councilman. I think Councilwoman Brooks is back. Chair recognizes Councilwoman Brooks.
Thank you so much, Council President. My questions are for Dr. Bowen. I'm going to continue the questions similar to Councilmember Gim. Does the department have preliminary information on how many units you anticipate it to take to have robust coverage of these mobile crisis units across the city?
Yes. Based on data, we need 4 providers, and it would be 24/7, so each provider would have multiple teams. So we're talking about covering all shifts, 7 days a week. So you're talking about at least 4 teams, maybe 5 teams per provider in order to cover, round the clock, 7 days a week. That's based on the number of calls that are currently coming into the PCL line, the Philadelphia Crisis Line, and comparing that to the number we anticipate coming in as we intentionally make this shift. And that's based on the data, what capacity we need. That's why we want to go from 1.5 teams to 4 full-time 24/7 teams. Now, whether there will be gaps once we have it stood up is a question, but based on the data and what our capacity needs are, we are looking for 4 full-time providers to operate multiple teams each to cover 24/7 across the city.
Thank you, Dr. Bowen. My next question is, I have some questions around a co-responder model that's being proposed by the administration to be piloted FY2022. Under this model, a mental health professional is paired with law enforcement when responding to calls. We have been hearing some alarming concerns about the co-responder model, including a widespread fear amongst clinicians about the presence of law enforcement and their commitment to the lives of people with disabilities during a mental health emergency. What concerns have you heard from social workers and advocates who've worked on emergency mental health responses about the co-response model?
So we've heard a whole range of responses that really run the gamut from really wanting a response that includes co-response to wanting no police involvement at all in any of the responses. I think for the most part, there's consensus that reducing police involvement across the board, there's consensus there. There's also some consensus in having the presence of people with lived experience on the teams and also providing follow-up. So there's a certain amount of consensus, but as we talk about this major shift from police-only responses and looking at a continuum, for the most part, there are those who say, let's just go with the community-only response. But for the most part, we get, as long as you have a community-only response, then having the co-response as well, instead of a one approach only, having multiple approaches, given the real range of challenges and issues that present themselves. There seems to be acceptance that that can make sense. I think that whenever you do a kind of culture shift like this, there's going to be folks who are in favor of different types of models. But this model seems to be the one for Philadelphia right now that will allow us to make this shift successfully. The whole point of embedding behavioral health folks into 911 is to really understand what kinds of calls were coming in, and it was based on that work that some of the calls came in that could be responded to, that would have been responded to just by police. So those calls that have a co-response are police calls that have the support of behavioral health. And we're getting some early indications that the early in the field trials are having some effect. So we're seeing we're getting some information back currently that the de-escalation, the time that is being taken to understand what the issues are that someone is struggling with on the ground, is resulting in less trauma for the individual who is in distress already. So that might mean they take the time to take more time to talk to the person, to find out what the history is, the behavioral health history is, to find out whether they'd be willing to engage in treatment, as opposed to immediately saying that has to happen without their consent. So there's a whole range of possibilities that can happen. Now, for behavioral health, our focus is building the community mental health response, the community mobile response. But that interim place where we're supporting the police and the Office of Criminal Justice in having some behavioral health supports seems to have some merit. There are some cities who are doing that. There are some cities that are doing both. There are some cities that are doing only the mobile. I think ultimately we will need to be making the shift and assessing where it's effective. And then I think we will be in a position to have a kind of conversation like this, which is very passionate. People care incredibly deeply about what this model will look like. But on a whole, the feedback that we've been getting is that having more than one option has merit, as long as one of those options is a non-police involved response.
So my follow-up of that, currently the administration is proposing spending $6 million on the police co-responder pilot program. $6 million seems like an expensive pilot program for the police department when the citywide mobile crisis units are severely underfunded and have been proven to work. Why has the administration decided to fund the pilot co-responder program rather than, or in addition to, fully funding the alternative response?
So I think I might ask Dr. Wright, who's a little bit closer to the work that's happening, and keep in mind that that particular budget, except for the embeddeds, are through the Office of Criminal Justice, and so some of those questions might better be directed there. But Dr. Wright may be able to help you understand the thinking and the work that is happening with the behavioral health component of the co-response support. And I have him here with me today. So Dr. Wright, do you want to try to explain that from our perspective, from the behavioral health perspective?
Sure. Thank you, Dr. Bowen. Thank you, Council President. Thank you, Council Member Brooks. As Dr. Bowen alluded to, is a transitional community response, but it's important because citizens have been trained, if you will. They've been educated. They've been raised to call 911, right? And so as we transition to the new number that Council Member Gim referred to, what we really need to do is be able to respond to all calls that community members make if they continue to use that number as we go through the transition. And so we've had a 12-year, almost a 13-year relationship with providing crisis intervention training to police. And so that is a natural segue to continue that training, de-escalation techniques, having trainers that come in and talk about the impact of individuals that may be on the autism spectrum, individuals that may have intellectual disability, and the whole gamut that includes behavioral health and includes mental illness potentially. And so partnering with police at this point as we transition to a community facing and a community response, having multiple options makes a lot of sense. It has worked in other cities. And because of our training and relationship with police over time, it makes sense to input that as we move toward a community-only response. And as Dr. Bowen indicated, as we continue to learn and as we continue to see what types of calls come through, it is very possible that we will be able to answer more of these questions in terms of even adding more to the mobile side and maybe looking at how we would work with police in a different way. But right now, we're getting good indication that police are benefiting from the training. The community is benefiting from having well-trained police. Again, we just started this program, so we have a lot of learning to do. But I think it's in addition to and not either or. And so I think both and is where we are right now.
I think that's right. And if I can just take a moment to thank you, Councilmember Brooks and Councilmembers Gim and Gautier, for introducing us to the social worker collaborative that you have been working with. It's really important that we have those voices in these early days of such a dramatic shift for this city. And some of those folks have been invited to join our advisory committee, and I think we're going to be needing to watch very closely, evaluate very carefully, and assess as we go forward. But this is really a dramatic shift that we expect will make a big difference in the trauma that people are experiencing when they're already in distress. Anything that diverts from an arrest, anything that diverts from an unnecessary visit to an emergency room or a crisis response center, anything that brings calm and support is those are the kinds of things we're looking for when we look at outcomes and we look at outputs.
Dr. Bowen, just to be clear, that DBH will not be receiving this $6 million to fund the co-responder model. This money is going to the police department. Am I correct?
That money is going to the Office of Criminal Justice. I don't think it's going directly to the police department at all. There's about $800,000 or $900,000 of it that is going to the Department of Behavioral Health, and that is specifically to embed a 24/7 behavioral health navigators at the 911 call center. As you know, behavioral health has been very active with our partners in developing a script that helps call takers to determine whether there is behavioral health challenges, whether there are safety challenges, and how to make the best decisions about how to categorize and therefore make decisions about dispatch. When this is, assuming we get this funding and we are able to embed, we're talking about 11 staff members who would be there 24/7 and be able to support and respond to the things that come into the 911 call, the kinds of issues that come in that don't fall quickly or easily into the script. So they're there to consult and help and guide. And then with the PCL line expansion, refer those calls right out of 911 appropriately for the mobile response.
So you'll get $800,000 for that, and the rest of the $5.2 million or whatever will go through the Office of Criminal Justice and then over to the police budget to fund this co-responder.
No, I don't think this has anything to do with the police budget. It has to do with the behavioral health providers that are engaging the individuals in the co-response process. So, which is managed, it's overseen by behavioral health, if not funded by behavioral health. But those again are mental health professionals, and there's a team of outreach specialists that is part of that includes a person or a family member with lived experience that follows up after the co-response visit to make sure that the connections are made and that the individuals who had been in crisis are experiencing the supports they need, and that the connections and linkages to care have been done, and see what else continues to be needed. So the funding goes to a good deal of that goes to the behavioral health provider that is overseeing that portion of the co-response effort.
Thank you, Dr. Bowen. I'll have more questions on my second round.
Thank you, Councilwoman. Chair recognizes Councilman Squilla.
Thank you, Council President. I think Councilmember Johnson wanted to just jump ahead of me because he had a runoff, if he's available.
Thank you, Councilman Squilla. And I'll be real quick and brief with my questions. I just want to follow up on the questioning that my colleague, Councilwoman Jamie Gardier, addressed in regards to Commissioner Farley and the gun violence strategy here in the city of Philadelphia. And so I'll just be brief. And I also want to thank you, Commissioner Farley, just for the work you have been doing as relates to COVID-19, the testing, the vaccinations coming out into my community, and helping doing outreach. And so you described the Health Department's role in violence prevention as advising on strategy and gathering and analyzing relevant data. To what extent has the Health Department been involved in drafting the updated roadmap to safer communities?
So Dr. Ruth Abaya has been a participant in that process along with other organizations, other city units, I should say.
Okay. And also, and so from your perspective, how often are you participating in briefings as the head lead health commissioner here in the city of Philadelphia if we declared gun violence a public health emergency in 2018?
How often, and I'm sure I understand it.
How often have you participated in briefings, right, with the administration, meaning the Office of Violence Prevention, the Managing Director's Office, as the lead health commissioner around the issue of violence prevention and gun violence since we declared gun violence a public health emergency?
Right, so I was involved in early going when the original roadmap plan was established, and there had plenty of meetings at that time. And since we hired Dr. Abaya, and since COVID has taken over much of my time, Dr. Abaya has been the representative of the health department in most of those meetings since then.
Okay. All right. She's doing a great job. I'm just trying to get some clarity, just for the record. And I know you and I have met before, just around this issue of gun violence, and just want to get an idea on how we are approaching this in terms of moving forward, because we're dealing with we're dealing with a pandemic and an epidemic of gun violence. And so if we are truly approaching this from a public health standpoint, just making sure that we're strategizing and partnering and communicating all of our key agencies together around this particular issue. Isn't it true that the health department has historically convened healthcare institutions to lead a coordinated response to major public crises, such as we're doing right now with COVID-19?
The health department does coordinate the healthcare systems for COVID-19, and the healthcare systems, I believe, are involved in the death review process, the homicide and shooting death review process.
Thank you very much. So given that precedent, would it be appropriate for the health department to do the same for violence prevention? Like, for example, when I've talked to your staff about coordinating hospital-based violence intervention programs for Philadelphia hospitals, because a lot of times we have retaliating shootings, right? One hospital isn't talking to the other hospital as it relates to the trauma that the family members are dealing with, as well as the victims and the survivors of gun violence. And so just want to get an idea of how the health department will play a major role in leading such an effort, again, if we're addressing gun violence as a public health emergency.
Yeah, thank you. So, I mean, one of the things that has come out of our analysis so far in this review process is that a very large fraction of people who have been shot or been killed have visited a hospital emergency department in the past, which means that there are opportunities for when people come into the emergency department for a shooting or an injury and they're surviving it, for us to work with them to try to prevent a subsequent fatal shooting. Dr. Abaya, as you probably know, is very closely linked with that program that's at CHOP. And so I think that there is value for doing more of that work, and we would be happy to play some role in helping to coordinate it.
Oh, thank you very much. And then last but not least, and this is a program that's very near and dear to me. Actually, you introduced me to the program, and that's the program that Dr. Rich runs at the Drexel Center for Nonviolence and Social Justice, where I think it's the Healing Hurt People program, where individuals who have been victims of gun violence They get their lives together, and they're actually becoming case managers and community outreach workers to help other individuals who have been victims of gun violence. Are we looking to partner with such a program and taking that program to scale? I know we had preliminary conversations about this maybe 2 years ago before the pandemic, but how can we take this program to scale? And also, have we looked at doing a media campaign around gun violence as a public health emergency? I know we had one in the beginning. About 2 years ago, me and you discussed, it says, don't shoot, now what? What's the status, and how can we partner and take that program to scale from a public health standpoint?
Yeah, so the Healing Hurt People program that's run by Dr. Rich and others is something actually the city does fund, but the Department of Behavioral Health has funded over the years. I'll let Dr. Bowen fill in more on that. Let me just say that I do think that there's an opportunity for us to do more work on people who have had a non-fatal injury in emergency departments to try to prevent subsequent events. Whether that model, that taking the scale is the right approach or a different model, I'm not enough of an expert right now to say, but I do think that those programs it would be better if those programs reached more people. And so I'll turn it over to Dr. Bowen in a minute to fill in the gaps in that. As far as the media campaign, there was some work that we did a couple of years ago with the You Shoot, Now What? There's been subsequent media messaging. I think that there's more conversations taking place right now between Dr. Abaya and the Office of Violence Prevention about what additional media messaging is best right now. Dr. Bowen, you want to just talk a little bit about your involvement with Healing Hurt People?
Thank you, Dr. Farley. Yes, the Department of Behavioral Health and Intellectual Disability Services funds Healing Hurt People. It is a trauma-informed, hospital-based violence intervention program. It was originally developed by Drexel University, and it is expanding its reach throughout Philadelphia. It serves young men and women who are exposed to violent injuries at Tier 1 trauma centers across the city. It also continues to operate out of St. Christopher's Children's Hospital, and it provides case management services, peer mentoring, referral and linkages, and coordination for folks 10 to 29 years of age. They work closely with community partners. There's a whole range of community partners that they connect folks with. And for those who successfully complete the program, there are measurable decreases in PTSD and depression. And currently, for the first quarter of 2021, they served 87 people in outreach and engagement, and had some form of active involvement with 120 people. So they're continuing to be active and to expand.
Okay. Thank you very much, Dr. Jill, and to Commissioner Farley. Just wanted to do a follow-up just to make sure that, again, I know we have a COVID-19 pandemic that we're dealing with, and it's very, very critically important because we see people dying on a day-to-day basis, but just as equally, we have to walk and chew bubblegum because we see particularly young African-American men, but also we're seeing young ladies being murdered and children on a day-to-day basis. And if we're truly going to look at gun violence as a public health emergency, as we declared in 2018, we will make sure that we're doing everything we can to coordinate, partner. I want to be supportive of those efforts from a trauma standpoint, but also comprehensively looking at this issue with my other colleagues here on City Council that recognize that we are in a state of a crisis. And I know we're dealing with the pandemic, which is very, very serious. But I always will reiterate, again, probably the number one issue that we're dealing with right now, day to day, day in and day out, and it's all of our responsibility to address it collectively, is that issue of gun violence. And so, Commissioner Farley, I know you're in a tough seat because you are saving lives from a health standpoint when it comes to COVID-19, but also if gun violence is truly a public health emergency, we're going to take that approach. We're just going to employ you and work with you and support you as we and your team as we address this issue from a public health emergency as well. And again, Dr. Farley, just want to thank you for addressing these issues, and Dr. Jill Bolton as well. So thank you very much, everyone.
Thank you very much, Councilmember.
Chair recognizes Councilman Swiller again.
Thank you, Council President. Appreciate that, and thank you, Councilmember Johnson. Knowing how important this is, I have a couple questions, but I'm going to stick to the 911 because I think it's important to understand how that works. And now that is all the 911 operators now trained in this procedure of questioning?
So they've all been trained on the script. There's also specialized CIT training that about half of them have received at this point, and we'll check in with Dr. Wright to be sure that I have all of the up-to-date data on it. But they've all been trained on the script. They've actually evolved the script with feedback. One of the responses to the script, even though it was really helpful, it was taking too long, and they wanted to be more efficient with the script, and so they have evolved the script. So it is absolutely a work in progress, but it is already making a significant difference in terms of understanding what those calls, being able to surface some of the issues that wouldn't have been surfaced, that then are informed no matter which bucket that call goes into. It informs the response on the ground to improved in an improved way for the person who is in distress.
Is 911 then able to send to different providers at that point for assistance?
So what 911 currently does is when a call comes in, it is right now it is has begun to be bucketed. And is this a call that would be a CIT trained response? Is this a call that co-response might be appropriate for? And for right now, without the capacity to have the full-time 4 community mobile teams, only the suicide calls go directly from 911 to the Philadelphia crisis line, at which point the PCL line would then pick it up and start doing the assessment and the triage, and if necessary, respond by dispatching the mobile teams that we currently have. In order for them to take all of the calls that meet the criteria for behavioral health only response, we need to expand to those 4 full-time 24/7 teams, at which point those calls that meet that criteria would all be shunted to the Philadelphia crisis line.
So there will be a different those other calls now that are all going directly to police, except for suicide.
All those calls have traditionally gone directly to police. With standing up the mobile, there's an opportunity for it to go to police with a behavioral health person in accompanying. But the goal is for them, this is the major, you're hitting right on what the major transformation shift is here, which is to build the capacity to have all of those calls that do not need police response at all to be shifted from the police to the social service sector. It's exactly what we're trying to do.
Okay, good. And as we're building this, obviously, we're going to have some growing pains. We have some complaints of 911 not answering, people calling. And so are you working with the administration on getting more of these employees hired immediately and to make sure that we're going to have staffing appropriate to do this?
So if you're talking about, just to be clear, if you're talking about the Philadelphia crisis line, the PCL line, absolutely, that is part of the $7 million budget. If you're talking about embedding behavioral health full-time at the 911 center, yes, that's part of the ask to the Office of Criminal Justice for us to be able to do that and for the money to come to us to be able to hire those individuals who would be there 24/7 in the 911. But keep in mind that they're not call takers or dispatchers. They are behavioral health consultants that help and support the call takers to be able to ask the right questions and make some of the right decisions, particularly in the complex cases. But if you're asking about the 911 call takers and their capacity, that's a question you would have to ask the police department. Dr. Wright, am I missing it? Go ahead. I'm sorry, I just wanted to check with Dr. Ray if I was missing anything.
No, that is correct, Commissioner. I would just add that because this is a 24/7 coverage for the 911 radio call takers, that we are training about 13 per class, and so we will be at 50% on May 11th. We have one more class to get us to that point, but everything else you said is absolutely accurate. And to Councilmember Squilla's point, yes, we are working with the police to make sure that we have adequate capacity. And yes, this does take a little bit of time to have this transition.
Okay, yeah, because I mean, the other concern too is because as it is, and it's something good that we need to be doing, but as this is taking more time, sometimes it's a longer time before people answer the 911 calls, and if there are emergencies and we don't answer them, can also have an unintended consequence. So we have to be able to do both at the same time, right? Be able to train them and also get new people on board right away, starting today, and making sure. So we could work with the managing director's office, whoever is in charge of those hiring. Is that hiring through the managing director's office, or is that through the police department?
If you're talking about the 911 call takers and dispatchers, that's the police department.
Okay, all right, and they will be working on what capacity would be needed now that you're going to have. And is it in the police department, or do you guys do the data study on number of calls received, how they're being disseminated, and if we are falling behind on the capacity for these calls? Who does that study? Is that you guys or?
Dr. Ray?
Yes, so it's a combination between police being able to document the number of calls coming in, match with our PCL staff looking at the number of calls that are being transferred to the PCL line. And that's how Dr. Bowen was able to come up with the number of capacity that would be needed for us to scale up and look at how many transfer calls are likely to come in per month. We also break it down per week, behavioral health only calls versus police calls. And so, yes, it is a combination of the two departments looking at that data.
And I can tell you that approximately 3,000 911 calls per month were screened and would meet behavioral health only criteria. And currently, the PCL line receives between 4,000 and 5,000 calls per month, and that is how we figure that we need to have capacity to double the size of our current mobile.
Right, and you're looking at your capacity from your end, and then the police have to look at their capacity on their end, and you guys are working together on that to make sure that we are able to handle this, correct?
Yes, and that's how we also figure out, to many of the council members' questions today, that's how we figure out what we need to grow, how we need to grow the mobile capacity for the city based on the expected additional calls that would be shifted from 911 to the PCL line.
Right, because I mean, our fear, and I'll go into, I have some questions for Dr. Farley in the second round, but our fear right now is we're getting some concerned calls that people are calling 911 and nobody's answering. So we have to be able to address that also, and that's going to be a challenge because that could be something really serious. So thank you for your answers, and I'll wait for the second round for my next questions.
Thank you, Councilman. When Chair recognizes Councilman Thomas.
I could say good morning or good afternoon, and probably by the time I'm done, it'll be good afternoon. I want to jump right into it because I know that we're crunched for time. I'm going to start with where Council President started as far as vaccinations. I remember having a conversation with the health department a little while back, and one of the things that I communicated was this concern around the importance of educating people, especially educating young people of color. Minority communities have long been had a history as it relates to negative experiences with medicine and vaccines. So I'm wondering what type of focus groups or information sessions has taken place with the health department or any of the contracting organizations to specifically target and educate people, young people, I would say between, let's say 40 and under. What efforts have taken place, and what are we doing to make sure people understand how vaccines are created and why this is something that that they can feel comfortable taking?
We have several sources of information about what people's concerns are, from what we get on social media to our Philly Counts group is calling people on the phone, and for those people who are reluctant to be vaccinated, they find information about that, to other informal conversations and looking at surveys that are done. And there are specific messages that we are putting out there to address the concerns, particularly African Americans, such as, for example, questions like, how is it possible the vaccine was developed so quickly? And there was, answers to that in the ad about, okay, here's how it's possible, or such as,
where would the ad? Where you say you're talking about an ad? Where are these ads? Like
right now, these ads are over social media. You'll see more of them in the future. There will be also ads that are going to be starting appearing on SEPTA, and we're going to be doing some things on radio. And there's going to be more media campaigns and more media messaging in the future.
So you say shortly. How long is shortly in your estimation?
In the next 2 weeks.
Okay. So basically, up until now, nothing has really been done. And when we look at demographics and people who are not getting vaccinated, we haven't really had a concerted effort. I mean, I understand what you're saying as far as phone banking and things of that capacity, but a lot of us, as far as elected officials, are used to outreach and organizing, and we're all pretty sure that that's not the most effective way, especially when you talk about something as serious as this with communities that have the track records that they have. That's definitely not the most effective way. So I'm going to be limited on time. So I'm really concerned about vaccinations. I really don't feel like we've done an effective job of putting together the proper town halls, events, listening sessions, and not just. And even you said the advertisement has been late. So I don't know. That's alarming and it's concerning. Have we provided vaccines to prisons? Where are we at as far as vaccinating folks in the prisons?
Yes, we've been providing vaccines to the inmates and the staff since probably late January.
Okay, so we can assure that's because we know we have folks protesting outside of the prisons who are communicating different messages as it relates to access to vaccination, as well as being exposed to people with coronavirus. So as we're sitting in this hearing, there is going to be a protest at the prisons this week. There has been consistent protests where people have been communicating issues that's directly related to the health department. So you're assuring us that those things that people are protesting, like those things, they're out there protesting and it's just non-existent?
I don't know what specific issues they're raising. I can say that the vaccine has been available for quite some time. Now, not all inmates have agreed to take the vaccine. My understanding is it's only been about half, but the vaccine has been available for some time and will continue to be available.
Okay. Earlier, Councilmember Green talked a little bit about contracts. Who has the contracts? Who are your top 5 contracts as far as with the health department? We know we've seen a big transaction last year with COVID, and we understand it was an emergency. But who are the organizations who get those contracts, similar to what Councilmember Green was asking, as well as Councilmember Gim?
Well, our largest contract, I'm going to pull this up here, I believe it's with Fairmont Long-Term Care. That's for managing the nursing home. And I have trouble finding it here. List of other contracts. I'm sorry, I can give you a list. There are organizations we have used for staffing through the emergency.
Who are the organizations? Who are they?
So that includes UAC, Urban Affairs Coalition, includes PHMC, and includes PMHCC.
Can we see what those contracts amounts were for? If you don't have it right now, can you make that available before our hearing is over today?
Yes.
So, and the reason I think that's important, and it actually ties into something that Councilmember Johnson and Councilmember Gaudier was talking about earlier. When we look at some of the crises that we're facing, and we look at how we spend our money tells us what's a priority. So, in the midst of us recognizing that this gun violence issue that we have is a serious priority, has there been any thought process as it relates to the health department as far as redispersing who you give contracts to be able to put people in a position where maybe you have more credible sources in neighborhoods that can address some of these issues? Because it seems like we have an issue as far as relatability. So I'm wondering, in the midst of thinking about how we address these issues around equity, these issues around gun violence, looking at the contracts and the providers. You know, I too, like my council members, and I'm concerned that how we're spending and what we're providing is not reflective of the priorities that we stated. So as it relates to your department, has there been any dialogue around maybe changing some of the contracts and providers who traditionally contract with the city to give other people an opportunity to possibly grow and move their business? Because again, like Councilmember Gim said earlier, we're not in that same sense of urgency. And if we're really serious about equity and addressing these issues, it starts with us and how we spend our money.
Yeah. So I should say that, you know, the health department has many different divisions to it that do different work, from AIDS to chronic disease prevention. There are many different contracts go through different divisions for different purposes. But all or nearly all of them really do set have value on minority contracts or minority reaching community-based organizations, and we try to maintain this through this through this epidemic as well.
Dr. Fry, I just respectfully disagree. So I think that maybe throughout the course of our conversation, we can do a deeper dive into that. I definitely want to come back for a second round of questions, because you guys talked about an initiative that works, that serves 125 people, yet we know 1,800 people in the city, at least 1,800 people in the city suffer from gun violence. So I'm wondering why only 10% of the people will be able to interact with such programs. As like, you got to be a victim and hit the lottery at the same time. So I think we're sending some conflicting messages. And again, I'll come back for a second round, but I do support Councilmember Dom's idea of a tentative date. I think that's extremely important for our economy to recover. And like Councilmember Squilla said, and we put this on the record multiple times, we're getting complaints from citizens about people not answering 911 calls. So I don't understand how that's new. We've sent emails. We have correspondence. We have people who've even put it on social media. The fact that is new news is alarming. So I'll come back around for a second line of questioning, and hopefully we can do a deeper dive and get some of the answers to the numbers that are already put out there. Thank you, Council President. Thank you, Dr. Farley and team.
Council President, I just have a point of information.
Chair recognizes Councilman Green for a point of
information. Thank you. This is filed to Councilmember Thomas's comment. The vast majority of the contracts to the health department go to nonprofit organizations. Currently, the Office of Economic Opportunity Health Department only track contracting to professional services for for-profit entities, even though the vast majority of those contracts go to nonprofit entities, and that's also not tracked based on the leadership of those nonprofit entities. Thank you, Council President.
Thank you, Councilman. Thank you, Councilman.
Council President, this is Eva Gladstein. I'm just wondering if I could add a little bit.
Sure.
Thank you very much. Eva Gladstein, Deputy Managing Director for Health and Human Services. I wanted to just point out to Councilman Thomas and others that some of the funding that is in the proposed budget would also be for a health equity plan that the health department would be able to prepare, including in that would be a chief equity officer and the resources to create that plan. There are a number, dozens, if not more, of contracts that the health department lets to very small community-based organizations. That's in its substance use work, and it's in its AIDS prevention work, and kind of across the division. But I think that through this health equity plan, we'll be able to address many of the issues that Council Member Thomas addressed.
Thank you. Thank you, Eva.
You're welcome.
That concludes our first round. We'll be moving into our second round, and the chair recognizes Councilwoman Bass.
Thank you, Mr. President. A couple of quick questions. And just following up, I had a whole line of questioning all laid out, and then from hearing some of my colleagues, I think I'm going to go a different route. And one of the things I just wanted to touch on is going back to Councilman Kenyatta Johnson when he spoke about the resources that we put into gun violence and trauma that is afflicted from gun violence and harm reduction. And it just dawned on me in terms of harm reduction, and we use the term primarily when we talk about those who are ingesting drugs or going through addiction. But have we thought about harm reduction when it also comes to people who are involved in negative activity around gun violence? Because we know that primarily the shooters and the victims, it's all part of the same sort of network, if you will. They're, you know, that most of the time they're known to police, they're known in the system. You know, you know, they can almost be sort of pointed out in terms of who the next shooter is going to be or who the next victim is going to be. Is that something that the health department or DBHIS has looked at in terms of how do you employ some sort of harm reduction to this population as well?
So if I can just take that for a moment and speak to trauma in general. So the approach to trauma needs to be a wide-ranging approach, and there is intentionality behind the way in which the behavioral health system works for upstream and also you know, for the prevention from a public health perspective. And so if you lay out all of the different programs that impact trauma, this is why it's hard to put a dollar figure on it, although I will speak a little bit about that, because the numbers of programs, we tend to talk about individual programs, right? What about this program? I spoke about healing hurt people, but nothing like that will work for that kind of a complex and intense and urgent program issue by itself. It's not a program by program by program approach. And I think sometimes when we talk about it, we miss the system, which has prevention. And because DBHIDS is such a population health focused approach, which is wellness and harm reduction, et cetera, there is just a slew of programs throughout the community, et cetera. And then early intervention with all of the screening. So you have trainings, and you have early intervention, and you have youth focused efforts, and you have everything from, you know, early on through identifying as early as possible when somebody is starting to struggle with the kinds of issues that then lead to their increased vulnerability. So trauma is bidirectional, right? You've got trauma that leads to behavioral health challenges, and you've got behavioral health challenges that lead to trauma. So sometimes when we talk about the layering, we talk about that. So you have to look across the entire system. And after you look at all of the prevention, all of the early intervention, and all of the treatment programs, especially the ones that are specifically evidence-based for trauma intervention, and then you look at the crisis. We've been talking a lot about shifting the crisis system. That is so impactful on impacting the trauma that the city and its residents are facing. And then you talk about community follow-up. You realize that you've come full circle, and you start in the community and you end in the community. And that's how you prevent and heal, right? And so if you try to put a dollar amount on that, you could actually say the entire system, right? So if you start looking, and I've done this, I've laid out the trauma and you know, the prevention and the intervention and all of the efforts that go into this across the system. You can put money on programs that are effective and that work together. Like, you flow from one into another. You don't, you know, like, especially around a program, let's say Healing Hurt People, by itself in that moment when you're making a connection, or any of the warm handoffs after some sort of traumatic event, whether it's, you know, whatever the event is that brought you into a Trauma One center, you're being referred. And that referral and those linkages have to work like water that flows through the system. So you need to be able to connect on all of those different points. That's, I think, the way in which we address such a complex problem.
Dr. Barhorn, you took up all of my time and didn't answer my question.
I thought I did answer your question.
I waited an hour. You took up all of my time and I didn't get an answer.
I can tell you that there's, you know, if you include IBHS, there's like $88 million that are being utilized throughout all of these approaches, including the interventions at the school, and much more if you include all of the treatment efforts.
Well, thank you very much, Dr. Bowen. However, I was not asking about the financial cost, but I was asking about the actual employment of a harm reduction strategy around shooters and victims in particularly in neighborhoods that I would say have a very high volume of gun violence. And the same way we thought about safe injection sites, as an example, for those who are going through addiction, as a way to reduce the harm that they are inflicting upon themselves, and you know, themselves first, and then the community at large, and their families and people and loved ones who care about them. You know, what about a similar strategy to you know, those who are shooters, carriers of guns, and likely to be victims? And so that was my question, Mr. President. I don't know if I have time for anybody to answer it, but if not, I'll come back.
We should have a conversation about
the answer won't go towards your time, so we can get an answer to that.
Okay.
If there's somebody that has an answer.
Has there been any thought about a harm reduction strategy around gun violence? Has there been any thought about it? I
think we consider, I know I'll answer it, and maybe it's not answering your question, but I think that we consider the resilience building, the development of skills in the community, the leadership development in the community, like what Network of Neighbors does. We consider those harm reduction efforts.
Okay. Those are not, I guess in my mind, harm reduction, you know, again, it goes straight to the point. When we talk about harm reduction and we talk about addiction, you know, we're going straight to the point. You know, we're keeping, you know, like the idea behind safe injection sites was, you know, keeping folks alive until we can figure out what to do, right? That was the administration's strategy. And so the idea behind harm reduction for those who are engaging in negative activity involving guns that are likely to leave someone injured or deceased, you know, I think that there needs to be a much more direct strategy around how we're going to deal with this. If we're really looking at it as a health issue, as a trauma issue, then we need something very direct, I think. And so I have some ideas on that. I'll come back in the next round. Thank you, Mr. President.
Thank you, Councilwoman. Real quick, before I call on the next member, I had a change directions a little bit. Had a question. I guess, I don't know, Eva or Liz Hirsch would need to respond to this. We had actually introduced a resolution to hold hearings on the proposed $42 million coming from the American Recovery Plan to support our ability to get individuals that are homeless into some level of permanency. It's been around for a long time, so I've seen a lot. You know, we used to be into warehousing homeless people. I can recall the 1360 Ridge. I still remember the address with that big old building at Ridge in Fairmount. And it was essentially a warehouse, and it was horrible, and we finally shut it down. But this money, and I know there's been a lot of discussion about homeless initiative and issue. I mean, going back to during the pandemic to the Parkway, that whole issue as related to the Parkway over the course of the pandemic. What is the game plan? And I know you indicate in your testimony that you need a little more guidance in terms of being able to have flexibility. If you have flexibility, what would you do? Because I genuinely believe that transitional housing in the fullest sense is the answer. This whole issue about just giving a person a place to shelter themselves with no wraparound services and no direction in terms of where they need to go. Because you just don't want to see this vicious cycle of a person ending up out on the street in a short period of time. What if you had flexibility from the federal government for this money? What would you do?
Yeah, that's a great question. Well, first of all, I think the American Recovery Rescue Plan is going in the right direction. The federal government really wants us all to get out of the shelter business. They want it all. They want us focused on long-term housing. So I think the first thing that we would do. Well, let me talk about people and then places first. Our highest priority are the older adults. We have too many people in shelter who are 60 and older and or who have chronic underlying health conditions and disabilities. And we don't think anybody who's older and has a disability should be homeless, and they shouldn't be in shelter. So that would be our top priority. That's been our priority this year with COVID, and we would really focus on that population. Our second,
before you go to that, you say you focus on it. What does that mean? I mean,
that means that when there's housing available, long-term housing available, they're at the top of the list.
So how would you make the long term? See, this is the challenge. You know, it's
sorry.
Like we take this approach like, you know, it's not a proactive approach. You know, if there's long term housing available, then we'll put that person in there. I mean, you know, you don't want to have this be based on the availability. We should be proactive in making sure that there is availability. And we're going to be getting a lot of money, you know, from the federal government. So what is the plan to produce both a strategy and a number of additional transitional long-term housing opportunities for homeless people? Not tell me when something becomes available.
There is no concrete plan right now. We'll want to have a process for community input, but we do have a number of buildings that are currently have non-congregate sheltering, actual rooms where people are living, that we would like to have be permanent affordable housing. And then the tenant, we'd like to add to that supply. And then there's other buildings. I think the money could be used for the acquisition and development of those buildings, some of our empty houses and buildings that could be used for that purpose. And then tenant-based rental assistance, which is great because that's when people can choose where they want to go. And it looks like this money will be able to be used for rental assistance. So between repurposing existing buildings and programs that we have in the community throughout the city and tenant-based rental assistance, that's the solution. When people get that kind of affordable housing where they only pay 30% of their income or zero if they have no income, that's the gold standard. That's what works. So that's what we want to do. It's really just a matter of where we do that.
All right. So
does that answer the question?
Not really. I'm no more than you answered before.
Council member, during COVID, this is Eva Gladstein again. During COVID, we started to proactively set up alternative, lower cost, longer term housing opportunities, and Liz mentioned some of them. We have a shared housing program operated by SELF. We've re-engaged SRO operators. We've been providing a shallow rent subsidy. Again, we set up these COVID prevention spaces that now will provide an opportunity for longer term housing. So all of those are opportunities. Again, they're proactive. They won't take as much time as you know, a typical low-income housing unit takes to develop 3 or 4 years, and they're lower cost. So all of those are things that we would try to sustain and grow. We don't have the you said with flexibility, what we would do, we would continue to grow that those opportunities to the best of our ability with the resources that are available.
But we don't have a plan yet.
Well, there's no guidance. We don't know. What we have is an inventory of things that we already know that are working that we want to expand. But what we want to do, so we're looking at that, and then what we want to do is also open it up for some community input, so that we can get ideas above and beyond. So is there a concrete plan? No, there's no concrete plan. What we know is what's working that we can expand and replicate, what's temporary that we can make permanent, and how that's what we're looking at right now.
All right. So in preparation for the hearing, and you know, we just have so many different balls that we're juggling, which is why we haven't had it yet. There will be recommendations on what we should do from entities other than the city of Philadelphia. I'm a little concerned that the city of Philadelphia doesn't have a plan, and we're looking for ideas I mean, this is the business of the city. We should be in a position to understand what we need to do, and we should talk about the plans and then have the community respond to the plan versus us asking the people whose responsibility is not to come up with a plan on how to spend this money. It's just for me, I'm just, dealing with housing for a long, long time. I really think that, the professionals should come up with ideas and run those ideas by the community and not put that responsibility on the community to come up with a solution on how we fix this very challenging problem that's been going on far too long. So I'm just giving you a heads up. At the hearing, I really would like you all to come forth with a real plan to some level of specificity. And if the guidelines associated with the end product from the $42 million from the feds, and that's not the only money that's available, prohibit certain things, then we'll just have to take that off the table. But I'm very concerned about us not having a game plan in place. If somebody says, what would you do if you had the opportunity to spend this 42 or 50 or whatever it ends up being? We got a couple of programs, MPI, all these different initiatives. We're going to have money. So let's I really want you all to come up with some concrete solutions to this in preparation for us, the receipt of these dollars. So I'm just giving you a heads up when we have a hearing. Really would like to see a little something more concrete, to be honest with you.
What I can tell you is what we've done with the $35 million that we got last July in Emergency Solutions Grant, which was 7 times the amount of money we had ever gotten in the past. Unlike other cities around the country, Philadelphia got that money out onto the street. We got it into the hands of providers who had never had contracts with the city before, all of whom are African American and Latinx. So we used that money to increase the involvement and the investment and to get that money into communities that were underserved and to provide more innovative programs. For example, the SRO, single room occupancy, which has 55 units. We used it to provide shared housing where we've renovated 35 scattered site PHA units that were sitting vacant. And now we have 3 unrelated adults living in them as roommates, and those are permanently affordable. We're using that to pilot 2 tiny home villages, one in West Philadelphia and one in North Philadelphia. As Eva said, we're using some of that for shallow rent. We have a lot of people in our system who have a permanent low income because they're on disability. They get about $800 a month. So the shallow rent ensures that they never pay more than $200 a month, and they're living in the community. We have a partnership with PHA, and Kelvin Jeremiah and his team have been extraordinary. They've created almost 300 new opportunities for people, family unification, when children are reunited with their parents, people with disabilities is Section 811, so people who are homeless aren't in institutions, and vouchers for people who have disabilities and have been chronically homeless. And we actually have completed applications sitting and waiting for additional vouchers that will be coming. So we also avoided service cuts. We sheltered 11,500 people. We provided 260 people with COVID prevention space that kept them safe so that they never got sick. Of those, 152 have already gone into long-term housing, tenant-based, so that they now have a better lease on life. So we created Help for the Hurdles, which is an employment program for people in shelter to provide transportation and childcare. We're piloting vaccine ambassadors. We had 50 applications for people who are homeless to be vaccine ambassadors. So we got that money out onto the street immediately in innovative ways that advanced racial equity. We have provided rapid rehousing for 3,000 people, about triple what we've done in the past. So we have a track record of providing, of deploying those dollars to and to use things that build on things that are already working. We have a commission of providers and a commission of people with lived experience that we turn to when there is new opportunity, because in the city doesn't provide all the services. We rely on a network of about 70 not-for-profits throughout the city who each have expertise, who serve different neighborhoods, different populations. And so we really value their input, and we think it's really important that we hear from them about what's working and that we don't assume that we know better than they do, because we believe that the people who are on the ground and who have that lived experience very often know things that we don't know. And so to us, it's very important that we listen to them. And so that's part of the plan, is to provide that opportunity for them to create the solutions as well.
So are you telling me that you're going to replicate what you've done with the 35 million?
I'm telling you, we're going to do better. We're going to get more. The money that we got, the $35 million, most of it, though, we could use it for rapid rehousing, which is a 12 to 24 month subsidy. And that's how we created rapid rehousing from the street, which is brand new. That's helped us get 75 people from encampments into housing right away, people who won't go into shelter otherwise. So what we want to do is use that money for long-term housing, whether it's people from the street or people from shelter or other transitional housing. That's what our mission is. Look, if we had enough affordable housing, we would be happy to close all of our shelters and have just a tiny little crisis response system like we used to have, before Ronald Reagan and modern mass homelessness. So that would be our dream, and we're making progress in spite of it all. Our unsheltered numbers are down to 700, which is a steady decrease, again bucking the national trend, where we've reduced street homelessness, we've reduced chronic homelessness, and we've reduced family homelessness by providing long-term housing, and also by homelessness prevention. But also, we can't do it alone. We have planning and development. We work really closely with Ann Fadulin and her team and Greg Heller on rental assistance, with the PHA team, with the Department of Behavioral Health. It's an all hands on deck situation, because by the time people reach the situation of being homeless, every other system has failed them. And there is a healing process that has to take place. And we believe in housing first. That's how we operate. But it really is, everybody has to be committed to that. And frankly, since you have me on my soapbox, I'm sorry, I'm just going to say that we talk a lot about racial equity, and homelessness is disproportionately impacts African American people. It's part of the legacy of slavery, Jim Crow, mass incarceration, and redlining, and all of these discriminatory policies. And we are not going to have racial equity or true economic equity for people of color until we end homelessness.
Okay, well, I didn't mean to put you on your soapbox. And that's sometimes not a bad thing. But the simple reality is that what we're asking you to do is to provide a clear, concise plan that includes all the aforementioned entities, because I agree and concur, you can't do it alone. So being in a position to have $42 million that we didn't anticipate having as a result of the American Recovery Plan, is that tell me how the $42 million will be used to help leverage existing resources, existing organizations, and existing strategy. Real simple. And we're going to be asking, when we have the hearing, for you to lay that out. Be it enhancing or coming up with new and creative strategies, or replicating past strategies that have worked. Real simple. That's
you got it.
Question. So we will look forward to you being in a position to provide that plan on how we spend the $42 million, because I think there's going to be a significant amount of flexibility in those dollars. As you earlier referenced, HUD, in fact, encourages extremely strongly that this money be used for permanency, because this whole issue about the vicious cycle of people in and out of the shelter system, it's just not the way to achieve equity and to deal with all of the woes of slavery and all the other things that we've referenced in the past history of African Americans. So we look forward to you providing that plan and that strategy, and we'll be willing to be in a position to help you wherever we can.
Sounds like we're on the same page, Council President. Thank you. And thanks also for your team in helping us. They've been great.
All right. Okay. You know, I'm okay. All right.
Me too.
Thank you. We appreciate the work you do. Thank you. Now, let me recognize Councilman Jones.
Thank you, Mr. President.
Welcome, sir.
So, while we're on the homeless, the Benjamin Franklin Parkway wasn't the only homeless encampment. There's a homeless encampment in West Philly. There are people who are sleeping in recreation centers in my district that have just figured that's a safer place to be, possibly even than our shelter systems. How are we, and I know about the tiny homes, but how are we getting out to places in the neighborhood to get people into the system and placed in not just temporary housing, but permanent housing?
That's a great question, Councilman. There's about 30 encampments around the city. They range from one tent or structure to several. That's our definition of an encampment. The first line of defense is the homeless outreach teams. They hit every zip code. They work in three ways. They work in zones, they work a target list, and they respond to calls. And so they're out there all the time engaging people. We are deploying, we're actually standing up with some of that CARES ESG money, a new encampment team. This will be a social services team. We do not do enforcement, we provide services. And so we try to get people to come in by finding out what do they want, what do they need, what will they accept. And then one of the things that the positive things that came out of the Parkway encampment this summer was some new approaches. One of those that's been very successful is this rapid rehousing from the street. Some of the people who live on the street, they just won't come into shelter for a variety of reasons. So the rapid rehousing, if they have the ability to find a unit, negotiate a lease, it has to be inspected. They may then be able to move into that, and we have 75 of those opportunities. We also have safe havens, which are mental health facilities. And then the other thing that we've tried to do is make it easier for people to come into shelter. So no ID is required, no drug testing. Our shelters do have curfews because they're in neighborhoods, and because there's people sleeping nearby, even if there's rooms. So we've just tried to make it as easy as possible for them. And then when we have housing at the other end, we know that that's more attractive. Outreach is only as effective as the housing that we have. But we still do have about 700 people on the street, and to get back to the council president's point, that really is the lack of affordable housing. So until we have enough places for people to live, we still will have people on the street, unfortunately. I wish that weren't the case, and we'll continue to work at it.
There's an irony, Mr. President. We're getting ready to invest $40 million into one of my golf courses, and that's actually where homeless people live. And so we have to figure this out. We have to figure this out. Dr. Farley, are you still there?
Yes, I am, council member.
Who does your outsourcing and your contracting? What person?
Well, that's done within each division. Each division has people who work on the program side, and then people who work on the administrative side do the contracting within those divisions.
Because I was during the budget. I've got texts and phone calls about some of the processes by which to get certified in order to distribute vaccines, and it was kind of arduous, to say the least. So, and then they brought up Insight Global. Are you familiar with that? Who in your staff, because I know it wasn't you, who administered that contract?
I'm sorry, I'm not familiar enough. I'd have to check in that and get back to you. This
So
is a
that
contract
is
for what?
It's a contract for contact tracing, so that if Darrell Clark was in proximity to Curtis Jones, the contact tracing component. It's a company out of Atlanta, I believe.
I don't believe that we have a contract with them for contact tracing.
Council member, I believe the state had a contract with them, but I don't believe the city does.
And we don't use them?
No, we don't.
All right, that's good news, Dr. Farley. That is good news. All right, thank you, Mr. President.
Thank you, Councilman. Chair recognizes Councilwoman Ginn.
Thank you very much, Council President. First of all, thank you very much also for the statements about the importance of having a plan for OHS. I think that that's extremely important. A number of cities have seen, real models everywhere from Austin, purchasing hotels, for example, and to others, really seeing some significant work done on this area, and look forward to doing that. I'm going to have a few questions for Liz Hirsch, but first I want to finish up a line of questioning with Dr. Bowen, if we could. So Dr. Bowen, I just want to clarify, first of all, you pointed out about how important the transformation here is to shift from a law enforcement-based response to emergency mental health crises to a behavioral health response. So can you clarify a couple things? One, is in the co-responder model, is it your team that will be going out with PPD?
It's the provider. One of our contracted providers would be going out.
And you will be responsible for evaluating, is that right?
Yes, correct.
But you don't really have a role. The funding for that, you only have $800,000 out of the $6 million, and that is primarily to fund the people within the dispatch unit. Is that accurate?
So there's $855,000 for the DBHIDS staff, which would be embedded in the 911, and the $5.1 million that is for the provider.
Yes, goes to criminal justice unit.
That's the Office of Criminal, right? But I do want to point out that's 2.3 of that's for the behavioral health providers.
So I think one of the things we want to make sure of is that I would understand if there's like an interim, or we recognize that for a certain period of time, just by culture of habit, most people are going to be used to calling 911, and sometimes there are some mixed situations that are apparent at the beginning. I do, though, want to make sure that there's an approach where we are closely monitoring the co-responder model and ensuring that there is some quality control. So it's not like an end of year evaluation. It's an ongoing evaluative process, so that you are urging people to move away from co-responder when it's clear that it should be. And also, secondarily, the reason why it's important to have DBH more involved with the co-responder model is right now you launched the mobile crisis unit based primarily, I think, on capacity. And what we must understand is that we need some kind of a needs-based assessment in order to understand what we need to grow to. Does that make sense?
Yes, it does make sense. Thank you. And agreed in terms of the evaluation and the oversight.
Yeah. Okay. So, and do you think that in the coming year there's an ability for you to have more conversations about a larger role or an important role that you potentially an expanded role that you might play in the oversight of the co-responder model?
Well, we are overseeing the behavioral health component of it, so I don't expect to oversee the police component of it. But the evaluation obviously is a one that has to do with the team, and it's really about outcomes, right? What is happening when they attend together, and is it having the effect that we would want.
Okay. Well, I think maybe we'll just continue with this maybe offline, and maybe I might have a few questions that are sent over. If council approves the budget, my understanding is that you can move from 1.5 mobile crisis units to 2 almost immediately, you said, right? Like July 1st?
It's really dependent on how fast consortium can scale up.
Can you give me no later than August?
I can't make a promise like that, but we're already on the runway. We're already had already been speaking with them about iterative expansions. So I will have to get back to you on an endpoint, but we're even before we get to fiscal year 22, we're working on it.
Okay. If you put out an RFP for the other 2 mobile crisis units, what is the intended date of operation? Are we talking about like September? Are we talking about end of year? Are we talking about before fiscal year 2022? We are allocating, $7 million and seeing $6 million into the other co-responder model. What can we expect? What can council expect for this investment?
Yeah, the RFP is due to be out on June 1st, again, even before fiscal year 22, because we'd already done an RFI. So we've been working with the hope and the prayers that we would get the expanded money. So we already put an RFI, we already got feedback, we already have an RFP that is set to go up on June 1st. So I think that it's probably reasonable, if it's not, written in absolutes, because there are so many factors, but to expect a September selection and beginning to hire up in all of that for the other 2 teams.
Okay, and then I assume you can send over to us the kinds of emergencies that you expect to be dealing with other than suicide. I assume that you'll be able to do that once the 4 mobile crisis units are up and running. Is that right? Okay.
Yep. And the PCL hiring, we're already on it. So we've been with urgency planning and prepping for.
Thank you very much. And then, Council President, if we can, I'm going to hope for a 3rd round. I know that we're, there's a discussion right now since there's an encampment clearing right now that's happening. So it feels important to have a discussion, just one more round of questions on round 3 with OHS. Thank you very much.
Thank you. The chair will duly note you are on round 3. The chair recognizes Councilmember Green.
Thank you, Mr. Chair. Just have a few questions for Dr. Farley, if you could come back briefly.
Yes, Councilmember.
Yes. Just wanted to follow up on a couple things. You said earlier in your testimony about health equity lens. Has there been any conversation about creating some type of health equity center that's has multiple disciplines in order to address some of the issues coming out of the pandemic, which we know have been systemic, that probably impacted some of our ability to address some of the vaccination rollout, but some lessons we can learn going forward to help address some of the ethnic disparities in healthcare?
We have had both a health equity team in the department that was working totally separate from COVID, that has representation of different divisions and different levels in the department. But separately, we also convened a health equity group, or a COVID health equity group, to advise us as we went through the epidemic, and that they ended up working as part of our and connected to our vaccine advisory committee. And so the epidemic did show that when you have a new health problem like this, that it tends to track many of the existing health problems, and that it affects the most disadvantaged people the most. And so we can address some of those problems by addressing COVID overall, but some of these larger underlying social issues that go back hundreds of years are going to be tougher, and we're going to have to continue to work on those.
Yeah, I just think this is an opportunity to maybe do some type of public-private partnership prior to your tenure as health commissioner. We had created a health center authority that we never actually put into operation during the term of Health Commissioner Schwartz. That legislation was introduced and passed, but we actually never put it into actual operation because of some of the legal insurance challenges. But that still is a vehicle that could be used, as well as the ability to do a public-private partnership to create some type of multidisciplinary perspective on dealing with health equity issues. I also want to, and this is a question for both you and Dr. Bowen in reference to contracts. I know other city departments have, during this administration, grown their staff, but it appears that with both Department of Health and Department of Behavioral Health and Intellectual Disability Services, there's been an ongoing contracting process with larger providers to do services that traditionally would be provided by city employees. Can you give some perspective on that difference between the health department and behavioral health and intellectual disability services on their contracting out, whereas other city departments seem to be hiring more?
I don't think there's been a significant change during the pandemic at DBHIDS.
Well, Dr. I'm not talking during the pandemic. I'm just saying over the lifespan of this administration, and the various departments have grown. We've gone from a budget of about $4 billion to now $5 billion type of budget. So, other departments have grown in staff, but from my observation, it seems like these two departments have grown in contracting out.
So I don't believe that that's the case for us, that we have changed the percentages. The contracting out that we have done is with providers to provide direct care. These are the behavioral health provider network. So if you're speaking to those providers, but there's not a significantly different number of providers than we have had in the past. We have about 200 providers in the network, and that's been pretty stable. If anything, it's probably gone down a little bit over the years.
Well, maybe I'll be more explicit, and you kind of hinted at that. Not an increase in providers, but an increase in staffing at those providers by outside contracts.
So it's not my understanding that has shifted significantly at DBHIDS, but I will check on that and get back to you.
Mm-hmm. Dr. Farley?
In general, there may be in where we're funding specific providers to do specific services. There, in general, hasn't been a strategic shift. However, with COVID, as I said earlier, we had federal dollars that need to be spent immediately, services we need to bring up very quickly that, and likewise, may disappear just as quickly. And we did hire staff. We'll call them embedded contractor staff to get that work done, particularly around the contact tracing work.
And outside of the COVID perspective, I know my time is up. Is there a concern about the civil service system and why we can't be hiring city employees to do some of the work that we're contracting out through providers? Now, for Dr. Bowen and Dr. Farley.
We are hiring city employees, and we're hiring city employees even for these new asks that we're talking about. The 23 additional lines, these are all city employees. The PCL line expansion, the embedded at 911. So, it's just what you're asking isn't resonating with me, but we'll check on it and get back to you.
I would simply say that there is a problem with the civil service system in that hiring people takes a long time. And so when you need to move very quickly, it's very, very difficult to do that with city employees.
Okay. Thank you, Dr. Farley and Dr. Bowen. Thank you, Mr. Chair.
Thank you, Member Green. Chair recognizes Member Gutierrez. Member Gutierrez.
Thank you. I'm here. Hold on. Thank you, Mr. Chair. My questions are for Liz Hirsch. Good afternoon, Liz.
Hi, Councilwoman.
Thank you so much for all of the hard work your team has done during the pandemic to serve our most vulnerable residents, first and foremost.
You're welcome. Thank you for your support and assistance.
Thank you. OHS's total budget allocation between general fund and grants revenue is $10 million more than what OHS received in FY21 and approximately $55 million more than what OHS received in FY20. However, the proposed general fund allocation for OHS is actually $4.6 million less than OHS's general fund obligations in FY20. Can you explain for the record whether the increased grants revenue funding from FY20 can serve as a full replacement for the general fund cut, or are there restrictions on the use of these grant funds?
We are facing a gap. The $4 million gap is a real gap. Because of the timing of when the new American Rescue Plan money is coming, which will be according to HUD, no earlier than the fall, and also because those funds will be for long-term housing, which is great and what they should be, but it will take time to deploy them, and we don't know at this point whether any of our existing programs will convert. And at this time, we do still need to operate a shelter system and a homelessness prevention program. So we are very concerned about that $4 million gap. Certainly our goal is never to have service cuts.
What do you think, what do you project could be the service impact of that cut?
Oh, I don't know. I hope that we won't have a service impact, but we'll really have to take a very hard look at utilization and whether we do. I don't know. We're just really right now hoping that we don't have to do that, honestly.
When do you think you'll have more certainty around that?
When the budget is finalized and the $4 million is restored.
Okay. I mean, it'd be helpful for us to know the true impact of that, right, as we're making this budget decision, but perhaps we can keep talking.
Well, there's no fluff in our budget. All of our money goes out onto the street. We have the intake staff who are city employees, most of whom are civil service. We run the Riverview Personal Care Home where there's 55 people, and we run about 43, in the winter, 46 different shelters. Every dollar goes into homelessness prevention. We're still meeting about 25% of the need there. So we're providing long-term housing with general fund to almost 500 households. So any cuts in dollars have an impact on those things. Okay. What we would we've looked at whether we can rearrange ESG money or there's also HAP money, and to see if there's any places where we can kind of move money around. We think we've maxed that out, which is why we've gotten as low as $4 million gap instead of the $6 million gap we were looking at. But we'll just... we're really hoping not to have to make any changes. We really need everything we have online.
Okay. Given the success of OHS's prevention and diversion initiatives, in a 2-year look back, no household who received these services has entered the OHS system. So given the success of that, do you think we should be providing more funding for prevention and diversion?
Yeah, homelessness prevention is great. It really works for people. What we've done over the last 2 or 3 years together with planning and development is we've really distinguished between eviction prevention and homelessness prevention. A lot of the people who come into the shelter, 80%, don't have a lease. They're not getting evicted because they're not the tenant. Now they may have been up the line, or they may be young and have just never lived outside a family home, or they have maybe couch surfing for a year or something beforehand, or living in abandonments or whatever. So homelessness prevention ideally is something that's multi-month. and provides case management and really gives people firm footing so that they never become homeless. And that's really what we want. And I would say the most vulnerable group are the young parents of young children who themselves have been in the homeless system or are in the child welfare system or have been in the child welfare system. So that's the cycle of generational poverty that we really want to interrupt.
Do you have a sense of how much we should be growing that work or that investment?
Well, I think, when we've gotten to about $5 or $6 million a year, we're really able to kind of keep the wheels spinning. Right now, with the emergency rental assistance program, it's taken some of the pressure off of us, and planning and development has been very flexible, maximizing the flexibility. But that's when we're really able. And then the other thing we've done is to get it out into the community, so that, for example, people who speak Spanish only can go to an organization where it's culturally competent and there's bilingual staff. So we want to be able to meet people where they are.
Can I ask one final question, Mr. Chair?
Yes, member.
Lastly, there's been a lot of debate about whether the city can receive 100% FEMA reimbursement for funding COVID hotels for people experiencing homelessness. Can you explain the city's position on this issue and the basis for our position?
Yes, the city has applied. So we are able to get the 100% reimbursement for the allowable costs. And that's really where the rubber meets the road. It really has to do with the FEMA definition of sheltering and the fact that they will not pay for what they consider to be homeless services that HUD should pay for. So the city has picked up through CARES and through ESG the actual cost of case management and the other homeless services that make the COVID prevention spaces places where people can start a new life. The city has now applied for $17.9 million for reimbursement to FEMA to cover the period from March 1st last year through December 31st of 2020. And the Recovery Committee is continuing to seek reimbursement for all eligible work. So I don't know, does that fully answer your question?
I think so. Are those hard and fast rules, or are we sort of making some determinations about what things will be covered and what things will not?
I see Eva wants to speak.
Thank you, Liz, and thank you, Council Member. Now, these are the very specific guidelines of FEMA. So, for example, they can cover rental and facility management costs, but won't cover the case management, housing supports, behavioral health supports that we've been providing at those sites. And I think, folks in the finance department, I don't know that they're on this call, have with their consultants kind of gone over line by line to see what is eligible and apply for all FEMA reimbursement that will be eligible.
Thank you. Thank you, Mr. Chair.
Thank you, member. And the chair now recognizes Council Member Johnson. Council Member Johnson. Council Member Johnson. We're going to move then to Council Member Brooks.
Thank you so much. I want to continue my line of questioning for Dr. Bowen, and then I had some questions for OHS. I would like to ask some questions about the crisis intervention training that's being provided to police officers. Can you share more about the crisis intervention training and whether it will override some of the training that officers have learned at the academy?
So I think that it's on top of and complementary, but I'll ask Dr. Wright to give you the specifics on that.
Yes, thank you, Commissioner. Thank you, Councilmember Brooks. Yes, it is complementary. It is in addition to, so it doesn't override anything that the police academy may be teaching. All right, I do know that they also have added, and this may be a better question for Inspector Fran Healy, but I do know that they have a mental health first aid type training that happens in the academy that is state supported. But in terms of DBHIDS, the Department of Behavioral Health, the CIT training that we provide is an addition to what the police already receive. It's a 40-hour training, so that's a week, 5 days, and that's what we do with them, yes.
So how does the CIT train officers to perceive erratic behavior from individuals who may be in possession of a weapon? And are officers trained not to perceive threats as erratic, like how to perceive a threat from erratic behavior? Because I know there's some difference in the training that they offer at the academy.
Right. And so what I can tell you is that any piece of training that's going to involve a weapon would be police training. It would not be behavioral health providing that training in terms of what to do about a weapon that is specific to police. What we do is we provide training from behavioral health professionals that help them distinguish between something that may be on the autism spectrum, something that may be drug or alcohol as a potential focus, and the difference between those things. We also have people talking specifically about what that looks like. We have scenarios, we have role play, we have a lot of different things to give police an opportunity to see what that looks like and the differences. We have video. We have something we are calling hearing voices training, which allows police officers to actually go through the exercise of wearing headphones and MP3 players to actually listen to some of the challenges of voice hearers and what they experience, so that police officers can gain an understanding of what it feels like to be a voice hearer. And while they're doing that exercise, we ask those police officers to conduct their normal business, that it would be a police type business, going out looking at license plates, trying to do appointments. We have them go through scenarios of sitting in an office like you would if you were in a doctor's office answering questions, just so they can see that people who hear voices, as an example, that they go through their everyday life, whatever that may be, going to the doctor, going to the store, going outside and finding your car, whatever that would be, and then specific to what police officers would do. And they have to do all that, going to the men's or the ladies' room, anything that you would normally do. They have to do that while they're experiencing the hearing voices. So that's one of many exercises that allow the police officers to not just learn the difference, but also to experience what it's like, obviously on a very small scale, 45 minutes to an hour, of what it feels like to be in that situation. So there's multiple ways for that training to happen. As you know, council member, that adult learning allows us to, and it advocates for multiple ways of providing the information. So not just didactic, not just lecture, but video,
Nation organizations have been invited to participate in CIT training, and how many have accepted invitations, and how many have declined?
I can tell you that I have asked that question to police and to our CIT coordinator that works very closely with police putting the training together, and they are not aware of anyone being asked to participate that has declined. So no one has declined that has been asked. I cannot give you a number on how many people have been asked. We've been doing the program for about 14 years, and I can get that number exactly how many years we've been doing the crisis intervention training. But I've asked the OCJ, I've talked to the police, and I've talked to our city, and no one has any experience or knowledge of turning them down after being invited.
So, Councilmember Brooks, we would be interested if you wanted to share that. We would reach out and find out, what the disconnect is.
Absolutely. Okay, we'll make sure to follow up offline with the organizations and the people that said that they didn't accept the invitations and how that affects this work. Thank you so much, Dr. Bowen and Dr. Wright.
Thank you.
Thank you, Member Brooks. Chair recognizes member Mark Squilla.
Thank you, Mr. Chairman. Real quick question for Dr. Farley. Is he available?
Yes, I'm here.
All right. As far as the homebound residents that we have in the city of Philadelphia, I know that we were going to look to work with the fire department and all. Has that plan been put in place, and is there a contact that we could share to get homebound folks vaccinated?
Yes, we have. There are several organizations that provide home-based vaccination services for homebound people. Fire department being one of them, and they've started, and there are other ones as well. And we now have a database where if you send us names, we can put it in the database, and they'll be referred to one of these providers.
All right. So, is there a contact that we could share?
And we hope to post our database publicly soon. If you want to send it, I don't want to mention the name of a staff member here, but could I follow up and give you a contact after the hearing until we post that database publicly?
Okay, there's nothing right now that we can share, so we'll just send you names over and then you'll contact them. Is that what you're saying?
Yes, we'll put them in our database, and then we'll send them to a provider, and the provider will contact them.
Okay. Also, what did you say the number of Philadelphians vaccinated were?
Give me a second to pull up. So we know of, based upon the vaccine that we've delivered, 567,000 Philadelphians who have received at least one dose. Now, there's more on top of that for Philadelphia residents who were vaccinated outside the city. So add maybe another 100,000 on top of that for those who were vaccinated outside. And we've also vaccinated more people because we vaccinated many people outside the city of Philadelphia.
Okay, so what percentage of Philadelphians are now vaccinated?
If you say a percent of, depends on what measure you're looking at, percent of people who are over the age of 16 receiving at least one dose, we know from our data 45%, but then there are more, a few more percentage points on top of that based on the people who have been vaccinated outside the city. So probably close to 50%.
All right, and what you said the number of vaccines has been going down, but we're still doing approximately, did you say 80,000 a week?
We did 80,000 the week before last. Last week it's somewhere between 60 and 80,000.
Yeah, let me call you back, Bern, because something's
Somebody. Member Squilla,
I'm sorry.
okay?
I don't know if something's. Am I on now? Can you hear me?
Yeah, we can hear
you fine, Councilmember.
All right, you broke up there. So can you just repeat that again?
The week before last, all the providers in the city delivered about 80,000 doses. And last week, when the numbers are not complete yet, but it'll be probably between 60 and 80,000.
Okay, so if we could stay consistent there, then, well, it looks like at this point, is it that we're not driving people to these sites, or is it just that we believe we're hitting sort of a wall?
Definitely, the demand for vaccination is definitely decreasing, and I would expect it to continue to decrease. We want it to decrease as little as possible and have the numbers stay as high as possible. The biggest decrease has occurred at the convention center, these very large mass sites. The volume of people going to our neighborhood sites and pharmacies has stayed pretty high. I do expect that to go down, but probably not go down as much.
Okay, now knowing that, and it seems like we have enough vaccines for people who want to get vaccinated, and I know a couple members had asked about an opening time, right. And you want to see more people vaccinated and the numbers going down, but if we get to a point where we're not seeing more people vaccinated, is it possible to go with the state guidelines and that, as people trickle in, because all the people who want to get vaccinated will be vaccinated, and then the people who don't or hesitant, I don't think we could make rules and depending on what they do as a whole. And as people also, if it's just the city of Philadelphia that is actually not open, our residents are going to other places and doing what they want to do and then coming back into the city of Philadelphia. So I know that you said that there's a number that you're looking to get to, but if we see this hesitancy and we're not getting increase in numbers, it might take us till the end of the summer or maybe into the fall before we ever reach a number that you're looking to reach. So is there an alternative plan in case you see that we're not getting there?
Well, I think that the only plan that we all have in public health is to get as many people vaccinated as possible, and to use these other methods to limit the spread to the extent that we don't have vaccine in people's arms. I would point out that the state of New Jersey is not fully open like the state of Pennsylvania, so their restrictions are pretty similar to what they are in Philadelphia right now. But if we're vaccinating people now who may not be eager to be vaccinated, but they're not necessarily people who are close to refusing. They're people who have, I think, other issues going on in their lives. They may be ambivalent. If we make it easy for them, I think we can get a number of them vaccinated. So I'm not ready to give up on people who are not rushing to vaccination sites right now. And I think if we open up too soon, we do risk that the virus will spread and people will get infected and die from it unnecessarily.
Right. Well, two things could happen. Either you start opening up and people want to be vaccinated to be able to go to things and they rush to get vaccinated and we could help them along. Or like you say, they're thinking about it and maybe will and will not. But at some point, we're going to have to decide that the people who decide not to do it can't drive our decision making. And we need to make sure that we as a city are in a position where we're not forcing then these businesses to go against the rules, because we know what's going to happen. The longer this goes, more people are going to pay less attention to what the rules are and do what is not legal. And then we're out there trying to run around, shut them down, and so forth and so on. So we have to somehow come into a happy medium. So I would love to continue working with you on this. I know it's not easy for you to make those decisions, but I think we have to really err on the side that, let's work hard. We don't want to throw anybody out. Work hard to get everybody vaccinated. But in the meantime, let's open these things up so maybe that'll encourage more people to get vaccinated. That's my 2 cents. So thank you.
Thank you, Councilmember.
Thank you, member. Chair recognizes Alan Dom.
Thank you, Mr. Chair. And Dr. Farley, I have a few more questions, and I want to follow up on Councilman Squiller's questions. In today's Inquirer, they reported that state of Pennsylvania on May 31, restaurants, bars, stores, salons, gyms, theaters, event venues, nightclubs, and other businesses can open at 100% capacity, and crowd size limits would be lifted on all indoor and outdoor gatherings in the state of Pennsylvania. We also heard that New Jersey will join New York and Connecticut in dropping many of its largest remaining coronavirus restrictions on May 19th, including fixed indoor capacity limits at restaurants, gyms, retail businesses, and churches through mask and social distancing will still remain. They're also going to end all outdoor gathering caps. Would you agree, Dr. Farley, that by the end of May, Philadelphians will be facing far greater restrictions than those living in every neighboring area of our city, including the suburbs of Pennsylvania, New Jersey, New York, and Connecticut?
I wouldn't necessarily agree with that, council member. The New Jersey, we looked at it yesterday, and it's a little hard to find actually what they've written, but they still have limits. For example, 30% capacity indoors for these large venues. They're maintaining 6-foot distance, and if you're maintaining 6-foot distance between people, there's still that's reduced density overall. Now we would, if we don't change, we would be more restrictive in Philadelphia than the state of Pennsylvania. But I don't know where we're going to be at the end of May as far as how many people are vaccinated, how many cases there are occurring out there. But I do think that there's a risk in opening up too early that there will be people dying unnecessarily, and not necessarily a small number of them. 60 deaths happened a couple of weeks ago. I'm expecting we're having about 60 deaths per week. We'll point out there was an international incident in Israel when at one event 45 people died, and that was considered an international tragedy. We had 60 people die in the city of Philadelphia a week over this preventable illness. So I do think that while we all desperately want to get this past us and relieve these restrictions, that we need to be cautious in doing so in a way that doesn't have people die unnecessarily.
Yeah, but I do think New Jersey has lifted their indoor dining restrictions. I know that, I don't think that's a restriction anymore in Jersey and in other states. So I just think that we're going to be the only ones with really, really restrictive requirements after the end of this month. And I think we need to look at that because that's probably something we should adjust. Let me ask you a separate question. I was thinking about the questions earlier, and I'm having a hard time understanding that we don't have an answer for these two questions. And these are very direct questions. What is the total number of Pfizer doses currently sitting in freezers controlled by the health department that have not been distributed to the providers yet? How many are we sitting in our How many are sitting in our freezers right now? We have to have an answer to that. That's like not knowing how much money you have in the bank.
So I don't have it on the top of my head. I can tell you how much we have in the freezers we have at the health department. That doesn't include doses that have been distributed to providers. Most of our vaccine goes directly to providers from the federal government, and it may be in their freezers. So we can tell you that, how much we have in our freezers.
How much do we have in our freezers, and how much are in their freezers that haven't been put in the arms of people yet? That's what I want. Those are two numbers we should know.
I can get those. I can get the number we have in our freezers and get that to you. I don't have it on the top of my head.
Shouldn't that be like a daily report? I'm sitting on 100,000 doses. I'm sitting on 200,000 doses, and our providers are sitting on. How would we not know that?
At this point, the greatest limiting factor is not the number of doses, as I said earlier. There are plenty of doses available. So, how much inventory do we have of measles vaccine in the city? I don't know, and it's not important. We have plenty of measles vaccine for everyone who wants to be vaccinated. So we're at that stage now, and I know that's hard for people to conceive of because it was so recently that we were in such short supply, but right now that's not the limiting factor.
I'm not sure I put measles vaccines in the same category as the coronavirus vaccines. I think that the coronavirus vaccines are on everybody's mind right now, and I would like to know, and I'd like to know today, do we have 100,000, 200,000, or 300,000 doses sitting in our freezers, and how many doses are sitting in our providers?
I can tell you what we have. Again, not on the top of my head, but I'll get back to you very soon.
Okay. Let me just clarify something. You mentioned that in the week ending, I think April 25th, the dashboard showed about 85,000 doses administered. And of that 85,000, I think 34,000 were delivered by pharmacies. The lion's share of those doses are the Rite Aid, CVS, Walgreens. Are they coming out of the city's allotment, or are they coming out directly from the federal government?
Well, those pharmacies include both chain pharmacies and independent pharmacies. And the chain pharmacies, most of them are coming from the federal government, and the independent ones, most of them coming from us.
So when we say 85,000 and we received 80 or 85,000, it's possible we have 20,000 doses we did not administer that week.
It is possible, yeah.
So that's what I want to know. And I also want to understand that this last week we did about 60,000 doses, I believe, week ending May 2nd. And I'm just trying to get my arms around how many doses we're sitting on and a plan for the implementation over the next several weeks so we can hit President Biden's goal of July 4th. The mayor of Chicago has that as her goal. The state of Illinois has it as their goal. And most states have it as their goal. We need to have that as our goal.
Understood. But I do want to reiterate the limiting factor is not the doses right now. The limiting factor is, at the moment, is demand. Now, I recognize demand is dependent in part on how many providers we have out there that are making vaccine available. But the more we have more vaccination sites, we got doses available to them.
I understand that, but my question is pretty basic of how many doses are sitting in our freezers and how many doses are sitting in the providers' freezers. I think that's a number that this body should know.
We will be happy to get you what we have.
Okay, thank you very much, Mr. Farley. Thank you, Councilman.
Thank you, Member Gum. Next up is Member Isaiah Thomas.
Thank you, Mr. Chair. I appreciate it. And, I'll just pick up right there where Councilmember Dom left off. You're basically saying that the demand isn't the issue. We have enough vaccinations for people. It's the fact that people do not want to get vaccinated. So I'm wondering about the point that I spoke to earlier. Like, and even if just listening to the hearing today, like Dr. Farley, do you and your team maybe possibly need to rethink some of the efforts in the outreach? I personally don't think advertising is enough. I don't think advertising is the right thing to convince people, because very rarely does advertising educate people. Often when we advertise something, we're trying to sell them something, and I don't think we could sell people this vaccination, right? I don't think that's going to be enough. I think it's going to require a different type of setting than me scrolling through my phone or hearing a commercial on the radio or hearing a commercial on TV. I'm 100% for that. But just based on listening to the dialogue back and forth to you and Councilmember Dom, what are your thoughts now, on maybe more of a sense of urgency to educate people and to put people in a position where we're having more intimate dialogue? Maybe a wing of the health department be responsible for outreach, maybe create some focus groups, have conversations with college students or high school students going to workplaces. How can we be a little more innovative if we're saying that we have the vaccinations, but people don't want to take them?
Yeah, so first I would agree that advertising is not, in general, education. It raises awareness, and that it helps to have more in-depth engagement. It's hard for us to engage with hundreds of thousands of people across the city, but we are doing what we can and have been doing this throughout. So we've had town halls, we've had lots of meetings, we have our Philly Council people, we're doing canvassing, lots of conversation. Now that doesn't mean that we've talked to even a large fraction of the people in the city, but we're doing what I can, and we will continue to step up that outreach, and that outreach is going to have to be on an ongoing basis. It's going to take a long time to get through the folks that have not vaccinated yet. Advertising is just one piece of that. But we do have the full range of communications.
I just don't think it's as difficult. Okay, go ahead, Matt. I'm sorry.
Thank you. I just wanted to provide a little bit more information. So Philly Counts has been doing outgoing phone calls with individuals in communities that have low vaccination rates. And doing kind of more extensive conversations with them, as you spoke about. They've also done focus groups with different populations, and they're building up a whole trusted messenger infrastructure like they did for the census. And I believe they already have, my numbers are not going to be precise, but dozens, if not hundreds, of trusted messengers who are known individuals in their community, for example, block captains or elders or faith leaders, and they're providing training to them on COVID, and so that they can become some of those individuals who engage. And Philly Counts is doing this in partnership with the health department under funding from the health department.
Has this started already, or is this something that's going to happen?
It has started already. It started several months ago, but they're still building capacity, so they're still hiring staff, but they've definitely done focus groups, they're definitely doing calls, and they've been recruiting and training the trusted messengers already. And it's just about kind of continuing to scale it up.
Okay.
I believe it's 40,000 phone calls that they have made to people in Philadelphia.
So can we do a deeper dive, right? Because, I have to get to other questions at a time, but I'm just thinking about what you just said. Well, 40,000 phone calls. Are we calling landlines or cell phones, right? Because if you're likely to own a landline, right, and you're receiving a phone call, you're probably more likely to already have gotten vaccinated. If you're likely to have a cell phone, right, you're likely not to pick up the phone call because it's a number you probably don't recognize. So again, I hear what's going on. I've never seen a town hall at all. I would love to get that information whenever you're hosting a town hall or information session so we can help get people in a room that can receive this education experience that you're talking about. I got to get two more questions in because I don't think I'll get to another round. Earlier, you talked about PHMC, UAC, and Fairmount Lawn Care being some of the top contract providers. Were you able to get me those other two contract providers as well as the dollar amounts for those organizations?
We're not able to get the dollar amounts. We do have in the overall testimony that was sent to the council the top 5 nonprofit vendors, which are Fairmont Long-Term Care, PMHCC, the HMC, Health Federation of Philadelphia, and Children's Hospital of Philadelphia. That also includes the percentage of their workforce, executive team, and board that is minority. Of those five, the majority of those have, 3 of those 5 have majority workforce and majority boards that are minority.
So again, like Councilmember Green talked about earlier, that's not necessarily reflective of what we want to push when we're talking about equity and inclusion. So I definitely want to do a deeper dive into that. Mr. Chair, also for the record, can we get the same thing from DBHIS as well too, their top contract providers? Because this is the thing with what we're doing, right? We have organizations in the city of Philadelphia that's been grassroots for 10 years, right? They're credible community organizations like Unity in the Community, like Frontline Dads, who, if given a contract to do some of this work, they would be extremely effective at putting credible messengers in neighborhoods to be able to get this stuff done. So I'm wondering, in the midst of trying to address some of the poverty issues that we have, as well as some of the things that we talk about around equity, how can we put ourselves in a position where instead of giving one organization, a 35 million, maybe we cut them down to 34 million and give $1 million to maybe a scale-up program for nonprofit organizations to be able to do credible work in neighborhoods that's already been doing this work. We give these folks activity grant dollars. We ask them to stand with us at press conferences. We ask them to help us tell people to put the guns down. And I think that if we could transition some of these organizations out of that $10,000 grant pot and maybe into some larger contracts through the health department or through DBHIS, it will put us in a position where some of the credibility and messaging problems that we have, right, both on coronavirus vaccines as well as gun violence, could be rectified. Thank you, Mr. Chair. I appreciate it.
Mr. Chair, could I just add a little bit?
Yes, please, Ms. Goldstein.
Thank you. I just wanted to, I didn't talk about sort of the overall communication strategy beyond Philly Counts. I do want to say, in terms of advertising, but also the creation of videos and other messaging, there is a group of communications professionals within the city who are working and meet on at least a weekly basis to develop those strategies. Joe Grace, who represents, serves council, is a member of that communications plan. So I really want to encourage communication that way as well. And council has been great already around doing the robocalls. But as you have other thoughts and suggestions, I just wanted to say that was another venue to capture your ideas so that we could act on them. Thank you.
So Member Thomas's thoughts are similar to what we did for the census and similar to what we did for nonpartisan voter registration. These are the kinds of door-to-door activities that boldly go into places and spaces that some folk are a little hesitant to do. And that's where it's needed.
Mr. Chair, I just want to, thank you. I just want to offer myself, as support. I have people in my own space and network who I can't convince to take the vaccination, but at the same time, I'm not a health expert. But what I can do is help convene people who are reluctant, that will want to hear more quality and credible information. And I'm 100% sure I'm not the only person that's capable of doing that. So I think that type of outreach is what we're talking about as far as community, trusted community folks. Thank you, Mr. Chair. And again, I'm here to support and address this issue because I'm extremely concerned that we're not making the progress that we need to. And we can do better. We can do more.
Thank you.
You're on mute, Mr. Chair.
Thank you. Chair recognizes Member Bass. Cindy Bass, Member
Here
Bass.
I am. Good afternoon, Councilman.
Right.
Thank you. Thank you. So I had a question for Dr. Bowen. Is she still available?
Dr. Bowen?
Yes, member, how are you?
I'm great. How are you? So I had a question. So recently, it came to my attention that the efforts that are underway by the Commonwealth to license facilities that provide drug and alcohol treatment throughout the state. And I wanted to get your thoughts and feedback on that. Because as I understand it right now, the system that's in place is kind of like an honor system. There was recently an article that was written regarding this, and I just wanted to see, does the City of Philadelphia, do we support that? Are we opposed to that? Can you give some guidance on where we are with that situation?
Yeah, I believe you're talking about recovery houses, and
that is exactly, yes, correct.
And we have been working for years to help, and that precedes me. So I will probably bring up Deputy Commissioner Roland Lamb to flesh this out a little bit. But we've been working to improve the quality of the programs and the standards already. So Roland, do you want to flesh that out a little with some specifics?
Yes. Good afternoon, members of City Council, Council President, and Councilwoman Bass. We have been, for the last, I would say, 10 years, been invested in developing recovery housing in Philadelphia. We have funded and supported the creation of the Pennsylvania Association of Recovery Residences, which is connected to the National Association of Recovery Residences. We have been active in the creation or the promulgation of regulations with the state around recovery housing. We have actually created a multi-tiered system of recovery house accrediting. When you consider the fact that the state has a series of regulations that they've imposed, but that's been recent. We have for years had a city system of regulations that have been imposed on recovery houses that we do business with. We've made sure that we've had contracts with recovery houses that have been very explicit as far as rules and staffing regulations and competencies. So we're continuing to do that. We are working with the state to make sure that we can coordinate the development or the promulgation of the regulations across the City of Philadelphia's recovery house network.
Can I ask a question? Yeah. I'm sorry.
You go first, then I'll follow up.
Okay. So the question I have is, when it comes to the regulations that the City of Philadelphia is working through with the recovery community, particularly recovery houses, are we looking at the quality of the treatment and the consistency of treatment that residents are receiving? Is that one of the standards? Okay.
And the recovery houses I'm sorry, go ahead.
Okay, I'll just get this in and then you can say more. But over the last couple of years, we increased the rates for folks at the recovery houses to ensure staffing was appropriate. And we've recently developed an opportunity for some mini grants for recovery houses so that they could do some work that would help them get closer to standard. And Roland, please continue.
We've also built what I think is a very strong connection between our recovery house network and treatment providers to ensure that people who are going into recovery houses that we are supporting, have access to care and have access to treatment. We have also created, what we call low demand recovery houses that don't necessarily require a person to be in treatment just to come in out of the cold, so to speak. So we're not looking at creating or compounding the issue with encampments. So that's
how has what's the response been within the recovery community, or how has it affected the City of Philadelphia, knowing that because of COVID, I'm assuming that we lost some beds in some of our recovery facilities. Is that accurate?
We have lost some beds in some of our traditional recovery facilities. You'll be, I guess you'd say, pleased to know that we have created some newer facilities, and we have actually increased the number of beds since 2019 in our residential treatment programs. So that we've been able to pretty much address that. The ongoing issue, Councilwoman, is the issue of people having choice to come in or not to come in. Mm-hmm. And so the issue for us is we're continually looking to find ways to improve the recovery house network so that folks are looking to make that a choice.
Mm-hmm. And recovery houses are part of the NIAC overview of quality process. So they're being reviewed as well, and the oversight extends through those efforts.
Okay. As we increase the number of beds, or basically save the number of beds that we lost because of COVID and spacing requirements and all those kinds of things. But you said we've added beds elsewhere. One of the concerns that I hear, and I think that we all have concern about people who are in recovery. I have someone who's very close to me, and like we all know somebody in our family, among our network and our friends that is going through it. Okay, let's just put it out there. So, but the other side of that, for the not so good actors in the recovery house community, is it causes us to not be able to put facilities throughout the city. It causes us to sort of saturate certain areas. And when I say saturate, I think that among recovery houses, the 8th, the 5th, and the 7th have the largest amount of recovery homes, I was told, in the city of Philadelphia. And so it becomes sort of like a saturation of facilities. And so I wonder if there is a strategy to address that, so that the residents, in those neighborhoods don't feel inundated and therefore would be more welcoming if they don't feel that they have become a neighborhood that is, all facilities and, not a lot of other types of residences. Is that something that we're looking at or considering?
Yes, we have been, and to be quite clear, we have an attitude or an expectation from all our providers, including recovery houses, of a good neighbor policy. That's number one, that they are not bad actors in the community.
I know that's the policy, but that's not always the practice.
Well, that's true, and the fact is that not every recovery house in the city of Philadelphia is in our system. We have some recovery houses that operate completely outside of the system, and that's one of the reasons why we have been supportive of the state's initiative to license recovery houses. So you don't have entities that are licensed or who are out there calling themselves recovery houses, but are not maintaining standards. So we're looking now to put everybody under some standards of operating.
And that's my concern. And I know the bell's rung, Councilman, but if you just give me one quick second, that is my concern, is that you have these players who call themselves quote unquote recovery facilities, but really aren't offering the programs, aren't offering the services, aren't offering the treatment that people need to get their lives together, and really have become quite predatory and operate in a way that is detrimental to the neighborhood, and it just does all of us a disservice. So I just want to make sure that that we can get the support that we need out of DBHIS, when we need it.
And once we get these regulations across the board, I think we'll be able to get some of those bad actors out of the business, or at least out of calling themselves recovery houses.
Our office would love to work with you on that. So, and again, the goal is to, if you get rid of the bad actors, then the good actors can do more of what they do. I remember I was on the board of an organization that was so good, people didn't even know they were there. People didn't know that they were, what was happening, behind these walls. And, it was clean. It was quiet. It was, people came and left, and, it was not some of the facilities that we've received complaints about at all. So thank you, Mr. Chairman.
Thank you, Member Bass. I can relate. In the 4th District, we may not have as many, but the ones we have happen sometimes to be doozies. And Roland Lamb came in and intervened and served as an ombudsman between neighbors, both in the community and in my office, and we worked it out, and we've been good neighbors ever since. But every now and then, you have to have someone like Mr. Lamb come in and say, now, put your trash out on the days that they're supposed to. And we don't have music blasting after 10, and teach actually the facilities how to be good neighbors in good communities. So
I need Roland to call me, because if he came out, Roland, I need you to call me.
I will, Councilwoman, and thank you, Councilman. We will reach out to you, and in fact, we will also involve PAR here at the Pennsylvania Association of Recovery Residences as well to reach out to you and to provide support around Recovery House and management.
Because ultimately we want stigma to drop and for people to be welcomed into the communities. Yes. And that's the ultimate. Right?
That's the goal, is that for people to be welcomed in, and most importantly, to get the treatment, to get their lives back on track. So thank you so much for all the work that you do. Thank you. Thank you, Councilman.
Thank you. Mr. President, are you back?
Yeah, I'm back, sir.
All right. Pass the baton.
Thank you, Councilman, for sitting in for me. Chair recognizes Councilwoman Kim.
Thank you very much, Council President. I just wanted to have just a very brief statement on some of the vaccination concerns that were stated earlier. And, just to remind our colleagues, we can get all the numbers and all the data that we want on the vaccination doses where they may be, but the fact of the matter is as has been made clear by Commissioner Farley, we cannot get them out. I have a vaccine clinic that's scheduled, for Friday for over 300 people, and we've got 50 signed up. And so, this is an issue where public health is not just about the medicine. In fact, like the medical part of it, believe it or not, is only the small part. When it deals with issues of equity, when we're dealing with lack of access, when we're dealing with a city that has continued to underfund and disinvest in the people's public health, when we are the largest American city without a public health network, then we are actually dealing with something that is not related to the medical part of it. We're actually dealing with psychology, we're dealing with social outreach, we're dealing with engagement, and most fundamentally, we're dealing with public trust. Public health is reliant on public trust. And that is one of the biggest lessons that we've learned. I hope that as part of Commissioner Farley's After Action initiative, that we do take a look at what happened. And I don't think actually that the Public Health Department can necessarily do it, but that we take a look at the psychology of the vaccination process. What did it mean to talk about scarcity? What did it mean when we limited it so much to, to the elderly or I understand that our notions of the disease were unfolding at the time. But for me, it is very painful because I wanted to see our city workforce that was frontline, essential, be prioritized. It is painful to know that many of them are turning down the vaccine. Many of them already got sick, to be perfectly honest. They were sick. They were laid out. They didn't get hazard pay. And so the vaccine dosage coming back in, is not quite as important now that we're here in late spring. And they're on the tail end. So we do need a chance to review it, why we did it, and why the public part of health is actually equal to, if not even more important than the health part of our work. So I just want to end that there because most of my questions are for OHS, and we have such a busy afternoon with OCYF and DHS. For Liz, my understanding is that are we clearing an encampment currently right now?
We did resolve the encampment that was in the Patco station this morning. Okay. We've been offering services to people since November. It was really important to us that there be no resolution during the cold weather. 42 people have accepted services. Some of them got medical care. They had to go to the emergency room, safe havens, shelters. And then there's more who are in the pipeline for rapid rehousing from the street.
Right. I have no problem with the term resolution if there's truly a resolution. I don't feel comfortable with using the term resolution for dispersal. Like those are two very, very different things. So I think, when you responded to the council president earlier, acknowledging that, we kind of lack a plan, like part of one of the things that will need to go into a plan that I'm interested in is whether you are actually surveying and tracking outcomes who've been moving from encampments over time, from one place to another, and that you're helping us as a city break down where people actually go right at the front end. This PATCO example is a good example here. So I know that you're tracking some that seek it, but we actually need to know where they are after 6 months, to the extent that we can, a year later. And we want to know how people feel about the options that they're given. That is a very important aspect of people taking those options. And in particular, we get, extremely low marks, as you know, on the shelter system, and we don't intend for the shelter system to be long-term housing. But we do have to understand people's feelings about the long-term options that they're placed in, and also whether they're able to stay housing stable. We're putting an enormous amount of money into this work for good reason, because housing is a human right. It is core to our public health and our public safety in the city, and it's one of the defining, most overt ways in which we demonstrate that we're the poorest large city in America. When you see families and communities living out on the streets. So we're united in this mission, but what are your plans right now to both track some of these outcomes and to actually survey people about how they feel about the options that are offered, and what are we doing to change that that sentiment?
Right. Well, those are all really good points, and we absolutely agree with you that this has to be service-led, that there have to be real options for people. There is considerable planning that goes on, months and months and months of planning that goes on, and one of the reasons that we do not resolve all of the encampments around the city is because this is a very intensive social service-led process, and we want to make sure that we really do have the best possible options available for people. What we do is, first of all, develop a by name list of the people who are in the encampment and find out who they are. And we survey them over many, many days and many times a day to find out what would they really like, what would they accept, what would work for them. Out of that process, that is how we came to develop the rapid rehousing from the street. Now, we do have some resource constraints. As you know, the federal money that we got last year is not for permanent supportive housing. So we have to be very creative. We created that shared housing and actually have been offering to some of the people based on their input that said that they really want to move into a place. Sometimes people go to treatment. One of the things is sometimes people aren't, they're not ready to come in, or they're especially in situations where people have a substance use disorder, which is really, an illness that tells the brain that drugs are more important than anything else. And that just takes time and continued building of trust. So that is the process that we undertake. The majority of people do accept services in every encampment resolution. On Filbert Street, for example, all but one person came in, so many people do come in and they remain committed to us, and that enables us to get them into a pipeline for long-term housing. I will say that when I said that we don't have a plan, it's for the new money. We do very much have a plan. We have a strategic plan that we developed 3 years ago. We're actualizing on it. We're making progress. We're exceeding our performance measures in all area. And we most certainly have a plan for the encampment when we move forward. It's a very planful process. It covers many, many departments. I also do want to challenge you, with all due respect, on our shelter system. Out of 11,000 unique people that were served over the past year, there were 149 complaints and less than 1,000 incidents, and most of those incidents were minor in nature. So our shelter system is certainly much safer than for people who are on the street. People certainly get care that they need. They can get 3 meals a day. They sleep in a bed. They're safe from the weather. And yes, they do have to conform to other people's rules. And, like I've said, we wish that as we're able to create more housing, that's obviously the goal. But we listen very carefully to what they have to say to try and help them, because we're not coercing anybody to come into shelter treatment. That's not our philosophy. It's person-centered, and it's trying to help them get the services they need so that they can have a better life. And then something like, let me say one other thing, is that in PATCO, there's no bathroom facilities. And people have no bathroom facilities, and so that creates like a really unhealthy situation for people. And because we do have services available, which is one of the conditions of the encampment resolution, to us, it's really important that they live in a healthier situation.
Right. And we both agree on that. Let's just be very clear that resolution is not dispersal. Resolution is actually getting people into some housing. And if that's what's happening, then of course, I think that's right. But if resolution is dispersal with no clarity about where they're going, then actually we are not resolving anything. We're simply moving it. I just want to clarify one thing. Rapid rehousing isn't long-term. It only lasts for, it has a limitation to it, right?
2 years. Well, this is one place where we disagree with the federal government. They consider rapid rehousing to be permanent housing. Right. And for 85% of the people who get it, it actually is. Sometimes people just need a leg up. They need to retire debt, get some housing case management, and get employment. And so 85% of people do really succeed through that strategy. And people like it because they have autonomy, and because they can move into their own place that they choose and follow their own set of rules. But for 15% of the people, it doesn't work. And then we do want them to, we try to create a longer term, like a permanent subsidy or, a voucher or public housing or something like that is long term.
And I just wanted to be clear that rapid rehousing isn't long term.
According to HUD and according to the law that created it, it is considered to be permanent housing. And so, as I said,
I don't want to get into semantics, Liz.
Yeah,
it's helpful, right? So we want to focus in on it does not actually function beyond 2 years. So
yeah, and for 85% of the folks who get it, it is really effective. And we agree with you about resolution. At the same time, some people make choices, and so they may choose not to come in at this time. But we never give up on anybody. We will continue to try, and we'll innovate, and to create as many options for people as possible, so that they, first of all, never end up on the street, which is a terrible thing to happen. And if they do, that they have some real choices. And I think this really is very closely intertwined with the opioid crisis. And, and that's something that I think we're all grappling with. Talk about a public health crisis. I mean, that's another biggie.
I mean, let's be clear. Public health, housing, and gun violence are all very closely intertwined, which is why the city needs a unified type of approach where it's not just one group going in and another group following, but actually it's a unified type of approach, and that we're hitting neighborhoods that are really hard hit by all of these things. And if we're going to even have a shot at solving them. Again, my request, though, before you is to take a look at the long-term data and evaluate our strategies against what the long-term data is showing us. It's not meant for what's immediately happening, because if it's just cycling people back for a temporary stop, we need to understand housing according to long-term stability and data, and then evaluate our strategies against that. Thank you.
Agreed. Thank you.
Thank you, Councilwoman. Just want to remind members, we still have another department coming up, and we do have public testimony this afternoon. So we have a lot more to go. Chair recognizes Councilwoman Brooks. Councilwoman Brooks. We'll come back. Councilman Johnson.
Thank you, Council President. I appreciate it. I had a little technical difficulties earlier, but I thank you for allowing me to get in on this round. Let's have a question for the Department of Human Services regarding our youth at the Juvenile Justice Center.
Council member, I believe they're going to be in the next group of testifiers.
Okay, thank you very much. Is that going to be the same thing, Council President, with Parks and Recreation?
Yes.
Okay, all right. Thank you very much. I don't know, Council President, moving forward, this structure, this new structure, hopefully we'll figure out a way to do things in a more efficient way, but I'll be on standby. Thank you very much, Council President.
Yeah, thank you, Councilman. Well, Councilman, this is the executive branch's government, and they can structure it the way they want to structure it. But we will get the answers that we seek if we are required to get callbacks or whatever. This is a little
Thank
different.
you very much, Council President.
And I'm used to recreation being under the managing director's office. So I still got to get used to that. But nobody, we would not like the executive branch try to tell us how to do our work. So
this is correct, Council President.
We should do it. So
absolutely,
I concur. It's a challenge.
Well, in the meanwhile, just a shout out to Eva Gladstein. Keep up the good work. That's all.
Thank you, sir.
Councilwoman Brooks, we get her back yet? Okay. All right. I think that concludes it. Hello?
Hello, Council President.
Oh, you back? Okay. Hi, Councilwoman.
Yes, I'm back. Thank you. My questions are for OCOS. My question is about the permanent housing. How are we doing so far as to moving folks into permanent housing? I appreciate your commitment to housing first, and I want to understand some things about your targets for this. First, looking at your written testimony for FY21, you had a target of providing permanent housing to 1,200 households. How close are you to that targeted number right now?
You know what? Those are new enrollments. Let me look for 1 second. Looks like we are at 815 into permanent supportive housing, and I think that's an undercount, Councilmember Brooks, because that's only housing that's dedicated to homeless. It doesn't include the city funded or the PHA funded. But right now my number is 815.
Okay, because I'm also wondering how you came up with your target numbers for FY22. FY22 goal for permanent housing is decreasing by 200 from last year, going from 1,200 in FY21 to 1,000 households in FY22. So can you explain how you have such a significant decrease in your goal while retaining the staff that allowed for you to be able to bump up from FY21 to 20 to 21? And is there a reason that the target isn't staying the same?
Yeah, well, we developed that goal, I think, several months ago before we knew about the American Rescue Plan and what that might bring. So I think it will be adjusted when we get a plan in place for that. And it has to do with the number of dollars that we get from HUD through the continuum of care, because there's no new. There have been for several years. There have been no new permanent housing dollars coming from the federal government. The numbers stayed the same. And then there's a turnover rate, so about 10% turnover. And then it's how much we get from planning and development, which is about 20 or 30 units a year. So we combine all of those things. And then we have about 500 that are city funded. And so we, some of those, they may turn over a little bit. So we look at really we look at the pipeline that we have from the known sources. So we don't yet know what the federal budget will be. We're hoping it'll be higher than it's been in the past, given the new Congress and the new administration, and that number doesn't account for the American Rescue Plan. So I think what you're looking at is just slightly out of date, and that's why there's that lag. I imagine that we will adjust that upward. That would certainly be our goal.
All right, thank you. And I also want to follow up on my colleague, Councilmember Gim. She was asking about how are we addressing the encampments. You know, you could take a short walk in Center City and it illustrates the housing crisis and the limitation of shelter system. My office has fielded multiple calls from individuals facing negative treatment at the point of intake while they're in facility. And a few months ago, I was able to tour SEPTA station from 5th to 13th Street, where I learned that there was currently many folks living underground as well. Additionally, the encampment on Filbert Street across from the Reading Terminal and in the Patco station were just two of the latest homeless encampments that were dismantled. So it looks like there is a continual shuffling of people experiencing homelessness in our city without sustainable permanent solution. And I have a few questions to better understand how we're moving those into permanent solutions. So first, can you explain what is the goal of the encampment resolution team? So when dismantling these websites, these encampment sites, what kinds of resources does the encampment resolution team offer that will help move people into long-term housing?
Okay, these are all really good questions and questions we spend a lot of time looking at, working on, and thinking about. First of all, the number of people who are unsheltered has actually gone down. Our unsheltered number this year is at 700, which is a significant reduction over the last 3 years. So I understand that the people who are unsheltered are very visible and it's very upsetting, but the actual true data shows that the numbers have gone down. The encampment team, which we're standing up, is service focused, and it's doing what I was talking about earlier. It's understanding who's out there, why are they out there, and what can we offer that would make a difference for them. And then really working with them to see, given what they really want and what do we have, what kind of match can we come up with. That's really the goal. And for some people, it may be shelter, it might be safe haven, might be treatment. Sometimes people have family and friends elsewhere and they want to go home. And it might be a COVID prevention space. We still have rooms in those. So if someone's older or has a chronic underlying health condition, we have a whole list of options that we try to make available to them. Some people don't come in. They make that choice, and that is their choice, and we don't give up on them. We keep trying to get them to come in. But as I said, the majority of people do accept services and come in, and you may still see them outside. Our shelters are not locked. They're not incarcerated. They're not locked facilities. People may come in, sleep in a shelter overnight, and come out during the day and hang out with their friends and go to the park and do things that everybody else does. We still do face a shortage of affordable housing, which is why we still have homelessness. But as soon as we can get a penny, we try to put it into long-term solutions, real long-term housing for people. Most of it's not directly from the street. Most of it is out of recovery houses, shelters, safe havens, or other kinds of entry-level programs.
So what would the city need to do to get those folks into permanent housing, as you said, and move away from shelter system that came about after the Reagan era of mass homelessness crisis and get back to focused crisis intervention?
So I'm so glad you asked me this question, Council Member. We estimate that we need 2,500 permanent supportive housing units to end chronic street homelessness once and for all. And that also takes into account the pipeline. So people who leave the justice system and don't have a place to go, people who leave hospitals or other kinds of facilities and don't have a place to go. 2,500 is that number. We think that and that's about a $31 million a year. The $42 million coming from the federal government is one-time money, so we'll be able to do something, but not everything that we want to. But that's really what we estimate that is needed. What this administration has done is we've created about 500 city-funded long-term housing opportunities. This is the first administration that's actually put money into long-term housing and not just shelter. But permanent supportive housing is the gold standard. When people get into permanent supportive housing, there's a 90% chance that they will not return to homelessness. And it doesn't matter whether they have a behavioral health issue, whether they're chronically homeless. When people have a place to live that they can afford, then they're no longer homeless, and they're very unlikely to return to it.
Thank you, Liz.
Thank you, Kendra.
Thank you.
We can do it. We can do it.
Okay. Ms. Hurst, you said this is the first city that has put money into long-term housing?
I said this is the first administration.
What do you mean by that? I mean,
that's actually using city dollars, to the best of my knowledge, for not PHA. PHA, I'm not talking about PHA, I'm talking about our city dollars. Am I wrong about that?
Ms. Hurst, hold on. We've been talking about
Can't hear you.
Funding developments for years that have done long-term housing.
Yeah, not development. Right. You're right. Not the development. This is just rent subsidies for people from the homeless system exclusively.
Okay, I'm just saying. You're saying we've never funded, but I know that's not the case.
No, through homeless services, we get 10. You're right. We get 20% of the units that are created through DHCD, which is largely state and federal, and some city housing trust fund.
Yeah, okay.
Stand corrected.
Just to respond to what you said, you said we've never funded long-term.
No, through homeless services. Sorry for lack of clarity.
Cool. Okay. I think we will have callbacks. I know there's a number of members, but as Councilman Johnson and all of us have been saying, this has been a somewhat challenging budget process from a time perspective.
Council President.
Yeah.
Can I humbly can I request some of my time to ask Liz Hurst a question? Since I punted my last time, or we on a time constraint?
Well, we have the Office of Children and Families coming up, but my biggest concern is that we have over 20 people for public testimony registered. My concern is that if we string this out too long.
Yeah, I'll defer my time.
So, if we can get a couple of quick ones in, we really need it.
Yeah, just a quick question was to Ms. Liz Hurst. I just wonder, can you just do a real quick overview of what's the city's strategy and plan for those who are disabled? I have a special interest of individuals who are gunshot victims who need housing, right? But also individuals who are disabled overall, but particularly that population. We talk about the homicides that are happening in the city of Philadelphia when it comes to gun violence, but we rarely talk about those who are survivors who are severely disabled. And most of that I meet are in need of housing. So can you just give me a real quick overview of what's the strategy and the plan to address that issue from a gun violence survivorship standpoint?
Yeah, it's a really good point. I guess the first thing is the people with disabilities are among are the highest priority when we do have existing resources, so they would be prioritized. And I will tell you that we have people living in shelter who should not be in shelter. They should have a place to live because they are in wheelchairs or have other mobility challenges. So we work with PHA. We have what are called Section 811 vouchers for people with disabilities and what are called 804. It's just, alphabet soup of, but those resources are, they're inadequate. And I think that's why with the new American Rescue Plan that we would really want to prioritize that no one who's an older adult or a person with a physical disability should ever be in a shelter because it's just, it shouldn't be that way. So I think that would be a priority. But right now we patch it together as best we can to try and get them the services they need.
Thank you.
Okay, thanks. Councilwoman?
Also, there is still development going on for accessible units. That continues to be a priority through planning and development and through PHFA, I mean, that funding source. It's just, I think we're still running, there's still not enough.
Councilwoman Gimm, were you trying to say something?
Yes, just a very quick statement, because I think Liz said something about, the significant reductions in homelessness. And while I want to acknowledge that there has been good work that the department has been doing, there's been a number of news stories in the papers that say that Philadelphia certainly under-identifies young people in particular that are experiencing homelessness at higher rates than any other large U.S. system. So we have a lot of work to do. I just wanted to clarify that youth homelessness in particular is an area that we are not doing a great job in accounting for, and we need to step up on our both our definition for it, our accountability for it, and thus our strategies around how to deal with that. Thank you, Council President.
I would say that, in fact, we're spending nearly $3 million a year on youth-dedicated programs. We've added 2 youth access points. We've added youth mobile assessors. We've added youth rapid rehousing. We've added youth permanent housing. We've added youth shelter beds. We've added youth navigators. And we've added, through our point in time count, we've added youth who have gone out for the last 3 years to identify other youth. We've incentivized their answering services to make sure that we don't undercount them. So I guess I would rather it not be on the record something that actually, in fact, we really are. We can always do more, and we want to do more. But I don't want our system to be characterized this way.
Council President, can I make clear something? My statement was not an opinion. My statement was based on a report commissioned by the state that shows that we undercount youth homelessness. So you can certainly list out the things and we can have a further discussion, but we still need to acknowledge that there is work to be done. On that, I think we can agree. And we should continue to evolve our strategies so that we can get better at what we do. This is not about an accounting. So I just want to make clear that this is not me issuing an opinion here. We just have to get better. That's all. Thank you very much.
Councilmember, I think we want to acknowledge that. I think the report you're referring to was by Research for Action, which was, and correct me if I'm wrong, but it was specific to school districts identifying homeless individuals. And so it was not taking into account all of the homeless systems and the work we're doing. We know that it is very difficult to count homeless youth, and that we've been trying to innovate and improve. But that report was specific to within any community across the state, the role of their school district in doing that work.
Yeah, I just think we have work to do on all of it, and we should be coordinating. The district is part of our city, so thank you very much, President.
Thank you all, and we will probably 90% likely that we'll be calling you guys back because there are a lot of questions I know the members had that were not necessarily answered to this level. And I'm sure some things you all would like to get out. So we got a couple of callback days scheduled just for this particular purpose, and we will be having that hearing on the 42 million. We're probably a little beyond the 42. And you're saying thank you. I'm not sure you're going to be saying that at the hearing, but okay. Thank you. God,
I think we fundamentally agree.
All right. Look, we're about solutions-based. We're a solutions-based council, and we have to, confirm. We have people every year coming in telling us various things that they've done with their departments, and yet we continue to see the same old challenges out here. And I'm sure people say that about us, but at the end of the day, there is an opportunity for people to give us a scorecard. It's called an election. Bureaucrats, and not to suggest that that's a bad word, they tend to be around, right? So all we're saying is that it's our responsibility to confirm all of the data that's been put out there and to confirm the testimony, and we're going to do that. So Again, thank you guys for your hard work. We appreciate you all, but we have to move on to the next group, because we do want to be able to get the public in here today at some point today in a reasonable time frame. So thank you. Dr. Farley?
Yes, I'm still here.
All right, yeah, I almost forgot that this was actually your group. Kind of got off sidetrack. But Dr. Farley, thanks a lot. Now, I'm sure we'll be, I'm not sure if we'll be calling the entire team back, but there will be some callbacks on a couple of aspects of what was talked about today. And thank you again, and we look forward to working with you on some really, really good strategies. To Councilman Thomas, I know you referenced strategies that we need to be doing to get people vaccinated. We concur. Actually, the mayor called me one evening and expressed his concerns about our ability to reach people that have not made a decision or beyond hesitant. So he said he wanted to have some input from council on how we do this. So we're going to establish some sort of process. But we got to get these folks vaccinated. That will really allow us to move forward as a city. So thank you all very much. Mr. McDermott, who's our next witness to testify?
Cynthia Figueroa, Office of Children and Families.
Thank you very much. Ms. Figueroa, please state your name for the record and please proceed with your testimony.
Sure. Cynthia Figueroa, Deputy Mayor, Office of Children and Families, and President Clark and members of council. If you will allow me, I'm going to greatly reduce my verbal, so I know that there's already anxiousness to get to the questions, so I'm just going to highlight what you guys have mentioned is that a lot has changed over the last year, and we're incredibly grateful for council who's been supportive to us in our work. I just want to highlight that the Office of Children and Family includes the Department of Human Services, Parks and Recreation, the Free Library of Philadelphia, PHL Pre-K, Community Schools, Adult Education, and Out of School Time. With me today are the commissioners and directors from these departments, as well as we hope to be joining us today is the new chair-elect of the Free Library of Trustees, Velasquez Olampin Lewis, along with other leaders. So I'm going to cut to the chase and thank you for the support you've shown for our departments, and jump really right into answering questions around our FY22 budget and other questions around our operations. Thank you very much.
Oh, I think you broke a record.
I mean, I can jump back in if you want me to.
That's great. That was awesome. All right. Well, let me get into it. I actually wanted to jump into because I know there are going to be a lot of questions for this particular department also. COVID-19, I want to get into the Parks and Recs. I'm going to get into Parks and Recs. I guess we have the Parks and Recs Commissioner on.
Yes, Catherine is on with me as well.
Okay, all right. So first, it's a general question. Can you kind of tell us how the COVID-19 has impacted the residents' demands regarding the services, your rec centers are shut down and then open on a limited basis. And, we know that is probably a significant contributor to some of the challenges that we see out here during the course of this pandemic, for young people and older people not being able to access those sites, and where we are now and where we look to be, hopefully in the nearby future.
Sure. Hi, this is Catherine Outlevel, Commissioner, Philly Parks and Rec. Yeah, we absolutely know that folks have been impacted, certainly by COVID as a whole, but certainly COVID's impact on our ability to provide services to residents. We have continued working throughout the pandemic at Parks and Rec. We've had staff working throughout. We had a very robust summer last year, as many of you know, with summer camps running in play streets and meal distribution, et cetera. And this fall, we transitioned to providing virtual learning spaces at 40 of our centers for thousands of kids to have access to virtual learning for school at home. And now we, just a few weeks ago, we started transitioning to opening. We have 118 centers that are open between 12 and 8 every day, providing programs and adult supervision and activities at those centers throughout our system, and we are gearing up for a very robust summer again. We're hoping to provide about 130 summer camps. We're gearing up to open over 60 pools, 130 spray grounds. We're planning to run our Play Streets program again like we did last summer with about 300 Play Streets. So yes, we definitely know that folks have been impacted. Our staff have certainly worked incredibly hard to continue to provide as many services as possible, including meal distribution at all of our sites, but it's been a huge challenge. I should mention our older adult centers also opened up last month, so they are now safely serving seniors again in person. All of our sites were doing virtual programming, over the last year, in addition to meal distribution and other activities like that, but the older adult centers are now open as well. And I should mention we had 35 gyms open since January as well.
Okay, that's good news. That's good news. Let me ask you about the recreation facilities. This has been a conversation for a number of years, the classification and qualification of workers at the rec centers, Rec 1, Leader 2, blah, blah, blah. And there's always been a question, and I actually had on an interview last week with a national newspaper talking about challenges for people in communities of color. So this issue about who can actually be a rec leader and who can actually work at the rec center, and we all know that there in a whole lot of rec centers across the city of Philadelphia, there are people who are like presidents of advisory commissions, councils, people who care about the park, recreation, all the types of activity. They are non-paid positions, non-city workers. And they do, and I hate to be critical, but in some instances, very few, they actually do more work than the person that's getting paid as a rec leader 1. I'm just calling it like it is. We talked about how these folks could have a pathway to being a rec leader 1 or some capacity as a civil servant or working for the city of Philadelphia at these rec centers. Where are we at with that? Are we still in the discussion phase, or have we moved forward on a real strategy for that?
Sure.
So beyond the provisionals, I know we do the whole 6 months.
Yeah, so all of our recreation leaders are civil service positions. So there's there's specifications for those positions that are set, including certain qualifications. But 2 years ago, we worked with the Office of Human Resources to really look at our recreation leader hiring from a racial equity perspective. And we did a huge overhaul of how we hire recreation leaders in 2019. And we continued that process again with the most recent announcement for recreation leaders in 2021 that just happened last month. So that process included looking at the specifications for the recreation leaders, the qualifications necessary, broadening out those qualifications, but also doing a much better recruiting job than we've ever done, which was limited, to say the least. So we recruited from within our seasonal base, which, as you mentioned, those are the folks that are really looking for the full-time opportunities. So not only did we recruit from our seasonal base, we also did effectively hand-holding of those individuals to make sure they could make it through the civil service hiring process, which can be challenging for anyone. And then we offered information session at recreation centers. We offered just a whole overhaul of how people are interviewed for the test. The biggest thing that we did was we eliminated the written test for that position, and we moved it to an oral examination. And we saw incredible improvements in terms of racial diversity of our recreation leader trainees by using that process. And we saw just a huge increase in the number of folks who had already been, as you're saying, other roles in our system, whether they were coming from the community, whether they were an assistant rec leader and just trying to make their pathway up into becoming a rec leader. So we saw really great outcomes from that process, and we'll continue to evaluate that to make sure we have pathways for folks in the future.
Well, give me some numbers.
Sure. We saw people of color specifically increase between 2014 to 2019 by 107% on the list of people that that were eligible to be hired as a recreation leader trainee.
So 107%.
Yeah.
Starting at 2, that's not a whole lot.
Yeah, it was pretty significant. So, for example, in 2019, and Council President, I have to go back and check my numbers, but I believe in 2019, with the top 12 people on the list, so we actually pulled 26 total people off that list. But the first round of hires, we had 13 vacancies. So of those top 13 people on the list, more than half of them were people of color. In the last 13 that we just hired, in the last 3 weeks, they're onboarding as I speak. We had 13 people we hired, and 8 of them were people of color. So the vast majority of this latest round were people of color, and we feel.
I'm going to ask you that question again. Give me some number. How many people that are currently serving in the capacity of rec leader 1, 2, whatever, are people of color, and people that are not of color?
Yeah, I'll have to go and get that exact information because I'm going on my memory. So we can certainly provide that to you.
Yeah, I'd like to get that today, if at all possible.
Sure.
All right. Speaking about this whole equity lens and racial lens and all the other terms that have been thrown around. I call you all the time about East Park and all the other things. So years ago, I got beat over the head to put $1 million of my ITEF funds in the Discovery Center. And I had people twisting my arm and everything, about building the Discovery Center up at 33rd and Oxford in East Park. And I know technically, before Councilman Jones says that's actually technically his park in his district, we appreciate the fact that he's supported us in funding it. But at the end of the day, the adjacent community is in my district. And we funded it, and I had some reservations, and the thought was this Discovery Center, which, by the way, is an awesome facility. The likelihood that it would be something that would be utilized by the local communities of color, because it, focused on, outward bound, birds, environment, a whole lot of other things. There were some concerns. We had a hard time actually getting that group, and although they got private once they got the funding, we all thought it was a city-sponsored initiative, putting one member from the community on the board, and I understand now they're looking at possibly doing 2, which is like amazing to me. But to date, and this is based on what I'm being told, what I see, there's really not significant level of usage from the local community for the Discovery Center. And while we understand it was private money put in that deal, a significant amount of private money, as was said in the hearing earlier this week, you can't have private money drive the decision of the investment of public money if it's not going to be done with the quote-unquote equity lens, because too frequently that leaves people of color out of the mix. So what are we going to do about that? So, I mean, it's great and all that, but people in the neighborhood are just not using it.
Yeah, so we lease, as you know, Council President, we lease that facility to Outward Bound and Audubon Center. I think it's a conglomeration between the two that actually holds the lease for that land. So that's definitely something that we can check back into with those groups to find out. I too was very involved in that process and those concerns, coming from the Strawberry Mansion community specifically. So it's been some time, especially during COVID, since I revisited that. But I'm happy to go back and reach out to that group that manages that facility and inquire about where things stand, and also through our work in the East Fairmont Park Coalition, et cetera, talk to the community about what what those concerns are, and to revisit that if that's what you're hearing. We can absolutely do that.
I would suspect everybody's hearing that. This is not new. People have been talking about this for a minute. And as I said, there were reservations about that site up there. There were stories told about, back in the day, the reservoir and access to the reservoir for a jogging track was something that everybody had a history with, even back in the old days when I could actually jog. But to take that away as a result of this Discovery Center, and I'm kind of dismayed, so to speak, that you suggested somehow you didn't know that was a problem. As it relates to uses from the community. I mean,
I definitely know about the history of the issues there. I just mean over the last year, I haven't been as in touch with them. Yeah. So I'm happy to revisit that now and get a better understanding of where things stand. Absolutely.
in very meaningful ways. And I'm just building a theme because, and I'm being very frank, and I know this is a public venue. This whole issue about park usage has been a conversation, sometimes quietly, sometimes not so quietly, particularly in the areas where parks are adjacent to communities of color. And I talk to you about this all the time. There was supposed to be this master plan for the entire 33rd Street corridor. This area over here, 33rd and Oxford, I'm consistently concerned because I've been seeing more and more uses from individuals who are not from that community. I know this is a public park, but I'm concerned about the fact that we're not engaging people in that local community. I called you 2-3 months ago, and this happened actually after, again, when myself and a couple of members from the community and the members of the park staff went out to the site to look at the site behind the golf range, and we were accosted by members of the disc golf and wanted to know what we were doing walking through their site. I'm like, wait a minute, hold up. Do you own the site, right? I mean, could have gotten ugly. And then 3 weeks ago, a similar situation. And this whole thing about entitlement and ownership, and I don't know about any other parts, but I know about this one, is a real problem. And I think we really need to be, one, acknowledge that it's an issue, and two, acknowledge that we have to make people from that local community feel that this is a park that they have loved and used for a lot of years, and they're feeling like they're getting pushed out of that. And it's happening down in the other, in their diamond, where the baseball fields were, where there were baseball leagues that were primarily softball leagues. Again, back in the old days when I could play softball, I used to play down there in baseball, right? They're no longer there. All of those ball fields are gone as it relates to local community people. So it's just this theme about uses of the park, similar to the tennis courts. If we're not proactively talking to the people from those communities, people of color, then I can see where, and it's quickly approaching that, where people in those local neighborhoods don't feel that that's their park anymore, and that's a real problem. So I'm going to emphasize it again. Again, I don't normally do this in a public way, but I'm that concerned. All right.
Yeah, Council President, I hear you loud and clear, and absolutely, we are. So the first thing about the stables back there behind the golf course. So we're
not supposed to talk about that yet.
Oh, okay, sorry.
Just so you left that off. Yeah.
Okay. Well, we're actively working on several projects that you have graciously recommended out there at 33rd and Oxford. So I was literally going to call you this week to talk to you about the design firm that we want to engage around 33rd and Oxford. So we absolutely want to move forward those projects. We've also hired Tanetta Graham from Strawberry Mansion CDC, who's working with us on community engagement for projects around advisory councils, some other things. So we hope she'll be able to help us with that engagement out there as well. And then I hope, working with Rebuild, that the Mander Rebuild project can begin soon too, because I know for the community out there, that is their number one priority, is to see Mander. They did a great master plan out there, and they want to see that master plan implemented. So I totally hear you, and we want to support in any way that we can. Totally agree.
Thank you. Okay, I'm done on my conversation about that for now, but I can't emphasize enough that that's a real problem, because Mander Playground right now, in the community's mind, is the only site left that has significant community uses. That's a problem. So thank you, Commissioner. Chair recognizes Councilman Johnson.
Thank you, Council President. This question is for Department of Human Services.
I believe Kimberly's on with us, the DHS Commissioner, Ms. Sali.
Thank you, Commissioner Ali. I'm also giving a shout out to Cynthia Figueroa as well, who's been also working with us, Council President, around this issue with gun violence, and work with some of the local groups that are out there on the front line. And so just want to acknowledge you for your hard work and dedication. I also want to give a public shout out to someone who hails from South Philadelphia, the Point Breeze area, which is Commissioner Kimberly Ali. And so thank you, Commissioner, for being here. Just want to get an overview of the work that's taking place at the Juvenile Justice Center with our young people. I have a strong emphasis around just making sure that we're stopping the streets of prison pipeline. And so obviously making sure that the juveniles who are, I still call it the Youth Study Center, but the Juvenile Justice Center are part of our overall strategy to address the issue of youth gun violence here in the city of Philadelphia, and how we could be supportive of wrapping our arms around those young men and young ladies who are currently locked up at this particular stage in their lives as juveniles.
Yes, so thank you for that question, Councilmember Johnson. I'm Kimberly Ali. I'm Commissioner for the Philadelphia Department of Human Services. The Juvenile Justice Services Center, that I will call the center, as you know, is located at 48th and Haverford, and it is a detention center for young people who are either awaiting disposition or who are waiting to move on to placement. We recognize that this is an opportunity to engage the young people because they are a captive audience, if you will. We offer several programming for the young people at the PJJSC, but I do want to quantify that and to qualify that in that it was hampered as a result of COVID. As you know, any detention center, it is a congregate care setting, was certainly high risk, so we had to do some mitigating strategies in order to prevent the spread of COVID, and we have been extremely successful with preventing that spread. But to give you a sense of some of the programmings we offer Community Power. So Community Power actually offers like poetry for young people. They write music and songs. So that is a program at the PJJSC. We have Uplift Center for Grieving Children. We have a Transformation Yoga Project. We have Mural Arts, Claymobile. We have Engaging Men of Color, Girls Inc., Educating Communities for Parenting. We do domestic violence. Of course, we offer on-site school offered by the School District of Philadelphia. We have medical that's on-site. We have behavioral health support that is also on-site. And then we allow young people to practice their religious preferences. So we do church virtually as well as Jumar virtually. So again, some of the program was certainly impacted as a result of COVID, but given the fact that we have a number of staff who have been vaccinated, as well as some of our providers who are vaccinated, we are slowly bringing those programs back online.
I have another direct question. Is Department of Human Services, particularly the Juvenile Justice Unit, are you a part of the Office of Violence Prevention, and as well as the administration? I think it's called Roadmap to a Safe Philadelphia Strategy Sessions and Team. Do your team meet with their team weekly around strategizing on how we address gun violence, particularly as we support the youth who are at the Juvenile Justice Center, as well as the youth who are on State Road? And the reason why I want to ask that question is because I'm on the ground as elected official, so I'm usually out in the community working on this issue. And so we hear the stories regarding the neighborhood turf wars and the beefs and the social media beefs and how they go from in the neighborhood, but also carries on inside the Juvenile Justice Center, right? Because you have different young people from different neighborhoods, different parts of the city. And so I think it's imperative that there's a connection between what we're doing overall when it comes to addressing gun violence, and the statistics shows young people, the people are becoming younger and younger. So I want to get, so are you meeting with OVP and their team?
Yes, so my team does meet with the Office of Violence Prevention, as well as myself. I have been at the table with them, particularly of late. We do not meet weekly. Certainly have communication about weekly, but we meet on about a month.
So I want to put a little pressure on you. So basically what you're saying, if I interpret that right, you don't meet, I think their team meets, if not weekly, bi-weekly. There is an actual team that meets. It's OVP, the police commissioner, I think it's courts, but there's a group of them that meet. And so you're saying you're not at the table, particularly the Juvenile Justice Center with a representative, when they meet on a regular to talk about the Roadmap to a Safe Philadelphia, GVI, and other initiatives. Is that correct?
That's correct, not weekly. That's correct.
Okay. No, I just want to just say, just for the record, and I think it's imperative that, maybe your team and maybe, the individuals that run the Office of Violence Prevention, like, you should be incorporated. Your team should be a part of that process And I think what we're all trying to do from a collaborative standpoint is connect the dots around how important it is for us to all be on the same page with a zero-like focus around this issue of youth gun violence. And if you're talking about young people who are making decisions to pick up guns, right, it doesn't take a rocket scientist to recognize that if we're going to stop the street to prison pipeline, it starts at juvenile justice center, it starts with our school district. And so I just think it's imperative that, at some point in time, everyone will be in the same room reading from the same playbook to address the issues that we're facing, particularly around youth gun violence. And so we'll probably circle back in the near future, myself and my colleagues, to see where we're at. But I just do think it's imperative that all of, like, your team should be in the room, particularly around this issue of gun violence, with those young people who are either on state road and the young people who are also at the Juvenile Justice Center. And so, and anyway, I have to be supportive in addressing this issue. I'm sure that that my team that's working on this, we will figure out how we can, one, get to the bottom of it from a supportive standpoint. But if we're going to save our youth around the issue of gun violence, then it's imperative that DHS is at the table. Because after I had the meeting with your team about a couple of weeks ago, it actually dawned on me that Juvenile Justice Center is under DHS. And so young folks that carry the guns that's involved in the gun violence and the shooting actually are under the DHS jurisdiction. And so we want to be supportive of that process to help save our youth. And so
I just wanted to interject for a second, if you
sure.
mind, Council Member, that they recently on that thread, because we couldn't agree with you more, they recently have asked me to join because of the summer planning. And I think, yes, we agree, and there are a number of project-specific issues that Kim and Erica work on, so there's definitely a lot of communication, the idea is also...
But all due respect, Cynthia, right, and I know you run the Office of Children and Youth and Human Services, right, but on this one, I would like, I think, because I know it's under your jurisdiction, but she is the commissioner.
Oh,
right?
I agree.
I think Juvenile Justice is like under her purview with her team, right? I just think that I know you're there on a broader scale, but probably more direct access and involvement from her particular team that's responsible to her, that oversees the youth at the Juvenile Justice Center, should be meeting with the Office of Violence Prevention, GBI, the court, juvenile justice team. They should be intricately involved in that strategy. At least that's how I'm looking at it from the outside.
I agree. I just wanted you to know it wasn't a completely cold line. So okay. I agree with you.
Cool.
100%.
Yep.
I'm not. 100%.
I'm aware of the work you have been doing when it comes to gun violence, and we talked about like curfew centers and things of that sort. But now I'm zeroing in on a deep dive of the young people, and so I just wanted to state that for the record. And we're here to collaborate and be supportive so we can get this thing right to save our youth this year.
And I definitely want to just add this one point, in that I certainly recognize the urgency. Certainly will make sure that we do a more integrated approach and are visible. One of my staff did just text me and said that he participates weekly. He is on the prevention side, though. That's David Bruce. He's direct on the prevention side. I need to make sure that Michael Scott, who is actually the executive director of the PJJSC, is also at the table. So we'll make sure that we have the right people at the table.
Okay. All right. Thank you very much, Commissioner.
Thank you, Councilman. Thank you. Chair recognizes Councilwoman Gim.
Thank you very much, Council President. And I'll, just echo what Councilmember Johnson said. Obviously, one of the reasons why we want you there is in part because our strategy, you are thinking about this through a child's eyes. I mean, that's the goal of your work. And too often, when young people enter the justice system, they're immediately seen from the criminal aspect. But we need a new set of eyes on this if we're going to get any chance of saving young people's lives and ensuring that our city is healthier. And I think we can all agree on that, but I think that's part of the urgency. We simply just don't have enough people looking at the situation through a young people's lens. And that particularly matters because since January 2020, as we know, more than 750 children have been shot. And there's been untold and continuing harm done to not only themselves, but their families and their social networks that's reverberating. We are trying to get a handle on zeroing in. We know that the majority of these young people are Black and brown. We know that there are 25 schools which encompass 50% of the students. We know that there are 10 zip codes that are most impacted. And so I want some of my questions to be zeroing in on them. And Cynthia, Commissioner, Deputy Mayor Figueroa, I think, I'll start by talking a little bit about a couple of clarifying questions on out of school time. So can you clarify how many out of school OST slots are available currently? And is it an increase or a decrease since, say, summer 2019? I don't want to use 2020 as a standard.
So just so I understand your question, you're asking for the summer, not for their current use.
Why don't we do summer and then year round?
Okay. So it is a slight increase in the total number of OST slots that are going to be available this summer because we're partnering with the district. So we have 6,000 academic slots, and then there's another 996 community-based slots. We usually run typically somewhere between 4,900 to 5,000 slots just in OST, including the older youth. Now, in addition to OST, we have the older youth providers are going to be operating the work-ready slots, and we're targeting this year 8,000 work-ready slots. So we actually look like we will have more availability for youth this summer than we did last summer.
Okay, so work-ready was not available 2 years ago?
So work-ready was available 2 years ago, and it was available last year. Last year was virtual only. It was 6,000. And the year prior, I can get the exact number, or if Waleska's on, I think we reached just shy of 8,000. So we're basically trying to return back to the levels that we were in 2019.
Do you remember what the application pool was like 2 years ago for those 8,000?
You mean the total number who applied? I don't have the 2019 number off of the top of my head, unless Waleska, you
said it was like more than double. Does that sound right? More than double the applicants?
You mean more than, so more kids apply? I believe there were more kids that applied than we ended up having slots for. As of right now, we have 5,500 applicants, so we haven't exceeded the total number of slots yet available. So there's still availability for the work-ready slots.
Okay. And then, so the work-ready slots cover older students, teenagers, is that right?
Yeah, 13 to 24.
And those do not operate solely through the school district, is that correct?
That is correct. They do not. They are, they're independent. They have some slots, and then the largest actually work-ready site provider is Parks and Rec. So we have a number of youth that are in Parks and Rec as part of a work-ready program.
Okay. So we have about 1,000 more slots this year for this summer than we did maybe 2 years ago. Is that correct?
That's right.
Okay. And I think what we are trying to, we believe that your work is in particular right now core to violence prevention. It's core to meeting families' needs. I think it's core to some of the trauma supports and things that people have been asking for. And so what I want to understand is, like, we basically are not seeing any expansion on work ready for older youth between 2019 and now, given the crisis that we're in. And we see a marginal expansion. I wouldn't really call it so much of an expansion, given the fact that there are so many kids, right? I mean, we're talking about for the number of teens, if you estimate even just like 12,000 a grade, in Philadelphia school district schools alone, roughly, maybe you'll do a little less, 10,000 a grade. You could talk about 40,000 school district teens, and that doesn't even include the number of teenagers who go beyond in charter schools and other places. So I guess, like, when we're talking about need, is there an ability for us to talk about guaranteeing them. You know, we have this list of 25 schools, right? These are where 50% of the kids who have been shot are housed in just 25 schools. By the way, only 8 out of the 25 are school district schools, right? The others are operated by alternative providers or charter schools. Is there a possibility for us to work together to guarantee those young people in those schools OST supports, to target it, or to take a look and guarantee, like, you know, one of the complaints we hear is that these young people don't even know about some of the resources that exist in high impacted zip codes by gun violence. Could you assign a navigator to help families get their children access, so that you'll see council offices fielding calls time and time again from families that don't know where to go, are desperate for supports for their young people, would love to be able to guarantee their teenager a job or a program or some combination of both. But we can't even get, like, we have to go program by program. Could you guarantee a navigator? Can we guarantee that those young people in those 25 schools could get a work-ready slot? And if we have to expand those slots, we should be campaigning to do that.
So thank you, Councilwoman. I know you're incredibly passionate about this, as am I. So I failed to mention 2 pieces. One is that I think it's important that COVID was like a lapse that none of us want to remember, and that it's always good to look at 2019, because what we had in 2020 was such a scaled-down version that I keep focusing on the enormous gains that we're making from last summer, right? There was like hardly anything available for youth last summer that was in person, and now we're going to have a lot that's available. I failed to mention that one of the major movements that we've been able to make with the school district is to have access to additional school district buildings that will be non-academic sites. So that's a whole nother, and we're finalizing those numbers. That's a whole nother group of kids that will be added to that slot number. So we could actually be well above more than 1,000, because these are like the non-traditional providers that Councilman Johnson mentioned, that we're working with some of the violence prevention programs that for the first time ever might have connections directly in doing some of this work, as well as athletic programs, because we know when we're targeting older youth that they're not really interested in going to summer camps. So what we're trying to figure out is how to create as many possibilities as available for that 13 to 17 catchment. And so I just want to highlight that there's additional slots. We're just finalizing what those numbers will be. Right now we have about 29 additional spaces in the school district that we'll be using with a new provider. So we're very excited. And PAL has committed, and a huge shout out to the police department, to expanding their hours and their availability. So we're going to have 1,000 PAL slots this summer. That is also a new thing that we're putting online. You mentioned the navigator, and so we should probably talk about that more, like what would that look like? Because I think the needs of the kids and the schools that you talked about, where a number of the shooting victims are, the interventions, which I think is what we're most interested in, is how do we target those schools? Yeah. And so the last thing I'll add is that we are working with the charters as well, because we know the charters also received the American Recovery Plan dollars, and a number of the charter operators, the larger operators, are running significant programs this summer as well.
Okay, so clarifying, OST is for younger children. It does not work with teenagers, right?
So it's kindergarten, first grade through 8th grade. And then we have a number of providers that are OST providers who do the work ready in the summer, and they work with the older youth.
Okay, so work ready is, I'm understanding, what is the plan for the 13 to 17 or 13 to 18-year-old group? And that's, you're saying, is work ready.
Right, and it's based on this. So you could have a 13-year-old who's in 8th grade who does camp versus work ready. So it all dependent on that. You know, you might have a younger sibling, so the family wants both the kids to be in summer camp. So if you're a 13 to 24-year-old, you are eligible and can apply for the work ready. There's also a number of programs we've been working on elevating through the Office of Youth Engagement, like the VAX ambassadors. getting youth into other events that are going to happen over the summer that their office is supporting, and then as well as the athletic programs. So some of the programs that we're putting into these non-academic sites will be running, like basketball leagues, will be running other activities, and so there'll be some targeted programs. So I don't have, the problem is I don't have that catalog of all the options completely finalized.
So I want to go back, because basically what I'm trying to underscore, and I think you understand this, right? We simply do not have enough slots to meet the demand that's out there. We know this from 2019, where our understanding was, and people had testified to this in hearings, that there was something like 19,000 some applicants that I recall hearing at a hearing for 8,000 slots, and that was back in 2019. Now we are here where the desperation and the concern is even greater. Young people being out of school for so long, as we head into summer and around year-round time period, we do not have enough slots to reach the 13 to 17-year-old groupings, for young people right now. And the question is, what is available for teens? What do we have to do to expand those options? And then in the 25 schools and in the top 10 zip codes, what are the guarantees that we can give to them?
Yeah, we definitely look to focus on very specific areas and work with our providers to target, as well as we do a set aside for JJ related or JJ involved youth for our work ready. Right now, we're not at our max. We're not seeing the level of interest that maybe in 2019. So we still have some time to go before the applications are finalized. But like I said, we have 5,500 kids who have signed up for the work ready slots.
And those are 13 to 17-year-olds?
Those are the 13 to 24-year-olds.
Okay.
Not, and in addition to that, there's other availability through other summer job programs. There's the seasonal job programs through Parks and Rec. There's lifeguards. So there's a lot more than just the work ready slots that are available for job related programs for older youth.
And none of the OST spots are really reserved for teens unless they're in 8th grade. Is that right?
The current, right now, the way that we've constructed the work with the school district, it's up until 8th grade, yes.
Okay. And this is there's not been an expansion of this work since 2019. So the same number of work-ready slots were available in 2019 as we hit a crisis right now in 2021. Is that right?
So, right. So one of the most important things to note is our city didn't cut the funding. The majority of cities, including New York, eliminated this funding. So the fact that we even maintained any funding last summer was significant, and the fact that we were able to maintain the OST network, because the other issue is capacity. So even if we got funding...
If you had the money, would you expand it?
If we had the money for more summer work ready, we would need that money in a subsequent budget year, and then we'd have to make sure that we had employers fill those slots. That's the capacity issue. So making sure that there were enough physical places to then assign children to.
Okay. I'll come back on the second round. Thank you, Council.
Thank you, Councilwoman. Chair recognizes Councilwoman Bass.
Thank you, Mr. President.
Well,
so I have a few questions, and I want to start out first with DHS. And we did, thank you very much, Deputy Mayor Figueroa and Commissioner Ali, for the briefing that you gave my office recently regarding DHS and the improved outcomes for children and the work that you've been doing. I wanted to go back over something that we talked about during that briefing, which was the KUA scorecard, and the fact that the KUAs went from when the original scorecard came out, and I think it was 2017 or 18, the average grade was around, I would say, a D. If I had to, I know you have like a little, like a Liberty Bell system, but if you went by
we know your school teacher tendencies, Papa.
Exactly. So I'm wondering if you can give me a sense of how did we go from a D to now, from our last meeting, you said that they were roughly at around a B. What did we do differently that got us those outcomes in such a short period of time. We don't want to have anyone thinking that we're cooking the books here. We want, we can lay out the information in terms of how we got from one point to another. I think that will be very helpful in the short time.
Absolutely. Thank you for that question, Councilmember Bass.
You're welcome.
So I would say, as you indicated, that the first scorecard was issued in FY17. And so the most recent one was FY20. So we have 4 years of data. And so what we learned from FY17, 18, 19, and even what we learned for FY20 is, number one, the COAs needed a clear roadmap in terms of expectations. And our expectations around providing quality services for young people. So whether they are receiving in-home services or placement services. So we believe that because the scorecard was so specific in terms of the expectations for COA case managers and supervisors, that we were able to create a better roadmap in terms of what does case management service delivery look like. As you indicated in FY17, it wasn't pretty. And so what we did in FY17 and what we do anytime that the COA doesn't perform optimally is that we have them create a plan of improvement. So they create a plan of improvement and they work with our DHS University, which is our training and technical support arm, as well as our performance management and technology, so that we can monitor and develop strategies that are led by the COA, but certainly approved by us, to ensure that they achieve better scores around their service delivery. So we believe that that certainly helped the technical assistance that was provided by DHS University. In addition, at the COAs, we actually have staff who work physically on site, but now they're virtually on site, that we call senior learning specialists. They are master prepared DHS social workers who walk alongside the COAs to ensure that they are providing quality services. And then we also have practice specialists who are DHS social workers who are also co-located at the COAs. And really the purpose is, again, to make sure that the service delivery that they provide to families are optimal. And so, yes, happy to report that this was the first time, FY20, in which we had 2 COAs that achieved 5 bells, which was our highest level of bells. And then in addition to that, we had 5 COAs who achieved 4 bells. 6 COAs who achieved 4 bells, and then the remaining 2 achieved 3 bells.
Okay. I hear what you're saying, and I have my concerns regarding the COA system, which I've expressed to you all before. I just don't know how you can pay less and expect quality social work services, and when we're paying considerably less. This was a cost-cutting move, I understand. Everybody's trying to tighten their belts, but when it comes to vulnerable children in particular, I just don't think that this is an area where we can cut corners. And I think that not having the level of expertise of social workers that we've had in the past, I think it's led to my second point, which was child displacement. And I know that over the years, we've had a number of hearings regarding child displacement and the fact that Philadelphia had the largest number of children, particularly Black and brown children, who were displaced or taken from their homes, often for poverty-related reasons. And so I'm wondering if you could talk a little bit about where we are with that. I know we had a briefing, but if you could just be on the record so that we can let the public know where DHS is with that.
Yes, so thanks again for that question. So as you indicated, DHS is a jurisdiction that had one of the highest removal rates. The last data that was reported by Casey Family Programs was actually in 2017. So we are anxiously awaiting the updated data, because we have certainly seen a decrease in the number of entries into the child welfare system. So we've seen a 37% reduction in placements in the child welfare system. As you indicated, when we look at our reports that come into the hotline, most of those reports are not Child Protective Services reports that we call CPS reports, which are physical abuse and sexual abuse. Most of the reports are General Protective Services reports that speak to a service need for the family. And so one of the things that we did to ensure that we reduce the entries into the child welfare system is develop screen out units on our hotline so that we can take a second look at those GPS reports and divert them from formal child protective services by providing a prevention service for families. And so we believe those efforts around investing in prevention services, investing in concrete goods is certainly what is helpful for our families. In addition, although our reductions into the child welfare system have decreased significantly, we still have an issue with disproportionality. So as you indicated, young people who are placed in the child welfare system are disproportionately Black children. So we embarked on a disproportionality entry rate study in 2019 with the University of Pennsylvania as well as Casey Family Programs so that we can look at the reasons that lead to disproportionality. It's actually a 3-phase study. The first phase has already been completed, in which there was a data analysis that was done looking at 29,500 children. And of those 29,500 children, 93% were actually diverted from our child welfare hotline. 5% received in-home services and 2% received placement services. And when we dug a little deeper in terms of the individuals who received placement services, again, we're talking about General Protective Services reports. So we know that we need to get ahead of those families and make sure that we provide some primary prevention and support so that young people don't wind up in care. University of Pennsylvania just concluded the second phase of the study, so we're waiting for that analysis. And the second phase of the study included interviewing the decision makers. So in terms of removals, the decision maker is DHS social work staff and not CUA staff. So interviews with DHS social work staff, surveys with DHS social work staff, as well as community umbrella agency staff, interviews with them as well as families who are also impacted by removals. So they just completed gathering that information, results of that study, and then the third phase will be strategies around how to address the disproportionality. But we didn't actually want to wait until the strategies because we know the study actually confirmed things that we already knew about our system. So one of the major pieces that we did was we developed a cross-systems group in which we have other city departments at the table, many of which are from the Health and Human Services sector, so that we can, again, provide supportive services when we see those red flags at the school district or, young people receiving outpatient services. How do we get ahead and address that before a report comes into the system? The other thing that we are working with the state around is looking at the mandated reporter training. And so we want to provide supplemental training to mandated reporters. And then the third thing, we're working with the Center for the Study of Social Policy. They are looking at all of our policies as it relates to the removal of young people with an anti-racial lens so that we can rewrite policy and also implement practices that help support families.
Okay. All right. Well, thank you very much for the explanation. I think that, it's been a concern. It's something I think that we have to continue to monitor and try to figure out how do we make sure that our numbers don't creep up and that they actually go down. There's nothing more valuable than a child within their family structure, whatever that family structure may be. And so the more we can support that, the better we are. So thank you very much, Mr. President. I'll come back for my next set of questions.
Thank you, Councilwoman.
Thank you.
Here recognizes Councilwoman Gauthier.
Thank you, Council President. My questions are for Parks and Rec. Good afternoon, Commissioner At-Level.
Good afternoon, Council Member.
Before I ask you a few questions, I want to talk about how we've historically funded the Parks and Recreation Department and why we need more funding for Parks and Rec than the mayor has proposed for FY22. We fund the Parks and Recreation Department at lower levels than our peer cities fund their Parks and Recreation Departments. The Trust for Public Lands, a national organization that advocates for access to green space and parks for communities, gives Philadelphia a score of 77 for its investment in its Parks and Rec system, while cities like San Francisco, Chicago, St. Louis, New York, Washington, D.C., and Cincinnati receive a score of 100. Not only is the baseline level of Parks and Rec funding too low, over the past decade, investments in the Parks and Rec Department have not kept pace with the growth of the general fund or the investments in our police department. In fiscal year 2009, prior to the mergers of the Department of Parks and the Department of Recreation, combined spending for these departments was estimated to be $52.7 million, and the departments had budgeted 848 positions combined. Now, for fiscal year 2022, several years later, the proposed budget calls for Parks and Rec to receive $62 million from the general fund for 795 positions. That's only a 17% increase since fiscal year 2009, with 53 fewer positions. Meanwhile, if the mayor's proposed FY22 budget is adopted, the size of the general fund will have increased by 43% since fiscal year 2009, and the size of our police budget will have increased by 36%. We must treat our Parks and Recreation Department like the essential service that it is. Parks and Rec has historically been under-resourced, and now at a time when we need our Parks and Rec centers more than ever, as we emerge from the pandemic and combat epic gun violence, we must fully fund the Parks and Recreation Department. I don't think a same old $62 million general fund allocation meets what this moment is calling for. We must invest more in opportunities for engaging our youth at a time when gun violence is surging across the city. And so, Commissioner, I want to thank you and your team for the Herculean effort you put in during the pandemic. You really showed up for our kids despite not having all of the resources that you need. We understand that Parks and Rec is getting a $6.7 million general fund increase for FY21, but does this fully restore the cuts from FY19?
Thank you, Council Member. You did a lot of research there. The restoration that we're getting is actually what we asked for when we were asked to submit our budget justification. So it is not the same amount as what was cut in the 2020 COVID budget, but it is exactly what we asked for from the budget office and from the administration, and that includes bringing back our pool season, doing a limited Dell season, restoring our seasonal positions, restoring our key spots, our computer labs, and our facilities, as well as some operations support as well.
Can you tell us what's the difference between the proposed $6.7 million restoration and the cuts from 2019?
I believe we were cut approximately $11 million, so that difference would be in the $4 million range.
Okay. We've heard, and you stated that park usership is up somewhere in the neighborhood of 50% during the pandemic, which is great news. But what has the increased use meant for Parks and Recreation operations and maintenance?
So the increase, I want to be clear, is not an exact number. We're basing that on the amount of trash that we're picking up. We measure the trash that we pick up, and we've seen a 50% increase in trash in the parks. And so we are assuming that's because anecdotally, we're also seeing a massive uptick in usership, but we don't actually have counters out there counting folks. But we do know anecdotally that the usage has increased significantly. COVID has certainly meant people have rediscovered parks. Parks were probably the only, the only thing that didn't close, in the pandemic. So I think people really found them to be a rescue. But I want to stress that it's not the only stressor on COVID. Hasn't been the only stressor on an increase in park usage. I think climate change has had a lot to do with it as well, in that the season is just longer. For instance, our seasonal positions are 6-month positions for a seasonal maintenance attendant. The park season is longer than 6 months now. For the past 5 years, we've had, I think 3 of the past 5 years, we've had President's Day weekends that have been above 60 degrees in February. So people are out using parks sooner, in February, and they use parks through November, which also puts more pressure on us as a system to accommodate that usage.
Thank you. And I know you might not have the answer to this next question, but this is something I think about a lot, and I want to put it on record. Too many of our parks and recreation facilities have been the site of gun violence this year and in years past. In your testimony, you mentioned that proposed funding will maintain 2 staff members on site at certain rec centers, but how much funding would it really take to ensure that all of our rec centers had enough staff to be safe sanctuaries for young people and a key tool in our city's efforts around gun violence prevention?
Previously, before we made this commitment to 2 people per centers and have a budget restoration to be able to do that, we had about 100 centers with only 1 staff member working in them. So we do see this as a huge gain for us in trying to prioritize the safety of not just our staff, but also of our participants. I'd have to get back to you exactly on the other part of your question. We haven't actually done that, that assessment, but we do feel that 2 people is a minimum that we should have at our centers, and especially at the sites where some of the violent incidents occurred. There was just 1 person working at those centers when those incidents occurred, and I don't think anybody wants to be in a situation like that by themselves. And as parents, we don't want our children to be in situations where there's only 1 adult at a facility. So that's definitely something that we believe is critical, and that's something that we're prepared to implement moving forward using this additional funds that we've received.
Thank you.
Council President, I have a point of information.
Chair recognizes Councilman Johnson for point of information.
Commissioner Outlaw, can you clarify, and this is on the lines of really clarifying what Councilman Jamie Gardier asked regarding the restoration of funding, the $11 million that was cut, can you just clarify what was actually cut under that $11 million, please, just for the record?
Sure. Going back to this time last year. So we lost the pool season. We reduced seasonal positions significantly, both in for program recreation as well as for operations. We reduced our motorcycles. We got rid of the Dell season. We eliminated our entire workforce development program. So that was well over $1 million. Gosh, there might have been some other things, but that was the bulk of the reductions.
Thank you. Thank you.
Thank you for that clarification, Council Member. I'll just end by saying I'm glad that we're proposing to go up to 2 staff members at many of our centers. I don't think we ever should have had a situation where we had 1 adult at a center. However, I would really love to get your thinking about in neighborhoods like Cobbs Creek, Mantua, West Mill Creek, and I know council members have other areas, if putting 2 adults in the center is really doing what we need to do to serve the community and to provide opportunities for young people to stay away from violence. And I just would love for you to think more about that as it relates to the neighborhoods that are experiencing the highest levels of gun violence right now.
Yes, of course, Council Member. We 2 points of clarification. Number 1, at our larger centers, there are more than 2 people. So I want to be clear about that. So it was just at our smaller centers. You mentioned Mill Creek. West Mill Creek was an example of that, where historically there's only been 1 person at that center. Another example would be Conestoga in your district. But at our larger centers, like King Sessing, et cetera, I'm trying to think of examples in your district, we do have more than 1 person, sometimes as many as 3 or 4 people in those facilities. One thing that was a budget request this year from us was funding towards massive realignment that we're doing about staffing. And Council President Clark mentioned in his initial line of questioning this historic classification of recreation centers, and what our new staffing realignment planning does is to sort of change how we staff our recreation centers. Instead of staffing based on the size of a facility, to staff based on the needs of a community. And so we have spent 10 months coming up with a data-driven approach, looking at everything from crime statistics, equity statistics, poverty statistics, to the size and amenities at our centers, and came up with a staffing model for the first time, I think, in 50 years that truly looks at the community as a whole, as opposed to the size of a center that was built there in the 1960s or 70s. And part of our budget for this year, the $62 million, includes $760,000 to help us to continue to add recreation staff members. So this past year, we added 13 new staff members in 2020 and in fiscal year 2021. And in fiscal year 2022, we plan to add more full-time and part-time staff members to continue to add recreation staff to our centers, but most especially in those communities in need, regardless of the size of the center. The idea is to shift away from staffing facilities size and instead begin staffing neighborhoods.
Thank you so much for that, and thank you for your work. Thanks, Council President.
Thank you, Councilwoman and Commissioner. As you all think through enhancing or increasing the staffing levels, I'd like for you all to give some real thought to these individuals, because we're trying to deal with violence prevention in every meaningful way. And as you said, these rec centers have been sites that have been challenging at times with gun violence. To look at those individuals who have the level of legitimacy, quote unquote, street cred, to play a role at some of these sites. Because they have the ability, to influence people in a very positive way. And I know some people around some of these sites, they will not necessarily fit the criteria established by a Rec 1, Rec 2 leader, 4 years of college or whatever. Then it's not going to meet that goal, no matter how much you hold their hand. But they will meet the goal of being able to bring a level of comfort, particularly from people who are bringing their kids there, because they know that this person has influence. And I'm not necessarily talking about somebody that, is currently in the game or whatever. That's a different role. We got to figure something else for them. But there are a lot of folks out there, and the people that we talk to all on an ongoing basis, they have real influence. So let's give that some thought. And you can talk to members of the council and other individuals about the possibility of doing that. They can play a really significant role, I believe.
You're absolutely right, Council President. Thank you for that. Totally agree.
Thank you. Chair recognizes Councilwoman Brooks.
Thank you, Council President. And I kind of want to shadow what you just said, because I know in my community there are a group of barbers that want to have access to one of the centers on a Sunday where it's not staffed. But that's the only day that barbers are available, so they're scuffling up time for a mentor program for 35 young men aging from 13 to 21. Some of them are college students that come back and feedback, and they can't find a home. And Parks and Recs would be a perfect location for that. But the problem is, access. And access is very difficult. But that's not my question. My questions are I combine my questions for time, for Commissioner Lowell and Deputy Mayor Figueroa. So I'm going to combine this question into one. But both of you guys can answer. Most of the gun violence in the city takes place in public spaces, in our streets, our parks, and on our corners. And much of it is concentrated in a handful of communities. I know that because I live in one of these neighborhoods. Is there an opportunity to provide targeted funding for neighborhoods most impacted by violence? And do you think the current level of funding is adequate to combat gun violence epidemic in the city? And if you were to see an additional influx of funds for violent prevention programs or violent prevention in OST and Parks and Rec, where do you think these would be most effective?
I'm gonna borrow Erica Atwood's quote on the first day, which is, "There's always a need for more resources for our community-based providers who are really doing the work on the ground." I think that there's some opportunity that we want to make sure happens and that we expand this year, which is Play Streets, right? We found that the Play Streets program is the community on the ground, and it changes the environment right within the neighborhood, and in the sense of it's just this completely different, fun dynamic that ensures that there's food and other resources and supports for the kids and families. I think that Councilwoman Gim was getting to this question as well in terms of, do we need more job opportunities? I think we have a good category of resources that are available We started the enrollment really early to find out what more can we do if we max out, like if these slots get filled up. And then we do meet regularly with the Office of Violence Prevention in terms of looking at how do we partner their community investment grants, and are there ways to tie them into the work that we're doing, whether it's through the proposals that we're working on for the curfew centers, or is it through some of the rec center evening activities. So I don't have like a number for you, council member, but I think that you're having us think, how do we think differently, or how do we have been talking about Sunday. So I saw Catherine's face, because we know that evening, Saturday into Sunday morning is an important time. So, happy to talk further about the interface between Erica's work with the targeted community investment grants and then the work that we try to do through the OST providers, because there's also different kids. I think I'm sorry, I'm taking up some of your time. One of the dynamics that we've been talking about is making sure that we're clear of like who we're targeting with different activities, right? Because I think we think about the various issues that are going on, and there's kids that we want to keep engaged. There are kids who might be involved in high risk, and that's maybe a different and specialized activity, and making sure that what we're offering makes sense for like that particular group of kids in that in that particular community. So more to come. We'd be happy to talk to you more about ideas that Eric and I have been floating.
Thank you. That's why I lumped it together, because I figured both of your answers would take up my time.
Thank you. I appreciate it.
Yes. That's a good one, Councilman.
Commissioner, do you have it?
Did you want me to comment as well?
Yes, please.
Okay, thank you. So Cynthia did so well, I was covered. But, I think you hit it spot on, Councilmember. I can't explain why historically our centers haven't been open on Sundays. I think it probably had something to do with church going back in the day, right? But Lord knows that time has passed, and that is a critical day for us to have a presence in those communities. And so part of the staffing realignment also involves having our centers open on Sundays. Not all of them, but some in each district. And we are also making sure that when we hire new employees, that we're letting them know that weekend work is part of that hiring, and that's not something that we've done historically. It's been a Monday through Friday job. So those are two solutions. I think the council president's suggestion that we really engage more mentors in the community, existing community leaders, old heads, if you will, in the community, and get them engaged to also support us on weekends. They're already there on Sundays. They're there anyway, and if we can pay them to support the work that we're doing already, all the better. It doesn't have to be some massively structured programmed activity. It can be a presence, an adult presence in that community, to make a facility available for another organization that wants to come in and do work there. So agree with all of these ideas, and absolutely look forward to implementing them.
Thank you so much.
Thank
Point of information, Mr. President.
Chair recognizes Councilman Jones.
And the only reason I'm doing this is I have to jump off for a minute, and then I'm coming back on for the public comment. But I'd like special dispensation to declare Member Brooks no longer a freshman, because that was the question of the hearing.
All right.
Don't call her a freshman no more.
All right.
Thank you. Thank you, Mr. President.
Well, I'm glad I was a part of that moment then, I've got to say.
Thank you, Councilman. I'm going to leave that one alone. I usually have a comment, but I'm not saying a word. Thank you, Councilman. Chair recognizes, well, that was your Councilman Jones. You got to jump off? Or did you, Councilman Jones? You're out? Okay. Chair recognizes Councilman Thomas.
Thank you, Council President. And first, I have to start by saying thank you to Cynthia and Catherine, two of my favorite people to work with in the city of Philadelphia. I often, come on with monologues to communicate frustration. I think every once in a while, you got to kind of tell folks they're doing a good job. So I commend you both. I appreciate the work you're doing. I think that you guys have put together some great foundational plans as it relates to some of the things that we want to do this summer. I do want to push on some of the things that my colleagues talked about. I think just the idea of, and just listening to dialogue. Let me start here. What are your thoughts on play streets? Is there a way that we can possibly blend the void that we have with high school and college students to possibly expand play streets? Is there any synergy to kind of collaborate that? It's not an idea I had before, but just kind of listening to some of the issues in today's dialogue. Just wanted to know your thoughts on that, and then after that, I had some contract questions.
So, council member, it's a great suggestion. Actually, last summer when we expanded play streets, we received a special position called the SLIP position, which was a federally funded position for, I think it was 18 to 24-year-old youths. And we actually employed them to work at the play street. So they were the play street supervisors, if you will. Unfortunately, that funding is not available this year, but we were really grateful that the PYN funding was increased to include up to 24-year-olds. So we are again recruiting young people up to the age of 24 to help support us on the play streets, and we will definitely be getting information out to your offices so you can help us in that recruitment for those slots as well.
And so
it's a great suggestion, and we'd love to expand that if the resources were available.
So you guys are hiring up to 24 and as low as 12? But
no, not 12.
As low as where is low as 13 for work ready for 13. Catherine? Catherine has a different age category.
Well, 14 for work ready, and 16 for lifeguards, and 18 for the others.
Okay, so I do agree with my colleagues when we talked about staff of parks and recs. I think we should overdo it. I don't think we should do what we feel like is enough. I think we're going to see more people use our spaces and facilities in any time in recent history. And I think not just thinking about the gun violence perspective, but also the coronavirus perspective. Earlier today, we listened to the health department, and that was not the most encouraging as far as our outreach to make sure that people are informed and educated as it relates to the vaccine. So we're going to be going into this summer with a plethora of people congregating in a lot of different spaces, and I think it's important that we not just think about the safety of our staff and the people who use the space from the perspective of a gun violence lens, but also from a coronavirus. So I just want to stand with my colleagues and support even more money to parks and recs and to your department, Cynthia, to get you whatever you need to be able to best service the citizens of Philadelphia. Earlier in our hearing, we listened to the health department say that PHMC, UAC, and a couple other organizations where they're bigger nonprofit contractors. PHMC also contracts with you guys. So I'm wondering, PHMC has the contract. They got the COVID contract last year, which was probably over $50 million. They had the rebuild contract, which is $35 million. And now we have a contract for OST for $2.8 million. So I'm wondering, can we look at the $2.8 million OST contract that already goes to PHMC and possibly look at another provider who can benefit from the opportunity to really scale their organization up? One of the things that we've been trying to push the administration with, and this isn't about parks and recs or children and families, it's just about contracts in general. We've been trying to push the administration to make it a priority to spend local as it relates to Philadelphia, but also to encourage growth as it relates to black and brown businesses. I think the way we provide contracts to nonprofit organizations is a path to be able to go down that we can look at as it relates to helping people grow wealth and equity and deal with some of the poverty issues that we have in the city of Philadelphia. So I'm wondering first, what are your big contracts that you have, right? Like I'm wondering how much money does United Way get? Wondering how much money does Big Brothers Big Sisters get, PHMC and these bigger organizations, and what can we do, again, like I said earlier, to put ourselves in a position where we're giving dollars to smaller nonprofit organizations that are, I get it, the boots on the ground, address the gun violence, that's one side of it, but another side of it is we have organizations in the city of Philadelphia that's been considered grassroots for a decade, and we know that they're extremely effective in the work that they're doing. So I'm wondering, how can we come together and possibly look at what we can do to redistribute the contracts that go into the nonprofit sector? And again, this is the same challenge I gave DBHIS and the health department earlier. So I'm not just looking at you, Cynthia. Well, I guess Cynthia would be your whole umbrella because I'm talking about DHS, I'm talking about OST and things of that capacity. So I'm just wondering, and I know Cynthia might not be you, but somebody from the administration, I'm wondering their thoughts on this because, again, not only should we be attacking this from the equity perspective that the administration said is a priority, we also passed a procurement bill last year that required the administration to create goals for local businesses to be able to contract with the city, as well as other priorities. So I know that said a lot, but I'm wondering if someone in the administration could provide some feedback on that.
I mean, I'm happy to start. I think you bring up an excellent point that we have these really, really big projects and that we tend to end up, I think, falling and expecting the same providers to do the same level of work. And so we use some similar groups for our intermediary. I know that for the work that you mentioned related to OST, we're not, we're going into the summer, but we're looking to revisit that RFP. The other thing that the summer's providing us, and I just want to highlight, thank you, because I think you do a great job of bringing key areas of frustration, and then we try to problem solve around them. So for the summer, these additional providers that we're trying to bring into the school district building, we're trying to figure out how do we create an opportunity for these grassroots or these other programs that haven't historically been in the mix. So we appreciate your work on that, and we are trying to bring some of those providers in and trying to make sure that they could then stay as part of our process. Another conversation we've been having, because the RFP process itself, and we've had, we did a great session that you hosted, which is that the procurement process is really complicated for some of the smaller or more grassroots organization. And we've been trying to figure out, like, how do they make sure that they know the resources available that are through the Free Libraries Resource Center and an intermediary contract with UAC, so maybe they don't do all the back end work. And I'm going to throw this out there because maybe council can think of a really creative way to do this. I would love for there to be a way to have like an innovation fund, right? So that if there is a provider that you want to support, that the complexity of the procurement process, that we're still able to meet it, but we have flexibility, because our procurement process sometimes doesn't allow us to like change on the dime in the way that we need to when we're either in COVID or the gun violence that we're experiencing. So I know I'm not doing a great job of answering your specific question, Councilmember Thomas, but we're committed to helping figure this out, and how do we get other organizations into the mix and make sure that we're regular in our RFP process.
Cynthia, I and Council President, I'm going to wrap up with this. Cynthia, I do agree with you. I think you and your department and your team has done a good job to try to address this issue, but the issue but this issue is much deeper than just simply your department. I think as an administration, I'm trying to really push, and not just me, I've heard other colleagues say this, I'm really trying to push the administration to rethink all contracts, especially the big ones. We want to be able to give some of these mid-sized organizations an opportunity to mature, and then we want to give some of the grassroots organizations an opportunity to become a mid-size. And I think we have a chance to, I'm 100% sure we have a chance to do that with this budget, but the direction we're moving in right now does not suggest that. So I'm going to continue to push this every single day for every single department on the administration side to be able to ask who the top contractors are and what can we do to rethink and reimagine how people contract with the city so we can spark the local economy and we can help those who are most disadvantaged. So thank you, Cynthia. Thank you, Catherine. Thank you, Council President. And I will be back for a third round if there is time to address some of the issues. If there's not time, I will submit my questions in writing. I'm fine with that as well, Council President. Thank you.
Yeah, thank you, Councilman. I've been informed by council support and tech that it will take a minimum of 30 minutes for them to queue up for the public testimony. So that's adding another 30 minutes to the time that we can get them on. So
I'll submit in writing. Thank you, Council President.
Thank you, Councilman. Chair recognizes Councilwoman Gim.
Thank you very much, Council President. Cynthia, I just wanted to go back and clarify some of our discussion from last time. So OST slots are, what we heard from our discussions in the Children and Youth Committee with young people over and over again is that teenagers need and lack safe spaces for themselves. That was one of the overwhelming things that we heard from young people right now. So for OST only, what was the number? The number in 2019 was 8,000, and the number in 2021 is 8,000, correct?
The number in 2019, is that what you said, the first one?
Yes.
I believe that was the target, yes. I don't have the exact number, but the target for this year is also 8,000, and last year we reached 6,000.
Right, but in 2019, what was it?
I'm saying I'm 95% sure that the target was somewhere between 7,500 and 8,000.
Okay. And none of these
to make sure we secure coverage of the academic sites and the non-academic sites. And I think the idea, and Councilwoman, I apologize, I don't have this, but the other 29 providers that are going to be, or 29 sites that'll be operating through the school district, I don't have the catalog of those offerings yet. So what I would like to do is get sort of an overview of all that's available for 13 plus year olds, because then I feel like I'm not giving you a fair representation of everything that's going to be available.
Right, but even so, would you part of what we're asking for and what we're hearing from young people is just a crushing amount of need and a lack of access. So would you be willing to work to expand the OST spots, at least can you say in zip codes and schools with the highest rates of gun violence?
I can't commit to that because I don't have the financial capacity to do that. So that, I mean, we're obviously in a budget hearing, so that's part of the conversation. And until I think we have the enrollment process going through, I think it's hard to say what the need would be. And then also just making sure in the conversations we've had with the conversations I've had with the older youth that we've set down want to make sure the Parks and Rec sites are available. They want to be able to drop in and hang out places. They want to feel safe where they're going, and they want jobs. So those are like the two tracks that we've been trying to work on for the older youth based on the conversations I've had with kids.
I think what we need to hear is what other opportunities that youth have to be safe in neighborhoods, and especially if they're in communities that are deeply impacted by gun violence. And I think what's clear is that we are limited in our programming right now. Young people,
I mean, one of the other positives that I mentioned earlier, right. I'm sorry, was the Police Athletic League, which is going to expand.
But that's 1,000 spots K-12 across the city, right?
Yeah, but they mostly target older youth, even though they have, they can go to the smalls. They're looking at, and we're also looking to expand the amount of work that they do at district sites. So I'm in agreement with you. I'm totally not arguing. I'm just saying this is what we know as right now, and we're still building out the entire portfolio this summer.
So as you're building out, I think what we are trying to say over and over again, that we need a targeted guarantee in two areas. There are 25 schools, all of them high schools, that serve 50% of the kids who have experienced gun violence since 2020 are in those schools. So we should be hitting those. And in the top zip codes that are experiencing gun violence, we want to know whether there can be a guarantee. And look, that can be an expansion of OST. It can be new programming that gets developed. But to some extent, what I think we are hearing from young people directly is that they need there to be a guarantee. Work Ready isn't going to capture all of it. PAL isn't going to capture all of it. We're looking at location because this is an anti-gun violence strategy. We want a youth-centered anti-gun violence strategy. And thus, in the neighborhoods where youth are experiencing the most amount of gun violence, or in the school communities in which they're experiencing a tremendous amount of gun violence, we want some guarantees for them. Can you work with us on that?
Absolutely. I mean, the in-person programming with everything that's going to be available is in the upwards of 30,000. I mean, last year we only had a very, very small number. So we're 100% committed. I also think it's a lot of coordination, because I believe I heard you say earlier that in a large number of the schools where the shootings have occurred are actually charter schools. And so that's like coordination with them in terms of like what are they offering, because they are running summer programs. So we've committed to doing the coordination. I'm certainly committed to trying to have as much available as possible. So we're at 100% open to the conversation.
And I think, part of the thing is that we spend a lot of time on capacity-based questions, like what are you doing? What are we doing? What can we do? Where's the money? All this, rather than focusing on need. And I think what you'll see is that as soon as you come into a school and say, there's a guaranteed summer program for everybody who signs up by, whatever date, contact this person and you're guaranteed a program. You're guaranteed something that will either put you into, a safe space. But that's what we're lacking. And that's why sometimes you see so much turnoff, because young people apply. We know this from 2019. If they applied, half of them were rejected. And so that turns people off from opportunities, and that's just even a worse thing, right? So I'm looking for a guarantee, and what I'd like to do is go back to the communities that are most impacted by gun violence, to the schools that have been devastated by it, to the kids who have known young people who've been shot or hurt, or to those young people themselves, and say, we are making you a promise. Because that's what we need to tell these young people. We need to make you a promise, and this is what is offered to you. Now, that is a needs-based question and not a capacity. So can we do that and then figure out who responds, and then we figure out the programs? Charters may provide some. We have to fill in the rest. Parks and Rec could do some, at this point. But we need to expand our opportunities, and if that's a budget expansion, I'm pretty sure this council is going to say, gun violence is our number one issue. We are going to make this promise to these communities, and we're going to deliver for them. And the cost is going to be the cost, because the cost on the other end is absolutely unbearable.
So I think the excellent point that you all made in the earlier part of this morning that crosses over today is that it's really about an integrated approach, right? So it's not about one office and their particular resources, but how I think what you said it beautifully is our commitment to the kids in those neighborhoods, instead of these piecemeal, is what's the integrated approach to all the resources that we're putting in for the summer, which we know is an important time for these kids. So.
Yeah. And as head of Office of Children and Families, the concept behind the creation of the office is that you're looking at the world through a young person's eyes. You have the ability to convene all these different groups together, when normally what we do is we just piecemeal kids out, and they've got to scramble, and families have to scramble, pick and choose from Parks and Rec, look at what's available at the libraries. Hopefully my school district can offer this. But the Office of Children, Youth, and Families, in the midst of this gun violence crisis, let's go back to those communities and tell them, you've got a promise. Sign up here and we'll find something for you. If we can do that, I think that will be a huge win for the city, and will show our commitment.
Gotcha.
Thank you very much, Council President.
Thank you, Council Member.
Thank you, Councilwoman. Councilwoman Bass?
Good afternoon again.
Good afternoon again.
So I have some Parks and Recreation questions.
Okay.
So a question for you, Catherine. Park usage, as you know, as everyone knows, has been significantly higher as a result of the pandemic. And, so people expect to be able to use their parks, their recreation facilities, these amenities, public amenities, taxpayer-paid amenities on a regular basis. So it was bad enough that we had to close them through COVID. But recently I had a facility in my district that was closed, and I want to know, what's the process for informing the community when a center is closed? What is the formal process?
Sure. So when not COVID, not during COVID times, because the centers have gone back and forth in various states of opening and different hours through the past 12 months. But pre-COVID, if we have to close a center, for example, we had to close. We've had to close several centers, but Vare Recreation Center.
Well, let's say, for example, Waterview.
Sure. So in a normal situation, so Waterview had been closed because of COVID, like other centers. We had moved most of our staff to access centers, so that staff had been deployed to an access center. So Waterview is going to be reopening to the public soon, but as you know, we had a roof leak and a water issue there, so it hadn't been reopened at the same timetable that some of our other centers had opened. We have about 118 centers open now out of about 159. So some of our centers have not all of our centers have reopened for public hours.
So my question was, what is the public process for informing the community when a center is closed?
Sure. So it depends on why the center is closed. So it's for the Waterview example, it was just just signage on the facility that the facility wasn't open as of right now, and then we'll be promoting that the facility is open as soon as it is reopened for public programs.
And I would just say, council member, just given I know your interest or your connection, not interest, your leadership on this, is that we're very open to working with you to think about if there's a specific way in which we should be doing this really for all district council members, and particularly if we certainly don't want people to be caught off guard if there's not only signage, if there are particular groups that's consistent that we should make sure that we work with, because the last thing we want is to make sure that the community thinks it's available as we're reopening, and how do we do that in a way that folks know and are informed.
Well, I think that the more we can communicate with the community, the better it is, always. And so if something is going to be happening, I think, I don't know if you all have an apparatus to get information out to say that this rec center is going to be closed. Do you have robocalls or email addresses, or through the advisory councils? Are any of those networks used when a center is going to be closed to inform folks what's going on?
Yes, all of those networks are used. So certainly the advisory council, we reach out to the advisory council and to existing users to let them know and that the center is closed, and hopefully when it will be reopening.
Were they used with Waterview?
I'd have to look back and see, because again, with the COVID situation, things have been not our usual process. So I'd have to look back and see what the communication was with the Waterview Advisory Council.
I can answer it for you. No, they weren't informed. There was no information to the community at all. And Catherine, when you and I spoke about it, when I asked you about at least letting me know so that I can inform the community, get it out on social media. I know you said that you had 150 some facilities and really just didn't have the time to inform council members. But as the representative for this area, people hold me accountable, and they should hold you accountable as well. When a rec center is not open, people need to be informed. They need to know this is a public amenity paid for with taxpayer dollars, and they certainly deserve to have the information made available to them about what's happening in their neighborhood, why it's closed, when it's opening, all of the kind of things that we would do maybe in some other neighborhoods. But for this neighborhood in Germantown, it really wasn't done. And it's totally unacceptable that at least the advisory council wasn't informed. There was no outreach whatsoever. And what happened was someone went to the building, pulled at the door, and that's when they realized that it wasn't open as it was supposed to be.
I'm very sorry about that. You're absolutely right, council member, and we will make sure that we do a much better job of that in the future, no question.
Okay. Question for you about stages. So now, in the past, it was my understanding that did Parks and Rec have stages that they lent out for community events, for community functions?
No, we don't have stages. Public property had stages that even we would request for for public events, but we don't have stages.
So that's all. Has that always been through public property, or is that something that was through Parks and Recreation at one point?
Yeah, we've never had stages. The only thing we have is the showmobile.
Okay, I'm sorry. You know what? That's what I'm referring to.
Okay. Yeah, it's the showmobile. We have the showmobile.
Okay, and so what's the process for making the showmobile available to community groups, to organizations that are having events, so that we can be on the record and make sure that people, know and understand what the process is, and that I, as a member of council, make sure that I'm absolutely clear.
Sure, it's the same as going through for a special event. So you can reach out to the Parks and Rec Special Events Office and request the showmobile. You just give them the date and the hours, and then the showmobile, we provide that for events on Parks and Recreation property, right? So if you want to have like the showmobile at your local rec center or your park for an event that you're having, then you can put that request in just like you would a permit.
Okay. Now, Mr. President, I know the bell is rung. Can I go? I just have a couple more questions. I'll make them brief. No. You're on mute, Mr. President. You're on mute. I can't hear you.
He's going to say you're going to, like Kendra, can you hold them all together?
Of course.
Thank you. So I'll move along quickly to be respectful. So let me ask you another question, and Cynthia, maybe you can answer this too. The Philadelphia Activity Fund, I know that Catherine, you were a former board member of that activity fund, and we've certainly had spirited conversations about your action and activity as related to the activity fund. You're no longer on the board. Is there a reason why?
No, there's no reason why. It's really just for me, we have a role as an administrator of the fund, so I think it's somewhat of a conflict to administer the fund and also serve on the board. So that was my main thinking around resigning from the board.
So part of our work council, I'm sorry, I didn't want to interrupt.
No, that's okay. I was just going to say that all of us are associated in some way with the fund, with giving out funds as members of council, that, we're all associated with the Philadelphia Activities Fund and work hard to make sure that there aren't conflicts of interest. So, I know that you didn't have a particular, or you had a particular disdain for the fund, it seemed. And again, these are taxpayer dollars that are coming back into the community. And so, I just want to make that point that, as members of council, we don't have RACP funds or, large amounts that we can give out through DCED or through, like the state and other elected officials can do. The only funds and support we can really give are primarily through the Philadelphia Activity Fund. And so I think it does a disservice if any one of us feels that the fund is not important, if it's not resourced properly, if it's not all hands on deck in terms of board members and board participation and support of the fund, again, because this is funded through taxpayer dollars, like everything else that we do that pays your salary, that pays my salary. All of our salaries are through the taxpayers of the city of Philadelphia. And I think we owe them the respect that when we say that we're going to be a part of something as important as a give back through the Philadelphia Activity Fund, that we actually do that.
And Councilmember, if I can, just to interject in terms of, because I got involved sort of on the tail end, and we know that there were a lot of lawyers involved because there's the transition around setting it up as an independent entity. And that because it's specific that Parks and Rec is the administrator of the funds, it was the intent of the administration that since Catherine oversees that money. So I don't think it was, and I apologize if it came off as anything related.
Well, it did because actually we were in board meetings in which she said, I can't wait to get off this board. In which, like well, you can say no, I can say yes, because I was there. And there were about 10 other board members who were there as well. And so, I'm not going to call out names in terms of who else was in the room. But and Catherine was very clear that she did not want to be on the board because we asked about minority participation regarding the attorney who was working to sort things out. The board hadn't, it's public knowledge, the board hadn't met in quite some time. and we were trying to organize, and I asked about participation in terms of African American support among the attorneys that we were using, and there was none, or it was limited, as I recall. And Catherine took exception with that and felt that she no longer wanted to be on the board as a result of that very spirited conversation. So I just want to be clear about that. One other question, Albury Park in Germantown. I was contacted yesterday regarding a 5,000 square foot building that was requested to be put on the park, similar to Council President Clark's situation with like a bird watching sanctuary or arboretum or something of that sort, that was requested by a small group, not the larger community, and not put where they live at, the smaller group, but put sort of like in the middle of Albury Park in a field that's currently used for multiple uses by the overwhelmingly African American community in Germantown. And so I wanted to know if you were aware of that and if you are in support of it, just to be on record.
I'm not aware of that, but it sounds wonderful. So I think I would be in support of it. I'm anxious to learn more.
Okay, I think the overall support of the community is what's important. And so I think that before we make any proclamations that, there needs to be a conversation with the neighbors in terms of what they want on a field that they use. I know it sounds great, sounds like probably a fantastic idea, but you have to take into account that there's currently people who live in that area who use that park and what the uses are. And then my very last question is, I did want to say for the record that I had some concerns regarding a facility in Tioga that you and I visited, in which you told the residents of the advisory board, the community, that it was a palace. They felt that it was very much, they felt otherwise very much so. And so I just wanted to bring that concern to your attention, because it's still something that lingers out there in the community, that people still have concerns about your comments stating that that rec center was a palace. And for anyone who knows this rec center, which is Jerome Brown in Tioga, it is, listen, I don't want to say what my initial thought is when it comes to what the condition of the facility is, but I would say that it's probably one of the worst within the system. And to tell the people in that neighborhood that that rec center was a palace, as if they should be grateful for it, was very offensive. And I think that the neighbors also mentioned that to you as well. So that being said, I think
I do want to respond to that and just say that is taken out of context, that conversation.
Please explain then.
I want to go on record saying that I'm excited that Jerome Brown will be rebuilt through the Rebuild Initiative. I just do want to say that those comments are being taken out of context, and we had a very frank conversation following that meeting, and I appreciate all of your comments thus far. I'm taking them into great consideration, and I really look forward to Jerome Brown being rebuilt through Rebuild, because that community absolutely deserves a wonderful new center.
I could not agree with you more on that point. I think that the community certainly deserves to have a new facility. It hasn't had one in a very long time. But if something I said was taken out of context, and I do believe that the responsibility is on you to please explain the context in which it was stated. This is on the record, and we want to be absolutely clear.
Well, and it sounds like the commissioner did, or as I understood it, to.
Well, she said it was taken out of context, and I'd like to know in what way.
Sure, and our rec leader, Brian Payton, was also their council member,
yes.
and I'd be happy to have Brian Payton also explain how he felt that the comment was taken out of context, because we've had some frank discussions on that. What I said was, and again, it was over 2 years ago now, so it was a while ago, but it was a conversation with an amazing advisory council, really advocating for resources to come there. And I totally agree that resources are needed throughout our system, and certainly at Jerome Brown as well, and made an off-the-cuff comment that, some people might think this is a palace compared to some other centers. by no means meant that it was a palace. It was a wrong, choice of language, and I said it off the cuff, at a meeting, and I apologize for it, but was taken out of context, and that I did not mean to say that Jerome Brown looks like a palace. No, I totally agree with you. Nobody could go into Jerome Brown and think that it looked like a palace. My point was saying that we have other facilities in our system, sadly, that are in bad shape and some worse shape than Jerome Brown. So again, I apologize that I said that, and I apologize to you then. I'm apologizing to you now. I apologize to that community, and I had very frank conversations with Brian, our great rec leader there afterwards. I had very good conversations with the community after that meeting, and really am excited about moving forward with the new rec center at Jerome Brown, and with your great support and leadership to build that new facility.
Well, thank you. I appreciate that. My laptop just died, so I missed part of what you said. But I just wanted to state for the record that, to say that this was taken out of context, nothing could be further from the truth. And I just recalled the conversation that came from the community afterwards. And I believe it was, actually, I'm not going to say his name because I haven't asked him for permission to say his name beforehand. But after you made the statement that that was a palace, one of the residents from the advisory council said, you think that we blank should take anything in our community. You think it's okay to give us anything if you call this a palace. And so it wasn't taken out of context. It was taken exactly as it was stated. So I just wanted to be on the record and be absolutely clear about that. So thank you, Mr. President.
Thank you, Councilwoman. I'm not sure. Councilman Johnson had a point of order, and I'm not sure if that was his.
No, I didn't have a point of order. I was waiting for my line.
Okay.
I'm still here, just waiting for my line of question, but I didn't have a point of order.
Go ahead.
Oh, well, Commissioner Catherine, just a couple questions regarding gun violence and our strategy around keeping our young people safe. I have had the opportunity to meet with your team members regarding partnering with captains from various police districts and park and recreation to look at making sure that there's coverage on high time crime, doing high time activity where we think violence may take place. And so I just want to get an idea of what's going to be the strategy coming forward during this upcoming summer. I am in the same mind frame of Councilman Isaiah Thomas as well as Councilwoman Gammy Gardier to make sure that we're providing a significant amount of funding to go through Parks and Rec as a way of strategizing and working in partnership with the Department of Human Services around just supporting our young people, giving them the opportunity to get involved in something that's positive. So just want to get an idea about the strategy on how we're going to address gun violence and making sure it's intertwined with Parks and Rec. And then also, what is the program going to look like? And then also just want to give a public acknowledgement, because even as we address the issue of gun violence, I'm still moving forward and all of my parks and recreational facilities projects moving forward. And so shout out to I call him the great Frank Faby. I want to thank Parna. I want to thank Francesco. I want to thank Chris and your team, but just still through the pandemic, making sure that we move projects forward in the second councilmatic district, as well as what we're doing down at FDR Park, which we'll be hosting the flower show. And so we look forward to the improvements that we're going to do down there as well. And so I just want to put that out there and just get some feedback from you on how we're going about it. And then last, are you meeting with the Office of Violence Prevention on a weekly basis, talking about the strategies that they're doing with the roadmap to the Safe Philadelphia and how Parks and Rec play a role in keeping our young people off the streets but involved in something that's positive?
Thank you, Councilmember. You got a lot in there on that question.
Yes, I did.
Let me try to take it from the top because I took some notes. In terms of violence prevention at Rec Center specifically, we're working really closely with the Philadelphia Police Department. We've had many conversations with them on a weekly basis about making sure that not just that our facilities are safe, but that people feel safe sending their children back to the facilities, which is just so important, and especially after we've had a stretch that we had this past spring with some violent incidents happening at our centers, some of which in your district. We want to make sure that, that participants feel safe, that staff feel safe, and that families feel safe sending their kids back to our facilities. So we've been really grateful to the police for providing this additional support, making sure that officers are getting in to sign those logbooks at our facilities every single day, having meetings with our recreation leaders to talk about, issues that they're seeing in the community, and then being a presence there. So Friday through Sunday, Monday nights actually, police have authorized overtime at 40 of our centers with the highest rates of violence to have a presence there. And so there's an officer there at the centers on those evenings, and they've offered to continue that support, especially through the summer with pool season. We will again have police available at all of our pools this summer, and that support has always been given, and we're very grateful for that. So having that presence from police, I think, is really important. But you bring up a great point in working with the Office of Violence Prevention, because we formed also a really great partnership with them. We talk to them, on a weekly basis about programs and projects and activities.
Do you talk with them, or do you meet with them? Because they have like a little strategy team that meets weekly.
we have representatives at that meeting, and then we're also talking to Erica and her team very frequently, both with Cynthia and her team and myself. And it's really about not just what programming we can provide, because of course our rec leaders are providing programming, but also making sure that our facilities are accessible to these community organizations to make sure they know that they can run their programs in our facilities. We want them, we welcome them, we will make that space and that time available to them. And that's really, really important. It goes back to what Councilmember Brooks said as well about making sure that our facilities are open and accessible for those organizations. So we just want to make sure that people know that we want those facilities to be hubs of that activity and to be seen as safe spaces, but also to proactively work to provide those programs for those communities.
In terms of moving our projects forward as district council individuals, and I know we usually get a capital budget every year that helps us upgrade our recreational facilities and our playgrounds, because we want to make sure that every neighborhood, regardless of the zip code, has a world-class recreation center and playground, especially like in the 4th councilmanic district, which I always strive to be like. Give us an idea from the cuts and hopefully the restoration of funding from a capital funding standpoint, how that will contribute towards us continuously using those funds to upgrade our parks and our recreational facilities in our councilmanic districts, because I think we received less than $1 million this year. And so I don't know that on a deeper dive level, the separation between capital funding and operational funding as relates to the parks and recreation.
Yeah, so we definitely received a restoration in our capital budget as well, which we're very grateful for. So not only the mid-year transfer this year around the fire alarms, which was so important for us to be able to get that funding to replace and bring up to grade all of the fire alarms in our facilities, but also, for other projects that we're doing, both ITEF projects and then independent capital projects in the various council districts. We've received some really necessary funding for that we're very grateful for. And that's, of course, in addition to the rebuild funds that are funding about 60 of projects as well in our system.
Okay. All right. Thank you very much, Catherine.
Thank you, council member.
Thank you, Councilman. I think that's it for these witnesses. We will be.
Mr. Prez, I had a comment, sir. I just had a brief comment.
Sure, Councilman Jones.
I just want to thank you and your team for, and a lot of people, this isn't on the front page of your reports, but during the pandemic, it was the rec department that was called upon to provide locations and safe spaces for kids to be fed. It was during the pandemic that the rec department was told to take down every basketball hoop in the city of Philadelphia's public playground, and then told to put them all back up. It was the rec department that had to open up play streets, safe play streets, to entertain our kids during the hot summer months of COVID. It was the rec department that when we had uprisings, their staff was called upon to put up barricades and to augment public property during those tough times in Philadelphia history. So whether it's a pandemic, whether it was uprisings, and did I mention one of the most contested elections in this country's history? It was the rec department's staff that was asked to step up to the plate and augment every department. It was like you were ravaged during that time. And you are asked to keep up and maintain all of these rec centers. And at the end of the day, you don't have a capital improvement budget, do you? You may answer.
It's limited, Councilman, but we do have a capital budget, but you're right, it is certainly not the extent that we or so many other city departments need.
So if we are truly asking you to do more with less, how about doing more with more instead as an alternative? And so I give you my share of hard times. We've gone back and forth, and you don't take tea for the fever either. However, at the end of the day, I truly believe that you care about these kids, and that you would do whatever it took to make sure that they have play spaces. And Deputy Mayor Figueroa already knows how I feel about her. We go back, but I just want to thank you publicly for what during these tough times, being a captain that was seaworthy to withstand a storm. So, we mess with you a lot, but we appreciate what you give to the city of Philadelphia. And I wanted to say that, Mr. President, thank you.
Thank you, Councilman. Okay, with that, I want to thank you all for your testimony today and your response to our questions. I've already gotten 2 inquiries via text from members to have you all back. So please be prepared to come back on one of the callbacks where we will notify you. Again, thank you. To colleagues, the text report says they need around 30 minutes to tee up the individuals for public testimony. So we're gonna come back in like 30 minutes as we get those people back and prepared to testify for public testimony today. All right, thank you all. We'll see you in about 30.